Good morning, everyone. I declare open this hearing of the Senate Community Affairs References Committee's inquiry into the impact of microplastics and other toxics on human health. I begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. The committee will be conducting today's hearing via video conference and in person. I'm Senator Allman-Payne, and in the room I have with me Senators Anand Raja, Askew and Ruston, and I believe Senator Cox is online. These are public proceedings being video streamed live via the Parliament's website, and a Hansard transcript is being made. I remind all witnesses that in giving evidence to the committee, they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to a committee, and such action may be treated by the Senate as a contempt. It is also a contempt to give false or misleading evidence. Witnesses also have a right to request to be heard in camera. If a witness objects to answering a question, they should state the ground upon which the objection is made, and the committee will determine whether it will insist on an answer having regard to the ground which is claimed. If the committee determines to insist on an answer, a witness may request that the answer be given in camera. I remind all senators of their obligations under the Behaviour Code for Australian parliamentarians to treat witnesses with dignity, courtesy, fairness and respect. And I remind committee members and witnesses who are appearing via video conference and who are not speaking, it is very helpful for you to mute your microphones. I now welcome representatives from the Australian Medical Association and the National Rural Health Alliance. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, if you could please state your full names and the capacity in which you're appearing today, and I'm going to start on my left.
Okay, it's Associate Professor Julie Raitt. I'm the Vice President of the Australian Medical Association.
Susie Tegan, Chief Executive of the National Rural Health Alliance, and I also have online Gigi O'Sullivan, my colleague from the National Rural Health Alliance.
Great, thanks very much. I might go to Gigi.
Can't hear you, Gigi.
Hello, good morning, everyone. I'm from the Gigi O'Sullivan from the National Rural Health Alliance, Policy Officer.
Thank you very much. I'm now going to invite each of your organisation to make some short opening remarks, and then I'm going to go to the senators for questions. So I'll start with you, Mr. Raitt.
Thank you.
Associate Professor Raitt.
Thank you. First, good morning, Senators, and I'd like to thank you all for inviting the AMA to be here today. Obviously, the AMA recognises the growing concern in the community and amongst our members and the wider Australian public regarding potential health implications of microplastics, PFAS and other persistent environmental contaminants. These substances could represent an emerging public health issue because they are widespread, persistent and increasingly detected across food, water, air and human tissues. Yet our understanding of their long-term health effects remains incomplete. We were also involved in discussions with the New South Wales health leadership during the Blue Mountains catchment PFAS issue, an experience that underscores why clear surveillance, communication and precautionary management matter, even when the evidence base is still developing. We know microplastics and PFAS are highly persistent, that exposure is largely involuntary, and once released into the environment, they are difficult, if not impossible, to fully remediate. Microplastics are now best understood as ubiquitous environmental particles with plausible biological effects. The AMA wishes to emphasise that uncertainty does not equal safety. Many chronic diseases have long latency periods and complex causal pathways. Waiting for definitive causal proof before acting on the risks is not good preventative health. With the current paucity of data, the AMA's position is to prevent exposure and contamination where practical. Based on the current evidence, there has been emerging associations presented between microplastics and PFAS exposure and adverse reproductive, developmental, cardiovascular, endocrine, immune and chronic health outcomes. However, these associations remain insufficient to establish causality with certainty or to quantify population-level action with confidence. Nevertheless, The convergence of exposure ubiquity, biological plausibility and early harm signals supports a precautionary harm reduction approach. The AMA is particularly concerned about potential impacts across sensitive life stages, including pregnancy, early childhood and the first 1,000 days of life. While human evidence remains limited, emerging international research raises credible concerns regarding reproductive health, early development and neurocognitive outcomes. Given the persistence of these substances and the vulnerability of developing systems, prevention is especially important. Currently, there are no universally accepted clinical thresholds for microplastic exposure. Routine clinical testing is not standard practice nor clearly actionable. But PFAS biomonitoring is more established in specific exposure contexts such as occupational or contaminated communities. But the clinical interpretation remains complex and continues to evolve. For this reason, the AMA cautions against an over-reliance on individual clinical detection as the primary response to these exposures. Instead, the AMA supports a systems-based public health approach focused on prevention, namely reducing environmental release, strengthening regulation and standards, investing in longitudinal research and biomonitoring, and aligning Australian policy with international best practice. Clear and balanced communication is also essential to support clinicians and the public without causing unnecessary alarm. And in closing, the AMA believes a precautionary evidence-building approach is both reasonable and necessary, acting now to reduce avoidable exposure while strengthening the evidence base will better protect population health and support sound clinical and policy decision-making into the future. Thank you.
Thank you, Associate Professor Raitt. I'm now going to go to the Rural Health Alliance. Am I going to you, Ms Teagan?
Yes, you are. Thank you very much, Senators and members of the committee. Thank you for the opportunity to appear before you today. The Alliance is the peak body representing 56 member organisations working to improve the health outcomes for rural, remote and regional people. They make up about 30% of the population and more than 7.4 million people. Our membership includes healthcare, disability and ageing professionals, service providers, health and medical educators and trainers, as well as researchers and students, and very importantly, Aboriginal and Torres Strait Islander health practitioners and training organisations. Our vision is for healthy and sustainable rural communities, but even more so that there is equity and parity between rural and remote and urban centres. We welcome this inquiry and commend the Senate for examining this emerging and complex issue of microplastics, toxins and forever chemicals. They're in our firefighting materials that our volunteers utilise. They're in shampoo, sunscreen. They're in our grease-resistant pizza boxes. They're in everything that we use, and we often don't realise purely because we are so used to them since the 1950s. Rural Australia is the productive powerhouse of our nation. That is why Australia does so economically and socially well. It relies on rural Australia for our national prosperity, and while microplastics and other toxins affect all Australians, I wish to emphasise from the outset that Australians living in rural, remote and regional Australia continue to experience access barriers to healthcare, disability and ageing, delayed care, increased hospitalisation, indeed 12 to 16 years earlier death than those people living in the cities, due to inflexibility in policy, chronic underfunding, fragmented service delivery, and in addition to that, the research dollar doesn't tend to go there. Amazing. These all contribute to poorer health outcomes, resulting in higher levels of mortality, as I mentioned, and morbidity compared to people living in the city. In the context of this inquiry, Australians living outside of metropolitan areas are more likely to be exposed to environmental contaminants through water, supplies, food system, workplace, air, natural environments and proximity to contamination of land. Don't forget our income comes from the minerals, resources sector, from agriculture and all the other areas that bring in our economic benefits. Rural communities frequently rely on local water resources, including rivers, bores, rainwater, which may be more susceptible to contamination of less frequently monitored sources. Many work in industries that have higher exposure of risk. Indeed, many rural industries such as agriculture, mining, waste management and manufacturing involve higher occupational exposure to chemicals and plastics. And you just have to look at history of lead and also asbestos to know how some of these industries have higher risks. I fear that when emerging hazards such as microplastics are poorly understood or inadequately monitored, or if there are long delays in identifying and responding to these environmental health threats, these would exacerbate health issues and disease risk factors experienced by the people who live in rural and remote Australia. There is growing concern about the potential impacts of microplastics, and my colleague to my right has mentioned many of those, including disruption and long-term chronic disease risk, endocrine issues, inflammatory responses, affecting children and also those people that are pregnant, indeed the ageing population. But while the science is still evolving, research has shown that awareness of pervasive microplastic pollution contributes to stress and anxiety amongst all the other things that rural, remote and regional Australia already experiences beyond what people experience in urban centres. We need to act urgently for populations already experience this advantage. Firstly, water security and safety. Rural Australians deserve the same assurance of safe drinking water as those in the city. We are a Western country. Rural Australia is not a third world country, including clear standards for emerging contaminants. Secondly, health workforce capacity. There is already a chronic shortage of health services of all kinds. Healthcare providers are already thin on the ground, stretched and stressed. Rural clinicians will need additional support to be able to recognise and respond to environmental exposure, but should not be responsible for this, for the implementation. Thirdly, rural communities themselves. There needs to be a recognition that many rural and remote communities and areas are in need of context for environmental health. They must be meaningfully involved, and this includes Indigenous populations in decision-making where transparent communications about risk, uncertainties and protections. What they require is policy that recognises rural realities rather than imposing metropolitan assumptions or being at the end of the value chain of large corporates, not making the changes that they have capacity to make. The Alliance strongly supports a national coordinated evidence-based response. We urge the committee to consider recommendations that embed rural and remote equity into environmental and public health regulation, strengthen national monitoring and research with specific attention to rural exposure, improve intergovernmental coordination across health, environment, agriculture and water portfolios with the states and territories, and ensure that rural communities are not left to manage emerging environmental risks alone when the government has the tools to make the difference and corporates also have the capacity. In closing, the National Rural Health Alliance urges the committee to ensure that its recommendations explicitly address rural and remote environmental health, and it must be recognised as a core determinant of health, not a peripheral concern that is acted on reactively once there are major issues. Equity demands that those facing the greatest exposure and the least protection or ability to act are placed at the centre of the response. Thank you for the opportunity to contribute to this important inquiry. The National Rural Health Alliance looks forward to supporting the committee's work and to advancing practical solutions that protect the health of all Australians. This is action that is not politically leaning. It should be addressed by all sides of politics. I welcome your questions. Thank you.
Thanks, Ms Teagan. And just before we go to questions, I will note now that we also have Senator Antic joining us online. I'm going to go to the Coalition first. So, Senator Ruston.
Yeah, thank you very much. It seems to be a reasonably common theme that we're seeing through all of the submissions we've received and the witnesses that we've been speaking to, that there is definitely a view that there is a concern here about the impact of these plastics and toxins in the system and the impact it's having on human health. But there also seems to be I suppose a lack of definitiveness around a lot of the elements around the evidence that would lead to being able to put in place strong clinical responses, environmental responses and industrial responses. So I suppose I'm keen to understand from either of you, you said, Professor Wright, that you think a precautionary harm approach is probably the right way to go here. I'm keen to understand what you think that looks like in terms of the risk profile that the evidence that is available to date is showing, and making sure that we don't create an unnecessary fear in our population if that is the case. So I suppose from this hearing or this inquiry, we're trying to come up with some recommendations in terms of the public policy approach that we should take on this particular issue going forward. So keen to understand, have you given any thought around the balance on this?
Well, I might take that, if I may, Senator. I mean, I think that obviously the greatest evidence is around, the per and polyfluoroalkyl types of substances, PFAS, PFOA, PFOS, etc. So these obviously being the most extensively studied, and action has already been taken July last year to limit the prevent the importation and manufacture of those substances. So there is obviously strong evidence for those particular compounds that they affect things. Now, obviously, there's less certainty around other forms of microplastics, but they are equally ubiquitous and potentially harmful. So that the AMA supports precaution where evidence is emerging, but we wouldn't go far as to, go down the line with prescriptive policy other than for those compounds I've mentioned. And obviously we don't want to overstate causality or establish or try and suggest there are some dose-response relationships, but we'd like to see, I think, some clear standards, particularly around water quality and safety, and I think, as my colleague to my left has suggested, when I last looked at the measurements that were typical levels of substances in the catchments in and around Sydney and Melbourne, major cities, they look fine, 2 nanograms per litre and so on. But I think in many rural communities they're very much higher, and certainly while people could allege they may still be safe, we don't know. I think that following perhaps the guidance of other jurisdictions, particularly the US Environmental Protection Agency around their standards, would be, I think, worthy of consideration by this committee.
Yeah, we often hear people responding in terms of ingestion of water, food, etc. Do you think that there is enough evidence to suggest, or to be able to come up with some sort of register of where exposures are occurring and what the risk rating of those exposures are? Because it strikes me, and it was something that you said, Ms Teagan, all those things that you listed, and that was only a very short list of the places that we are seeing these plastics being used. Do we actually know, and do Australians know where their exposures are coming from?
I think we certainly have very strong signals. I mean, they are ubiquitous. I think, as has been mentioned too, that they exist in non-stick fry pans and and clothing and obviously also plastics. And I think they're ubiquitous, and obviously most of us here would have considerable exposure. So. Yeah.
I get that, but is there anywhere that anybody can go to actually find out? So if I was considering becoming pregnant, which I can assure everyone I'm not, where would I go to find out where my exposure risk was? Because probably I should ask you, are there credible pathways or links on these exposures in relation to fertility, decline or adverse pregnancy outcomes that are sufficient for us to be putting in place guidelines to doctors and fertility experts and the like to be providing that information to women who are seeking to become pregnant?
There's no one trusted source. And what people are doing is they're Googling and they're asking ChatGPT, and there is research in various entities and organisations, but there is no one register. Just as the way there didn't used to be a register of the food additives, right? Until people could work out what are all these food additives in the food, in the tins. And so there is research, but it's not consistent. There are standards globally, as Julian Raitt has mentioned, the US, the EU, but there is no source that is reliable, and as you know, there is less trust in the community, and so there is an opportunity for a trusted site or trusted register. But it is in our clothing, it's in our air, it is everywhere. Everything we do has microplastics. What damages are they doing? Some people are more exposed to it, as I mentioned, because of agriculture, mining, manufacturing, defence, health. All of those industries really need to be very clear and transparent about what it means in those industries.
Yeah. So the second half of the question, maybe it's better to you, Professor Raitt. Do you think there is sufficient evidence and in terms of these exposures and the potential impact on fertility to warrant a requirement for women who are seeking medical advice, either pre-pregnancy or during pregnancy, to be able to be provided advice about their exposure risk, and is that happening at the moment?
Well, there's no clear source of truth, I think, as has been suggested, and I think there is a need for that.
So the first step is the source of truth to enable. Yeah. Okay.
Can I just add to that, because our RANSCOG has provided us some additional information. That's the College of Obstetricians and Gynaecologists.
They actually appeared last week. So
right, you've got that.
Yep.
Great.
So we have their submission.
Thank you.
Yep. Yeah. So in a sense, we're trying to get your particular take on things. So I mean, if you take the natural conclusion of falling pregnant and fertility through to the fact that we are seeing declining fertility rates and obviously increased usage of IVF, is there any concern or correlation that can be drawn in terms of what we should be doing at that IVF stage in providing information to these women, or is it the same answer?
I'd defer to the advice of the College of Obstetricians regarding that.
Yeah, okay. In your submission, you made comments around, describing the plausible biological effects and the uncertainty of the clinical outcomes, which is pretty much what you're saying now. So, what would your recommendation be in terms to policymakers and how they should act in that environment of uncertainty? Because it strikes me as it's one of those things, we have this particular issue out in the public and we're talking about it, so therefore there is a level of responsibility here. We have enough warnings to suggest that there is a problem that needs to be at least considered. It would be irresponsible of policymakers not to respond to this in some way whilst the evidence is being gathered. So I'm just interested in your view about what your organisation would be recommending to your members around this.
Yeah, well, so, look, I think as I've suggested, and I think Ms Tegan said too, I think when there's emerging evidence and it's more than likely that this will follow the path of previous public health concerns, that the evidence will strengthen, not weaken over time, and that we'll become more certain about these signals as time progresses. So the AMA supports precaution where evidence is emerging, and that means that while you perhaps wouldn't adopt prescriptive policies about banning specific products and going to that level beyond what you've already done, I think that there's obviously a need for national coordination, including more research and better human biomonitoring. And also making sure that there's harmonised measurement methods and standards. Like, for example, across, it seems to me, for example, that there are higher standards being applied to our cities than to our rural, friends. And so, I think trying to do that and also aligning our standards more carefully with both the US and European environmental standards, I think, would go some way to alleviating concern, because they are a stricter level and obviously based on, I think, proper analysis of the available literature.
So do you think there is a need at the moment for a nationally coordinated set of guidelines in relation to this?
Yes.
Whose responsibility would that be to design?
Oh, well, that would be the NHMRC would probably be the most appropriate place to, provide that advice to government.
Yes, we have them this afternoon. So you also mentioned, a system-based public health approach. How far away do you think we are to be in a position to actually do that? I mean, a lot of people have been called for a human biomonitoring program, and I think you mentioned that in your comments as well. But you talk about exposure reduction. Sort of, there is a bit of a conflict here in the sense of how do you do exposure reduction when we don't have any real clarity around all of the places where exposure is likely to occur?
Well, I think that public education is an important part of reducing it. As you suggested, that people that may be considering pregnancy or concerned about the exposure of their children require more information about where these substances are commonly found. Certainly, personally, I'm concerned about the drinking water, and I look at the quality standards in the various different catchments where I live and work. I also, avoid using plastic containers to reheat things. We avoid non-stick fry pans. Where possible, you avoid, pizza boxes, for example. I think there are a number of different things you can do. Now, obviously, they're pervasive in the environment, and it may not necessarily remove all contaminants, but I think that these are sort of practical steps that the public can take to reduce their exposure in the absence of definitive understanding, but some concern being raised in the research.
Yeah, so, I mean, there are obviously clearly those things that the consumer has the capacity to be able to influence their exposure to, but do we have any idea what the exposures are that you have no control over?
I just think there needs to be a corporate responsibility as well. There is no transparency in that corporate responsibility. The other thing is...
So it's really unpack that corporate responsibility for...
Transparency of the water, the industries, the occupational exposure. For rural people, they can't just change water sources or move house or avoid occupational exposure. That's their job. They work and they rely on those people that work in their industries or are in their communities to do the right thing by them. Now, water, you asked before, whose responsibility is it? It's really from a legislative and a standard point of view. I mean, that's where government steps in, right? Or government entities step in, federal and state. The other one is that, you've got legislation, make some clarity. And if we understand what the standards are, well, then at least we can hold people accountable.
So you say make legislation, but I'm just keen to understand what does that legislation look like and what needs to be done in order for that legislation to actually be effective. Because on one hand, we're saying we don't have sufficient evidence to make a clinical determination about things, but on the other side, you sort of make a comment about public policy around legislation.
We do have some evidence.
Well, yeah, but I mean, this is what we're trying to get to the bottom of. What is our next step? And it seems to be everyone's very concerned and a response is required, but I'm trying to get some clarity about what are the steps that we need to take so that we actually have got the evidence base that is sufficiently robust. Because, I mean, how do I know that the glue that carpet was stuck down by is not putting these things into the air? How do I know that, you talk about rural water. I mean, how do we know that the PVC pipe that this was delivered to me in this building? And I mean, to the medical profession, I'm in hospital and I need to have a drip put in. That drip's in a plastic bag. I mean, it just strikes me as that we are talking about the problem, but not talking about the outcome, but we're not actually understanding the problem. So I'm just keen to understand, where do we need to go to actually define what it is that then
Transparency. First of all, what's the risk of that particular product? You're right. The carpet, for example. Well, that might be wool actually, but
no, the glue that stuck it down.
But the glue. But most people have plastic carpet, synthetic carpets. So the point is that the transparency is missing, right? The second thing is the education, as my colleague has said. The third thing is what is a good level? Like what at what level is it no longer right? And which products do have that? The majority of people have no idea. I mean, I don't have an idea of how much I'm allowed to have or could have. And then on top of that, the next thing is that you do fund research, and you make sure that evidence actually goes to that source, whether it's, a trusted source, goes to that source so that we all know which research we actually trust. So it's really a multi-pronged approach to, having the right evidence, having transparency, having the education, knowing what level, and ensuring there's a trusted source.
Thank you.
Sorry, Chair.
I'm going to go to Senator Nandaraja.
Thank you, Chair. I just want to go back to the research issue because, there are questions around causality, but the problem with setting a benchmark of causality, which is actually a very high benchmark for something like microplastics, is that it will take potentially a very long time to determine that. It could take another generation, 25 years. And in 25 years, according to the Lancet Countdown, which was published last year, plastic pollution is going to explode. It's already at about 500 million megatons now, and in 2050, it's expected to hit 980 megatons, which is exactly what the fossil fuel companies want to do, and that's actually stated in this paper as well. So just to draw back to this issue of causality, I know you mentioned that, Professor Raitt, but we have an umbrella review that was also published of nearly 1.5 million participants. So, and that showed a litany of problems. I mean, it's everything from in utero effects, polycystic ovarian syndrome, endometriosis, which affects 1 in 7 Australian women, perinatal effects, miscarriage, low birth weight, malformations, stillbirth, diminished cognitive function, insulin resistance, hypertension, obesity in children, type 2 diabetes, cardiovascular disease, obesity, cancer. It's there from this huge umbrella review. So what kind of additional research do we need?
Well, I think that, in terms of longitudinal studies, is really what we need, is clear correlation between measured levels and disease outcomes. But I agree with you. I think the signals already are very concerning. And as I've suggested, and I think Ms Tegan said too, is that we're at a point which is very familiar, where we've been before with various other environmental contaminants, where there hasn't been sort of like clear evidence and we've not been sure about what to do. And I would hope that the committee would consider that the signals that are already there are disturbing and concerning enough to be able to create some clear policy prescriptions to try and minimise exposure, and also create greater transparency around the levels and products that are most responsible for these potential harms.
And there has been quite a bit of work on learning from the asbestos and the lead The processes that they now know they could have undertaken early, and we should learn from those and add to them with the information that we now know. I think doing nothing is not an option, and for us, leaving rural and remote out is definitely not an option due to our socio-economic benefits.
We've got the NHMRC coming a bit later. They're obviously going to have an important role to play in terms of kind of steering the research ship.
And MRFF.
I speak about both of them together. That's kind of where this is heading. What kind of questions would you like us to put to them? Or what kind of asks would you like?
What priorities are you making for rural, remote and regional Australia? Mm-hmm. And in particular, what percentage of your funding are you benchmarking to go there? Because there are so many issues in rural Australia.
Yep.
And the funding has been well and truly below 10%, considering they make up 30% of the population and have bigger health issues. In addition to that, what are you doing to actually build the capacity of the researchers in those areas?
Yep.
Because it's all very well that we spend the money there, but not... the other questions are, what are the hidden areas that we need to focus on that we don't see every day because they're part of our environment? What thinking have they had? How do they decide what is a priority? Yeah.
Do you think, just to follow on from that, do you think those priorities should emerge with some type of community consultation?
Absolutely. I mean, we work quite extensively with the NHMRC and MRFF, but we have one voice and we are often with the minority groups, and yet we make up a very large part of the population and produce the money that funds MRFF and NHMRC.
Yeah. Okay, thank you.
And I'd add the questions to follow on is to say that, what are they doing to ensure that there's equitable research across rural and regional Australia? And I think the other thing I would suggest that you ask them is to say, how do they reconcile the discrepant standards between ourselves and other jurisdictions, including those in Europe and the United States?
I think we heard some testimony from an earlier hearing, the previous one, that Australia is a little bit harder. It's harder to prove links in Australia because we're a quote-unquote cleaner environment than other places. But the fact is that we've got these microplastics in our bodies and they shouldn't be there. Bottom line, they shouldn't be there. So I think we should start with that premise rather than trying to prove links. And I always also struggle that, the onus falls on civic society, research, community to figure this out when, as you said, corporates don't seem to, they produce this pollution and they walk away. They profit from it.
Yeah. We need corporates, but there is a social responsibility. Their shareholders expect social responsibility, and we don't want whitewashing or greenwashing or rural washing. We just don't want washing, right?
Yeah.
So the transparency needs to be there, the responsibility needs to be there.
Look, and I'd also add that from my understanding too, I think the particles that we're most concerned about are the very smallest ones, the nanoparticles. Larger particles will obviously be caught in our, respiratory systems or our guts and not necessarily enter the bloodstream. Some will then enter the bloodstream and others will actually enter cells. And so I think the very smallest particles are the worry because they obviously have the capacity to disrupt cellular function and our DNA code, etc. So I think that when we're looking at this, I'd also ask, the questions about what do they consider the particles that we should be paying our most attention to.
Sure. And it's always struck me that there's a different standard for regulating pharmaceuticals compared to all the chemicals and plastics. Do you want to just talk the committee through? I'm familiar with it, but talk the committee through.
Sure.
some of the how we regulate the drugs that actually are put on the PBS and then given to people?
Sure. So I've had some, obviously, long experience with this. I've done dozens of clinical trials through my career, but basically the way it's done is that in the first instance that there's a phase 1 and phase 2 studies actually showing that these products don't actually have any potential to produce harm in small numbers of people. And then it goes to a phase 3 where it's looking to try and demonstrate efficacy over a larger number of people while also trying to detect signals around any potential unknown side effects. So we're going from, say, a few hundred patients perhaps to many thousands of patients. And then, of course, there's a stage 4, which is the post-monitoring surveillance period, where the companies are obliged to continue to monitor products that they manufacture in the community and actually seek feedback from practitioners about any side effects that might occur when those products are then deployed to hundreds and thousands, if not millions of people. So, you know, there's a sort of like a staggered system of safety, like controls that are all overseen, in our case, by the TGA, more usually, in my case, they've been overseen by the US FDA. But nevertheless, there's been a very strong focus on making sure that not only is efficacy demonstrated, but safety is demonstrated in very large numbers of people. And I think that this is where it's different, because I don't think there is any concern sometimes about when these products are deployed about them even seeking to detect any safety signals or not about their products. And non-stick fry pans, Teflon is a classic case in point where it was said to be sort of like a miracle substance that could do this or that. And it's only sort of like, 50, 60, 70 years later that people are saying, wait a minute, there could be a safety concern here. And all the while that particular compound has been widely deployed and obviously everywhere. So I think there is a need for more rigorous safety monitoring of these sort of style of products when they're introduced.
And chemicals.
And chemicals
farming, agriculture.
Do you think that, my last question, Chair, do you think that these industrial chemicals that then eventually make their way into products and then into the consumer stream and then into the environment and our bodies should undergo that level of scrutiny? I mean, do you think that's even possible, or do you think there should be...
Do I think it's possible? The problem is that there's very little effort made until many years down the track often. So I think from the outset when these chemicals are introduced, there needs to be much more, if you like, genuine attempts to consider the safety implications of these products and also some monitoring in the communities where they're deployed.
And should that monitoring be borne by the corporates?
I think so. Well, that's how they're born in the pharmaceutical industry. And
it is actually. The pharmaceutical industry do have to monitor.
And they self-fund.
Corporate monitoring post
it's all part of corporate responsibility.
Yeah.
The product that I think was mentioned too, which I think is the firefighting foams, which continue to impact, I think, rural communities in and around Air Force bases and things like that around the country, because their water quality standards are below those that we would consider safe. And that's a classic example of where a product's been sort of introduced without, proper consideration about the long-term safety risks.
And the other thing is that these people are often volunteers. Rural communities have a lot of volunteers, and so because it's used, whatever is used, they rely on it being safe, and it's not until later. So, we spoke before about, well, whose responsibility is it? The average person, yes, they need to be educated and need to have support in understanding, but they actually don't have the power nor the capacity often to actually implement the change that is needed.
Okay, one more? Really quick. 90% of our plastics in Australia are imported. Only 10% is then recycled. Most of it ends up in landfill. I guess the question is, there's a market that's driving this. So, we've talked about this previously in the committee about alternatives to plastics. And do you think that there's a role for government in fostering some research into, or R&D into alternatives to plastics, particularly here in Australia?
Yes. I mean, Julian, you might be able to say something, but I think the medical industry did look at the use of plastics, because in the medical and health industry, there are a lot of plastics used. Part of it is cost. Part of it is that they might not have an autoclave wherever they are. There's a whole lot of issues around that. But there's definitely an opportunity to do that. Look, you don't want to add too much red tape to any industry, because it affects productivity and increases costs. However, that doesn't mean that you don't have a responsibility.
There's still a cost, though, with all of this, right?
Of course.
Everyone's paying for this.
Of course. They're paying for it through their health.
Mm-hmm. Thank you. Thank you, Chair.
Thanks very much. I'm just going to ask one final question. You've mentioned in your evidence, and we've certainly heard from other submitters, that there is much tighter regulation in the EU and also to some extent in the US. And I guess my question to you is, from your perspective, what are the blockers? Why is it that we've got other jurisdictions that are much more readily happy to regulate, and that's not happening yet here?
Oh, I think it's a cultural problem. In my view, I think that other jurisdictions, as you mentioned, have a stronger environmental movement, and that these issues are much more, I suppose, prominent in the press, and also very much communicated to parliamentarians and other representatives. So I think that it really is it should be a priority for our government to be more concerned about these sorts of environmental signals, because as I think we're beginning to understand, I think they're contributing to quite a few hidden health issues that we're only just beginning to understand.
I'd just like to add that those countries or those jurisdictions that you mention are extremely protected by their governments. If you're looking at agriculture, for example, they're extremely protected, whereas our agricultural industry is basically lean and mean, and so they don't have the buffers that those countries have. That doesn't mean that we shouldn't be accepting them. They're also older economies, and very regulated, which does also affect productivity at times. So I think whatever is in place, the discussion needs to be also about productivity, and about when we compare with other jurisdictions, that we're actually comparing like with like. It doesn't mean that you shouldn't act.
Thank you very much. Look, can I thank you both for your submissions and evidence today? It's very much appreciated by the committee. Also want to thank the Rural Health Alliance for your advocacy. As someone who lives in regional Australia, it's very much appreciated. The committee will report to the Senate on Wednesday, the 26th of May 2026. We've agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026, although I don't believe any questions were taken on notice by this panel. Thank you very much for your evidence today. Very much appreciated.
Thank you, and thank you for your in-depth questions, all of you. Thank you.
Thank you very much.
I'm now going to welcome the Australian Food and Grocery Council and the Food Packaging Forum Foundation. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, if you could please state your full names and the capacity in which you appear today, and I'm going to start on my left.
Thank you. So, Scott McGrath, Director of Stakeholders Engagement and Policy at the Australian Food and Grocery Council.
Thank you. Sarah Collier, Director of Membership and Sustainability at the Australian Food and Grocery Council.
Good morning, and thank you for joining us. I'm now going to invite each of you to make some short opening remarks, and then I'm going to go to questions from senators. Oh, my apologies. We also have someone online, so I'm going to go to Jane online.
Hello, good morning. My name is Dr. Jane Munker. I'm with the Food Packaging Forum.
Fantastic, and my apologies for missing you there. I'm now going to go to both organisations for opening remarks. I'm going to start with Mr McGrath.
Going to pass to my colleague. Yep.
Thank you. Good morning, Chair and members of the committee. Thank you for the opportunity to appear on behalf of the Australian Food and Grocery Council. By way of background, the AFGC represents Australia's food and grocery manufacturing sector. Our members produce the food and grocery products Australia rely on every day. The sector contributes to about $173 billion to the economy, employs more than 300,000 people, and accounts for nearly 1/3 of Australia's manufacturing. Packaging plays a very essential role in enabling a safe and reliable food system. It protects food from contamination, extends shelf life, reduces waste, and supports consistent distribution of food across large, climate-exposed and geographically dispersed country. For many Australians, particularly in regional and remote communities, packaged food is a key part of maintaining access to safe and affordable nutrition. This inquiry is considering complex and evolving issues. The current evidence based on microplastics and related substances is developing, with recognized gaps in measurement, exposure, and health impact assessment. Leading expert bodies, including Food Standards Australia New Zealand and the Australian Academy of Science and broader public health agencies, have pointed to the need for further research in this area. Our understanding from this is that regulatory approaches are still emerging and the evidence is clearly established health-based findings from microplastics in the space remains limited. In this context, it is important that policy responses remain grounded in robust evidence and are designed to be proportionate and practical. The settings adopted will need to support both public health outcomes and the continued delivery of safe, reliable, and affordable food supply. The AFGC supports ongoing investments in science, improved measurement capability, and national consistent regulation approaches that can provide clarity for both consumers and industry. We remain committed to working constructively with government, regulators, and the science community as the evidence base continues to evolve. Thank you for the opportunity to appear today, and we look forward to your questions.
I'm now going to go to Dr. Is it Monk? Munker, thank you. My apologies, I didn't hear you in the beginning. I'll get that right next time. Dr. Munker, over to you for your remarks.
Thank you so much for the opportunity to speak with you today. My name is Jane Munker. I'm the Managing Director and Chief Scientific Officer at the Food Packaging Forum in Switzerland, and I'm also affiliated with New York University Grossman School of Medicine in the United States. My research focuses on food contact materials like food packaging. Our modern society depends on food contact materials, but materials like plastics are not inert, which means that they leach their chemical building blocks into foodstuffs. And these chemicals are called food contact chemicals. So what are the facts? 15,159 different food contact chemicals are known. For 5,005 chemicals, we have evidence that they're present in different food contact materials. 2,160 chemicals are known to leach into foodstuffs, and at least 3,601 food contact chemicals have been detected in the human body. Also, food contact materials are a known source of micro and nanoplastics, but the evidence on this is only just evolving now. At Food Packaging Forum, we have compiled a list of 1,222 hazardous food contact chemicals, and these are chemicals with hazard properties that are linked to severe adverse health effects such as cancers or reproductive disorders. But despite their known hazards for human health, these priority chemicals are legally used in food contact materials today and leach out of them. How is this possible? Regulations are based on chemical risk assessment, but chemical risk assessment is not fit for purpose when it comes to food contact materials. Many food contact chemicals have been in use for decades, and while the science has advanced, regulations have not. It took over 30 years to ban the endocrine disrupting chemical bisphenol A from food contact materials in the European Union, and that only happened last year. So what can be done? People are exposed to more than one chemical at a time, so a generic mixture allocation factor can be used to reduce exposure thresholds and account for uncertainty and data gaps. Then the many chemicals lacking hazard data can be grouped by their chemical structures, and structural similarity with known chemicals of concern is an indication of similar toxicity. For example, for bisphenols, phthalates, and PFAS. And then the entire group can be regulated to prevent regrettable substitutions. Novel approaches to material testing can be developed using effect-directed analysis. Here you test the mixture of all leaching chemicals for hazard properties of concern and then identify what chemicals are driving the toxicity and replace them in the material formulations. And last but not least, the use of inert materials can be enabled. Inertness is a material property that reduces the need for chemical data because of negligible migration. And inertness is also important for achieving a safe circular economy. So with that, I think I'll end my introductory remarks, and I'm looking forward to your questions. Thank you.
Thank you very much, Dr. Mulcahy. I'm going to go to Senator Ruston to begin.
Yeah. Thank you very much. Perhaps firstly in the room to the Food and Grocery Council. Do you think that the current food standards are sufficient or adequate to address the level of emerging concern that people have about the consumption or exposure to these plastics?
Probably, excuse me, thanks for the question. Good question, and probably one asked by a lot of people. Definitely a question to be put to some people joining you later this afternoon, I understand, where Fazans are coming into the room. We understand that they, they'd be best placed to answer it, but at this stage, evidence says it's still emerging.
Okay. So, this seems to have been the dilemma of the discussions that we've had with everyone and the submissions that we've received. There seems to be certainly a belief that there is a concern in relation to the impact of exposure, but nobody seems to be prepared to actually say, yes, we should actually actively do something about this. And so I suppose in terms of, you represent food manufacturers, how transparent do you think the labelling of the people that you represent is for consumers at the moment in relation to this particular issue?
I think, picking up on one of the comments you made there, I think additional research on this subject would be doing something. I think that would be an initiative that we'd all get behind. Are the labelling requirements on this product? Off the top of my head, I couldn't possibly answer that, so we can take it back and take it on notice. But I think it's a research piece at this stage.
Yep. So, given that we have a heightened level of concern, and in these circumstances, there's always an argument for a more precautionary approach to these things. Do you believe that the industry has, in terms of the food packaging industry, has some responsibility to A, provide more information, or B, reduce exposure for these plastics and toxins?
There was a comment made in earlier testimony there around sort of working to get away from plastic, and I think my colleague can probably talk a bit more about some of those initiatives, but I think that's where our industry sees their most productive contribution.
Yeah, I'd be very interested in some more information on that, Ms. Collier.
Absolutely. So we think about packaging and the circular economy that we're aiming toward. There's a lot of continuous improvement around packaging formats to make them more recyclable, to make them have better sustainability credentials. What is important, though, is that we remember that there is a balance in terms of the fit-for-purpose piece on packaging, so allowing it to arrive, to your door with safety, security, and if you think about how large our country is and the global supply chain that we're involved in, ensuring that food waste isn't an impact there. By changing constructs of packaging format, there can be unintended consequences.
Yeah, and I suppose this is the piece of the puzzle that's missing, is we do not have a risk rating on the exposure to enable you to be able to make that assessment, or for somebody to make the assessment between, you know, the fit for purpose safety in your food arriving as opposed to the potential impact of the exposure of the packaging that it's arriving in. You also made the comment about, you know, recycling and sustainability. In the work that you're doing in terms of these packaging materials, does exposure to microplastics factor into that decision making?
At this point, it's more around making packaging formats that are going to be circular. I would say that without, you know, international or aligned standards on measurement, data collection, it would be difficult to answer that question.
It's not difficult to answer the question on what you're doing. I certainly understand it's difficult to answer the question about, you know, the evidence base here. But it sort of strikes me that, you know, obviously the sector has acknowledged the requirement in terms of food waste, recycling, sustainability. We have an emerging issue here, and there is a body of evidence I'd be really interested to speak to. Is it Professor Monka, Dr. Monka? Dr. Monka, I'll make sure I give you your correct title. You know, interested to, you know, to understand the project that they've been working on. I mean, how much has industry responded to understand that this is potentially an emerging issue? And is there, from your knowledge, is there any response from an industry self-regulatory perspective around this issue?
So I would say that we're very much guided by the current regulation that's in place in terms of FSANs and the guidance that they're providing. And yeah.
So the industry itself is not really taking a proactive way. They're taking a bit of a wait-and-see approach here.
It would probably be a lot of, it would be one of several emerging areas in packaging that they would certainly be looking at.
Are there any other human health areas of that are emerging in packaging at the moment, apart from plastics?
Not that I'm aware of.
I mean, obviously under the DQ ICHEMS register, and there's a consultation going on there around chemicals of concern, which we're involved in.
Yeah, okay. I was really interested in reading your submission, Dr. Monka, and you made the comment that in your research that it shows that the particularly nanoplastics can actually cross the placenta. So far in your research, have you been able to ascertain, you know, the how significant that might be into pregnancy outcomes, and if so, what are your recommendations at this stage?
No, unfortunately not. So the research on micro nanoplastics is only just emerging, and one of the big challenges there is to have reliable methods for analyzing and you know, quantifying these particles in human tissue. So what we can tell with reasonable certainty is that these particles are taken up by cells. We have some indications of biological responses. I wouldn't go so far yet as to say of adverse health outcomes. But really what sort of the impacts on developing fetus or pregnant women are from this exposure to micro nanoplastics, it's really too early days to say that. However, we have a lot of evidence on the chemicals that leach out of plastics. And so I understand that in terms of public awareness, people are very focused on the micro nanoplastics. Scientifically, that doesn't make so much sense because we have several decades of very reliable scientific data and evidence showing that there's very, very well-founded reason for concern related to the chemicals that leach out of plastics.
Yeah. So in your actionable European roadmap for early life health risk assessments for micro and nanoplastics, does that take into account anything to do with chemicals, or is that a completely separate piece of work?
No, chemicals are somewhat considered in that. So the fifth kind of pillar of the roadmap is the mitigation strategies. And there we already acknowledge that we have a lot of evidence how plastics impact health negatively. And that's why mitigation is called for, even in the absence of hard, reliable evidence on micro nanoplastics themselves.
I mean, I note that you're still in the process of developing and preparing this particular paper and not expected to publish fully for a year or two. But in so far, how relevant is the work and the outcomes of this paper going to be for Australia, or are our environmental considerations sufficiently different to require a piece of work like this in Australia, or is there a lot that we can learn from the work you've done?
So, as a researcher, of course, the action for us is where the unknowns are, right? That's what we love. We love to find questions that need answering through research, and I will always support that. But I think when it comes to policy making, there's no need to wait. I think we know enough. I think we have enough evidence to justify action. And I think actually it's, now I'm speaking as a citizen, I think it's actually pretty unacceptable that people continue to be exposed to these materials and chemicals which have never been properly tested for their impacts on health. At the same time, we do see non-communicable diseases that are increasing globally in countries like Australia, but also in low-middle income countries. And it's very plausible to assume that chemicals, at least in part, contribute to those disease increases. If you look at the food standards and the regulatory requirements for food contact materials, you will see that there's very, very, very little requirement to test these materials and the chemicals that leach out of them. Mostly the requirements focus on testing for genotoxicity, which means how do chemicals interact with the human genome, so with DNA? Do they change the sequence of the DNA, or do they affect gene transcription in some other way? And the assumption there is that if chemicals can interfere with the genome in such a way that it could lead to cancer, which is not wrong. But cancers can develop in many other ways as well. And cancers are not the only non-communicable disease that is of concern. Actually, the most relevant one, the highest cause for premature mortality, is from cardiovascular disease. Chemicals can also contribute to cardiovascular disease. We're not testing these chemicals that are used to make plastics right now for these kinds of impacts. We're not testing them for impacts on brain development, on immune system toxicity, reproductive toxicity, metabolic impacts, and so on. So I think there's a wide open glaring gap here.
Yeah. So in your research, did you try and ascertain where the greatest potential exposures are in the general environment? Because we've got the Food and Grocery Council here today. And obviously, there is, some discussion around the food packaging. But do you think that food packaging provides a high risk major exposure point for as a pathway?
Well, as a researcher, I would have to say that we don't have all the evidence to answer that question with high confidence. However, again, I think we don't need to wait for more and more and more data to come forth. So I'll give you an example why I do think that food contact materials are really an important source of exposure. Maybe not the most important one, but they're definitely an important one. So if you look at the numbers, I shared some numbers with you on the food contact chemicals. Experts actually estimate that there could be up to 100,000 chemicals that leach out of the different food contact materials. That's not only plastics, that's also paper, that's the coatings inside of beverage cans, closures on glass jars and so on. If you look at that, there's huge data gaps. A lot of those chemicals have not even been identified in terms of what chemicals they are. And that also means that we can't say if they're toxicologically relevant or not. Compared to pesticides, which also are food contaminants, pesticides are very well characterized. There's about 1,500 different pesticides with their degradation products, and the levels are 1,000 times or less lower than for food contact chemicals. So just to illustrate that, I think food contact materials definitely are a very relevant source. And yes, we know very well what drives the contamination of foodstuffs. So if you have foods that are heated in packaging, maybe to sterilize them to enable longer shelf life, or they're maybe stored by mistake in the sunlight over time while they're being transported, that will increase the leaching of chemicals. Then long storage times are also of concern. And then, of course, the food chemistry plays a role. So if you have very fatty foods or very acidic foods, you will get more migration. And then maybe least intuitive is the serving size. So in small serving sizes, you have proportionally more migration than in big serving sizes, because you have this ratio of your packaging surface area to volume of food. And this ratio increases when you decrease the serving size. And that concerns me a lot because of, sort of these pouches of baby foods that are on the market now, which are convenient maybe, but they're small serving sizes. It's usually in-pack sterilized, so there will be heat applied. It's plastic layers. There will be adhesives, printing inks, and so on. And probably also microplastics, and this is being served to children that are very vulnerable to chemical exposures.
So from an international perspective, do you think there is enough information that's available to our food manufacturers for them to be realistically aware of this?
Yes, absolutely. Very, very aware. Yeah.
Okay.
But I think it's, I think it's like the colleague from the Grocery Manufacturers Association said, that for industry, there is no incentive to go beyond regulatory requirements. And the only reason to change the current system would be public pressure. If citizens demand truly safe packaging, not just safe in the sense of it's safe because it complies with regulations, and regulations that have been in use for decades now, which are not aligned with current science. And actually, I just want to point out that there are two really important reports, one from the US Government Accountability Oversight Office published in 2022, which did find that there are reasons for concern with food contact regulations in the US, and from the European Parliament from 2016, that also found that current EU regulations do not sufficiently protect public health. And despite these reports, both jurisdictions have not managed to update their food contact regulations right now. And we've also provided quite a lot of analysis into the scientific shortcomings with the current regulatory approach. I will be happy to share those documents with you.
That'd be great. Yeah, that'd be fantastic. Thank you, Chair.
Senator Nandaraja.
Thank you, Chair. Just to follow on from Senator Rushton, Dr. Munk, could you tell us a little bit about your Aurora project? I noticed that it's funded by Horizon Europe, and Australian researchers will be gaining access to the Horizon program from next year, thanks to the free trade agreement, which is really exciting. Firstly, just describe to us your birth cohort study, and then whether there are any collaborations you might entertain with Australian scientists.
Yeah, thanks for that question. So Horizon Europe is a funding mechanism from the European Commission. It's very competitive. And the Aurora project has been ongoing for 4 years now, so we're in the final 5th year of this project. We will end later this year. It's a collaboration between, I believe it's 14 different research partners from across Europe, and we have one partner in the US. And the 2 cohorts that are in the project are birth cohorts, meaning that we have sampled urine and blood from pregnant women throughout pregnancy, and we have collected placentas and cord blood upon delivery of the infants, and also taken certain assessments of infant health at delivery. In total, we have about 800 mother-child pairs. One of the cohorts is significantly larger. It's about 700 mother-child pairs from the Barcelona region in Spain. And the other cohort is around 50 to 100 mother-child pairs from Hasselt in Belgium. We are right now in the process of analyzing the biological samples. It's very difficult to do because the sort of more reliable approaches, methods to analyze microplastics in human tissue are incredibly work intense. So they take like a couple days per one sample. And as I mentioned, we have 800 samples. Or at least 800 mother-child pairs, many more samples. So the goal of our project was also to develop high-throughput methods. And whether we actually will be able to do that it's not certain yet, I have to say. So I just got back, yeah.
No, that's really interesting. Are you collaborating with the Minderoo Foundation at all?
Yes, so at Food Packaging Forum, we collaborate with Minderoo, the Aurora project not. But we have a collaboration with Minderoo Foundation on establishing the evidence base for the chemicals. So what I mentioned in my introductory statement, this is in part has been generated with support and in collaboration with our colleagues at Minderoo, yeah.
Are there any biomarkers that can be used in pregnant women to screen them now and predict outcomes?
Yes, I'm sure there are, but I have to say that I can't tell you from the top of my head. That's not my area of expertise, so I would have to get back to you on that.
No, that's okay. And do you think your study, Aurora Project, would help, I guess, identify some biomarkers that might be useful for pregnant mums?
Yeah, well, we're looking very generically at immune system related biomarkers right now. So yeah, again, waiting for the results. But I think, if you look at the body of evidence when it comes to the health impacts or the toxicity of micro-nanoplastics so far, it looks like the immune system and the immune response is triggered, and whether that can lead really to adverse health outcomes remains to be seen. But I think it's quite plausible to assume that if the immune system is affected in a negative way, that will have knock-on effects because the immune system plays such an important role also in, prevention of cancers and so on and so forth. So, yeah. But again, I have to say, this is micro-nanoplastics. For the chemicals, we have a lot of evidence. We have a lot of very strong, solid evidence that it affects health.
Sure, thank you. And can you just talk us through the effects on the endocrine system? Because you've mentioned it in your submission that there's reductions in alpha estradiol, it affects fetal development. Fetal development is tightly controlled. Could you perhaps elaborate for us, and particularly for expectant mums who might be listening?
Well, I think it's very concerning if levels of hormones are affected through chemical exposures, or in this case, through micro-nanoplastic exposures. because the hormones during fetal development control development of the brain, for example, or of the metabolism, and so on and so forth. So that's not a good thing, right? I think what women that are concerned about these exposures to micro nanoplastics and plastic chemicals can do is to avoid exposure to plastics. And what does that mean? Well, food contact materials, food packaging, kitchenware, tableware at home. There are good alternatives made with inert materials. And I think that the trick here is not just to think, oh, it's not plastic, so it's okay. Because indeed, also paper, for example, and especially recycled paper, or metal packaging, if it has a plastic liner on the inside, or beverage cartons, for example, have plastic on the inside. Those are all types of food packaging that will also leach chemicals into foodstuff. Unfortunately, there's no perfect packaging, but I think preferring the inert types of packaging is better than going for the plastic coated things. And then really pay attention to not consume too many processed foods, because during food processing, there's also chemicals that leach microplastics that get in. So it's a little bit more advice than I can probably squeeze into this response, but I will be happy to provide links and support with that, because I think it's a real need for women to know what they're doing.
Thank you. That would be great. Maybe on notice, if you just provide us a more fulsome list. I might just go to the Food and Grocery Council. You've heard testimony from a leading researcher who has been awarded a very prestigious award from, the world's largest research program, which is Horizon Europe. What sort of steps are being taken within the packaging industry? Because obviously we need food packaging, right? We have to be practical here. But what kind of steps are being taken within the food packaging industry to develop perhaps alternatives to plastic or minimise the use of plastic, to perhaps introduce more paper or cardboard packaging? Could you perhaps talk us through the innovations that are being considered or have been already implemented?
Absolutely. So our members have made huge inroads in their innovation around packaging. I think what's important, though, that in some cases there will be trade-offs. So, for example, it needs to be fit for purpose, as I've mentioned, around food security, transportation, but also that food waste component as well. In some cases, there are packaging formats that have not, there just simply is not a global solution to this. It's
Can you
not,
give us an example?
You talk about like certain products, if you're having a product that's hot or it needs to be heated and you have it in a fiber base, it's simply going to go through your hands. Or you may have a food waste issue because it doesn't have the shelf life to come from overseas, or if we're doing exports, so by the time it lands on shores, it's already expired. And so I think just understanding that there are some limitations. Certainly there is a lot of investment and innovation happening both here in Australia, but through the value chain partners that work on packaging formats.
Are you able to quantify that? I was going to ask you about the R&D spend, but are you able to quantify that amount that is getting spent on R&D by the industry?
Certainly not off the top of it.
No.
We can come back to you with some figures on that.
Notice?
There's also some pretty significant barriers to R&D investment here. So we know that the government released some work on that earlier. So we're keen to work with government to make it easier for companies to do that, because Australia does have some good examples of packaging formats being changed. So just to put one on the record here this morning, one of the best examples I've heard of is something like turning a product into a concentrate and limiting the headspace. You just essentially just creating less packaging. So it comes down to less of that product being there. So, but there's paper-based packaging, as you mentioned, and there's a whole other range of considerations that our members take in.
Okay. I mean, I think with that R&D effort and expenditure, if you could just take that on notice and provide us some information,
Sure.
that would be helpful. I think the question of inert packaging is interesting. Glass, I guess, is an inert type of packaging, but there's a cost associated with glass as well. Are there any other types of materials in that kind of inert category or closer to that inert end of the spectrum that you're aware of?
Oh, look, I think it depends on the product entirely. I think there's I think there's a lot of different work being done on different products based on whether they're sort of higher in, you know, if they're a product that has a shorter shelf life, a longer shelf life. I think it depends entirely on what it is. So.
Exactly. Yeah. Thanks, Jay. Off to you. Thank you.
I'm interested in, so far in your responses, it seems to me that the decisions that are being made around packaging and the research, like you gave the example of something that was larger and it was able to be concentrated and made smaller. We've just heard evidence from Dr. Munker that in fact, from a chemicals perspective, may in fact be more risky to people's health because of the size ratio. I guess I'm interested to know, in terms of the R&D spend, I take it that you need to take on notice how much is being spent. Are you aware, though, of R&D that's being done in relation to the health impacts of packaging as opposed to the amount of packaging and the recyclability of packaging?
I'd say the R&D investment, I mean, it's a great question. I'd say the R&D investment on packaging would cover any element of packaging. So it's storage, it's availability, it's fit for purpose nature, it's carbon footprint, all sorts of, and human health, I would expect.
Can you take on notice in that R&D spend? I'd be if the committee could know what element of that R&D spend goes directly to the health impacts of the packaging in terms of its chemical and plastic makeup. I guess my next question is, we've also heard from earlier witnesses this morning, you know, if we compare food and food packaging with the pharmaceutical industry,
sure,
where there's a big expectation on pharmaceutical producers to test the safety of their products. Is any safety testing done in relation to the chemical content of packaging by your members?
I think that is an excellent question to put to Fazan's this afternoon, but I do think...
I want to clarify.
Sure.
My question is,
Yep.
in terms of your members, the people who are packaging food, are they themselves expending any funds on testing the safety of that packaging?
I would expect they are, but we can take that on notice.
Okay, thank you. And maybe my final question. We've heard some fairly strong evidence this morning, for example, that heating foods in plastic packaging, there are decades of research showing that there is chemical leakage. Do any of your members place warnings, for example, on plastic packaged food that requires heating to tell them that actually if you do heat it in this packaging, there's risk of chemical exposure such that maybe they could take it out and put it in an alternative thing at home? Are there any warnings like that on any of your packaging?
I understand there's quite a lot of warning labels. Whether there's anything specific around the heating and whether you're reheating to take it out, I'm not too sure off the top of my head, I'm sorry.
Could I maybe ask you to also take on notice examples of where there are warnings that relate to chemical and plastic health risks of any particular packaging, given the evidence that we've heard today? Yeah, I'll go back to...
Just to the Council, Australia did support the Global Plastics Treaty. Now, we couldn't get it over the line because of the fossil fuel producing nations, including Saudi Arabia, who opposed it. But did the Council have a position on this treaty?
proud supporters from memory.
Absolutely.
Some of our members were some of the biggest supporters and used their global networks to do so.
Is that right?
Yeah.
Wonderful. Could you maybe on notice just supply us a little bit additional information around that?
Certainly.
I think that would be interesting for the committee
Yep.
to particularly engage with those producers who are one, big, and two, have global networks, and three, were supportive of this, because I think industry has a big role in driving this change and obviously has deeper pockets than some of our national funders and could be part of the solution.
Yeah, certainly. I think it's a story that they'd be pleased to tell, so I don't think you get any resistance there.
Great. Thank you. Thank you.
Can I thank this panel of witnesses very much for your submissions and making the time to appear before us today. In particular, Dr. Munker, we're very much aware that you've stayed up late at night in Switzerland to provide your evidence, and that is very much appreciated. The committee will report to the Senate on Wednesday, the 26th of May 2026, and has agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026. Thank you again to the panel for your evidence, and the committee will now suspend for 15 minutes and resume at 10:48 a.m. Okay, we will resume, and I now welcome to the panel the Heart Foundation and the Stroke Foundation. I won't forget the people on video this time. Good morning, everyone. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, if you could state your full name and the capacity in which you appear today. And I'm going to start online with the representative from the Stroke Foundation. Ms Murphy, if you could just state your full name and the capacity in which you're appearing today.
Yes, Lisa Denise Murphy, and I'm the CEO of Stroke Foundation.
Thank you very much. And to the people in the room?
I'm Dr. Daniela Doherty. I'm Head of Clinical Evidence from the Heart Foundation.
Hello, I'm Dr. Catherine Latham. I lead policy development in a number of areas at Heart Foundation.
Great. Thank you very much, everyone. I'm now going to invite each of your organisations to make some opening remarks, and then we'll go to questions from senators. And I'm going to start with Dr. Murphy.
Thank you. And thank you, Chair and Deputy Chair and all the senators here today. We are responding particularly to the items C and H of the Terms of Reference. So Stroke Foundation is Australia's national charity representing the estimated 440,000 Australians living with the effects of stroke, alongside their families and their carers, but also health professionals as well. Every 11 minutes in Australia, somebody has a stroke, and that equates to about 23 Australians dying from stroke as well. And this is absolutely devastating, but also for those that survive a stroke, that lifelong disability has such a big impact. Stroke is the fourth leading cause of death overall, and it kills more women than breast cancer and more men than prostate cancer. And it's not just a condition of the elderly. 25% of strokes happen to those under the age of 65. But there is good news. 80% of strokes are preventable. So absolutely every modifiable risk factor that we identify and act on has the potential to save lives and reduce disability. So that's why we're here today to discuss the impact of micro and nanoplastics. The evidence and the science is telling us something we really can't ignore. Microplastics are accumulating inside our bodies, and significantly for stroke, they're being found in the arterial plaques that line our arteries that are causing stroke. And this has really been highlighted in a landmark study published in the New England Journal of Medicine back in 2024 that found that patients with detectable microplastics in their arterial plaques had a 4.5 times greater risk of heart attack, stroke or death. And then subsequent to that, a 2025 study found that nearly 10% higher rate of stroke in communities that live near highly contaminated coastal waters. So emerging evidence is pointing to a link between stroke and microplastics, and the sort of basis of this is the inflammation that the microplastics and nanoplastics cause, the oxidative stresses and the damage to blood vessels lining, and then the subsequent immune disruption. So although a direct cause and effect mechanism hasn't yet been established and more research is needed, by applying a precautionary principle and dealing with the risk of micro and nanoplastics now is absolutely sensible and prudent, especially when exposure is so universal and unavoidable. Some Australians do face even greater risks, so there's those in those highly contaminated areas, workers in high exposure industries and Aboriginal and Torres Strait Islander communities. So we're asking this committee to consider the following 5 actions. Apply the precautionary principle, so strengthen regulation and monitoring now. Establish national policy on micro and nanoplastics as an emerging health risk, including safe human exposure limits. Embed human health into all national plastics reduction policies, taking a health for all policies approach. Identify and protect priorities and community populations that are most at risk, and invest in long-term research. So the question is, not whether we should act, but whether we cannot afford not to. Thank you. I welcome your questions later.
Thank you very much, Dr. Murphy. I'm now going to go to the Heart Foundation.
Thank you.
Dr. Latham.
Thanks. Thanks for the opportunity to appear today and add to the comments that we made in our submission. So since 1959, the Heart Foundation has been the charity working to prevent heart disease and improve heart health. At Heart Foundation today, we do continue this work across research, prevention, detection, care and support to help reduce the burden of heart disease in Australia. For many years, preventing heart disease is focused on reducing risk through behaviour changes, managing biochemical risk factors, but we now better understand that the risk of heart disease is also shaped by environments in which we live, work, learn and play, and microplastics and nanoplastics are now part of this environment. Being exposed to the microplastics are unavoidable. They're in our food, water and air, which I believe you've heard quite a lot about already from other witnesses. The tiny plastic particles have also been found to accumulate in human tissues and reported as associations with a range of different diseases. From a heart health perspective, we recognise that microplastics do pose a plausible risk to cardiovascular health. Over the last few years, there have been reports of microplastics present in cardiovascular tissues, and in some cases, this has been associated with a higher risk and greater severity of heart attack and stroke, as mentioned by Lisa earlier. While it's not evidence of a direct causal link, cardiovascular disease can really take a long time to develop. And the possibility of the microplastics and nanoplastics accumulating in our tissues from exposure every day throughout our lives, it really does make it a risk that's hard for us to ignore. We do see an opportunity for Australia to take a coordinated approach to reducing the health risks of the micro and nanoplastics. Australia does already have a suite of national environmental policies that are aimed at reducing the plastic waste. And these could be expanded, aligned, elevate human health as an equal priority, bring in explicit provisions for the microplastics, not just macroplastics. This could really create an opportunity to take action at the source, protecting environment and health, all heading the same direction from the potential harms. We also recognise that there's lessons learned from other persistent environmental contaminants, such as the PFAS, forever chemicals, the per- and polyfluoroalkyl substances. And that really tells us that we shouldn't delay taking this action when recognising a plausible risk, to health. I think waiting for certainty of a causal link could be a little bit too late to act. We also really see an opportunity for Australia to invest in long-term research studies to answer these outstanding questions about causality, dose, disease, as well as finding better methods to monitor microplastic levels and finding out which populations are most at risk, in addition to the information that we already have about priority populations. Over time, as new findings arise that address those gaps, plastics policies can be updated and strategies to reduce them can be revised to make sure that we're directing the efforts to the most likely sources of harm and to protect the health of people who are most likely at risk. So thank you.
Thank you very much. I'm going to go to Senator Askew to kick us off.
Excuse me. Thank you very much for your time, all three of you today, and for being here and for the submissions that you've submitted. They've been really informative and very well thought through, so thank you. Appreciated reading through those. I suppose I might just start in your final comment just about then was when you just said to update plastic policies. I just wrote it straight down because where do we start to update plastic policies?
I'm sure you'll also appreciate that we're a heart health organisation, and to speak to detail of plastic policy is probably slightly outside our remit. But where we do see the opportunities, we already have some information about the sources of microplastics. We know that a lot of them are from breakdown of macroplastics, so that's already a big indicator. We also know that some of them come from certain industries. I think it's natural to think about food packaging, and of course we just heard from that. But there's also road tyre wear, things like that. It's hard for individuals to make choices about that kind of thing, and it is a role for industry to make a change. And we already have this. I think we were really encouraged to sort of think about where we could align work on microplastics in the policy respect to other work that has the same goal. I mean, there's already quite a lot of work on air quality about particles from other sources. Microplastics are particles. If we can really learn what methods can help us better detect levels, understand what levels are dangerous, we can elevate microplastics in the work for clean air, for example. Again, I'll add that we're a heart health organisation. I don't want to speak too much to the detail there, but that's where we see opportunities.
I saw that as an opportunity just for us good advice.
Yeah.
So obviously a lot of your recommendations and so on go back to we need to do the research, we need to understand what we're dealing with, and I think that's a fairly common message that we've been getting through. But in the meantime, is there a strong case for action despite that uncertainty? Should we be actually making pretty good, strong recommendations now?
I think there's a strong case for action. I think probably it would be helpful. Of course, we would need to immediately start the long-term studies, but we may not learn about the results of those for some time. There is an opportunity, since there's information already out there, you're probably aware that the Heart Foundation does a lot of public awareness and public health education. The areas where we do that, we wouldn't really start doing that unless we had advice of what someone can do, at the individual level. We're not saying for a second that the only thing that should be done in Australia is at the individual level. But anything that can tell us more about how people can help their own situation, I think would reduce any panic, and the stresses that people already have from climate, as well as the long-term studies. And we don't know what levels are dangerous. Our understanding is that there may be research underway for better methods for detection in the environment and understanding that work. That would be... did you want to make a...
Yeah, I'll just add to that as well. Researchers are always trying to find gaps in research, especially early career researchers, PhD students, people trying to get into the research field. So if you start to make decisive action now, saying this is a priority area, those gaps will start to be filled by research. Then we'll start to have the long-term outcomes. Long-term outcomes obviously take a long time, but the more researchers we get in the field, we can answer these questions. We can fill in some of these gaps for you, which will then create stronger policy and then also have a stronger stance against industry or anyone that's potentially having pushback. So I think even though the research in the cardiovascular space is emerging, there are some established factors, there's some that are coming up, there are some that we know in animal models and lab-based studies. But if you do a call out, the researchers will come. If NHMRC or government funding can't sort of fund those projects, there'll be a trickle-down effect. We will start seeing those grant applications. So I think if you say action's required, people will come and fill those gaps, and that will be beneficial for all of us and then beneficial for heart health outcomes in the long term.
Just on your comment earlier there, Dr. Latham, about the communication and education process that you do, how would you see that happening? And that's probably also a question, I think, for Dr. Murphy as well, in that she might have wanted to add something to the previous questions. But just how would you see us communicating the risks to the public? Is that something that we should be being done through organisations such as yours?
I think as long as there was a clear action that people could take, I think that's just so central to our approach to public health education. So that's how you would choose the timing, I would think, is if you had strong evidence of what to do.
Yeah, and I can add to that. Anytime there's an emerging risk factor, we do try and start to populate our website, start to create a bit more information at a consumer level. But as Kath said, there needs to be an action that the consumer can do. Otherwise, you're just promoting fear. Mm-hmm. So then in the case of microplastics and nanoplastics, there are small things we can do around the house. Just this week from listening to all the Senate hearings, I've thrown out all the plastic and bought new glass containers. So there's little things that people can do. Yeah. It's like my bank balance isn't quite as healthy as it was before, but we can start to sort of push some of that small information without trying to promote fear. Emerging risk factors, they're emerging. We can say that, but I think we do need to empower the population of Australia as well. but not with full-blown risk factors. We don't know if this evidence aligns up with diet and lifestyle, alcohol, smoking. Maybe it will in the future, but just sort of dropping those little things that this could have an impact. So if you want to, make the change now.
Okay. Dr. Murphy, did you want to add anything?
Yes, thank you, Senator Askew. I would like to respond to both of those points. I think that the time for action now, there is accumulating evidence of the association between cardiovascular disease and micro and nanoplastics, although we haven't got that cause and effect yet. But given history of evidence about smoking, and now we're seeing vaping and the other plastics that has been actioned, if we don't take action now, we might be in a situation 10, 20, 30 years down the track where, if we haven't got on the front foot, a disaster will ensue. So in response to that, I think, we've got to be proactive. And then around the education, yes, we can all get rid of the plastics in our household, but the microplastics and nanoplastics are so ubiquitous in the environment that at an individual level, that's not really going to make the impact that we need to do. I think, we need to educate people about what's happening and what they can do. But as Danny said, replacing all your plastic with glass for somebody on a good income is easy, but for those that have lower resources, it's a really hard thing to do. So it's so important for the government to take leadership on this, because it's a whole of population level risk factor that we need to address.
And on that note, the environmental exposures is probably one of the key areas, which is probably what you're referring to. So how would we include that into the prevention strategies?
It's a great point, and I think it needs to be included in the prevention strategies, but not just the prevention strategies. So I mentioned in my opening, we need to take a health in all policies approach, which as a group of not-for-profits, particularly the ACDPA, is an approach we're very strongly advocating for. We can't just focus on health policies. It's got to be transport, education, housing, environment. So particularly for the preventative health strategy, we do already talk about environment. So, potentially expanding that to include microplastics and nanoplastics would be a good step.
Excellent. Do you want to add anything on the environmental policy side?
I think one of the main things we do have to keep conscious of is when we're looking at the environmental impacts, it's going to really affect those lower socioeconomic groups, the groups that already face health inequities. So we just have to be cautious that we're really prioritising those populations. And when we are educating, we're making it in an accessible way. When we're providing actions, we're not making it onerous on the end user, if that makes sense. Because like Lisa said, they're the ones that are struggling the most. We can't put the bigger burden on them. So anything environment, it's those people already facing inequities are going to be hit the hardest, as we know from what the research shows. So we just have to be conscious we're helping those people that need the most help.
We certainly heard evidence last week, I think, in regard to the producers needing to be the ones having the responsibility, which will have a flow-on effect. But in the meantime, it's certainly now, how do we deal with what we've got in front of us? So from your perspective, and especially from a heart and stroke perspective, should microplastics be treated as a chronic disease risk factor?
Yeah, I think the evidence is emerging. So I'd be speculating if I said 100% yes, but there is plausible mechanisms that it could be contributing to cardiovascular disease. But again, more research is needed. This type of research is also a bit more difficult to find causality because we can't do an RCT. We can't put people in a high microplastic and nanoplastic environment and see the difference. So I would be speculating to say an absolute yes, but we need more research to determine if that's true. And Lisa probably wants to speak to that point as well.
Yeah, I agree. It might have to be a risk factor with an asterisk, pending further information, which is not ideal, but, it's just going to add to more and more of these environmental risk factors that lead to chronic conditions, air pollution, microplastics is just another one. So tentatively, yes, but with an asterisk and with, yes, we need 100% need some more research, longitudinal longitudinal studies, etc.
I was going to say, what research is most urgently needed to address those gaps, but also would you support the establishment of a human biomonitoring program? It's something that's come up throughout the course of the evidence.
So, yeah, we need to understand what levels, first of all, because without knowing what levels cause harm, you can't then put policies and do regulation. So having some sort of body like that would be probably very useful.
And we need high quality longitudinal studies.
Yeah.
So this is, getting baseline data through standardised biomonitoring with baseline acceptable levels that we know of. We need this to be a diverse population as well. So across Australia, looking at people living in different socioeconomic areas, areas closest to the ocean, area closest to the metro areas, we need to be able to sort of look at all the different confounding factors and then study the outcomes at the end of the day. Because then we'll get closer to be able, there's the Bradford Hill criteria for causality, which is when you're looking at observational studies. We need to be able to get closer to looking at all those criteria being met. So I think a really well-designed longitudinal study with proper biomonitoring that's standardised. But again, looking at diverse communities, looking at those communities that suffer inequity as well, so we can then really tailor our policy and programs and interventions to help those individuals.
And to find other communities we may not already know about who are more greatly affected.
Yeah. So how would you identify those? I'm going to get the wind up any second.
I would imagine the environmental monitoring would be a good indicator for higher levels of exposure. That's probably.
I noticed in your submission you focus also on First Nations peoples as well, so that's obviously an area of concern in regard to how they would be impacted as well.
Yes, particularly regarding any additional cultural harms.
Okay. So I will hand back to the chair because I'm getting the look.
Oh,
no, it's all good.
It's not intentional.
Forward, I figure I needed to hand on.
Senator Raja.
Thank you, Chair. Just want to talk to you about priority populations, which you've kind of touched upon, but I'd like to draw you out on identifying these groups. Who do you think might be these priority populations who should be included in research studies?
So priority populations, firstly, would be anyone with worse health outcomes than the sort of what maybe normative data. So that would be First Nations communities, individuals from cold backgrounds as well, regional, remote and rural communities. I think we'd also want to look at individuals living in lower socioeconomic areas, individuals living closer to industrial areas. So if you're near a plastics factory, what's that impact?
Occupational exposure.
Yeah, occupational exposure. Mm-hmm. So if we look at, PFAS the PFAS studies, it's firefighters because they're exposed to sort of like the flame retardants. It's individuals who are around them, those PFASs that are having the biggest impact. So we'd want to look at those industries that are exposed to microplastics. But I think first up, looking at people that already have worse outcomes, because this could be a contributing factor, we don't know.
And it's a silent one, we haven't well researched it.
Exactly.
Do you want to make any comment there, Dr. Murphy?
I think the Heart Foundation gang covered that all, thank you.
Okay. You also mentioned, the need for longitudinal data, and we certainly heard consistent testimony that we should be looking at a national biomonitoring program. But do you feel that we have enough to act now on regulating plastics and their life cycle?
I'm certainly considering that they're cumulative and they're everywhere.
Yeah.
So from that respect, yes, I would say so.
I would agree. I think the emerging data is there, the mechanisms match up, the evidence is showing in lab studies. So I think there is sort of enough there to start taking action. And we've heard from people throughout last week and earlier, there's other areas, not just cardiovascular health, that have probably stronger data as well. So I think so.
Yeah. Can you talk us through the incidence and something about the epidemiology, of cardiovascular disease, so heart disease, stroke, for example, in young adults? and young people?
Yeah, so I'd probably want to actually take that on notice to provide proper stats and details. Risk factors are accumulating at a younger age. We see obesity and overweight, poor diets. So, generally speaking, you could probably see heart disease starting a little bit earlier, but I would want to take that on notice and provide you proper evidence rather than speculation just from what I've read in the past few weeks. So if I could take that on notice, that'd be great.
That would be great. Dr. Murphy, do you have anything to add?
Yes, there has been some evidence of recent times that strokes are happening more frequently to younger people. I stated in my opening that a quarter of strokes happen to those under the age of 65, and that instance does seem to be increasing. There's a lot of confounding factors, obviously, the sedentary lifestyles, the processed food, raising rates of obesity, which are all interlinked. So where microplastics and nanoplastics come into this is yet as to be determined, and there's still a lot of ongoing research. But I'd be happy to share with the committee the actual research, so you've got that to document.
That would be great. Perhaps on notice, that would be wonderful. Just going to your other recommendation, which referred to the N-Health subcommittee, I guess, of the Australian CDC. You did flag that, one, they should work towards developing national guidelines, I think, and there was a concern that this was perhaps, or their existing position was perhaps downplaying the possible risks to human health. Would you care to elaborate?
If you're referring to what we've spoken about in submission, maybe want to separate those 2 points.
Yeah.
So the second point about the potential downplaying was referring to the findings of the PFAS inquiry, where that was one of the findings. The national guidance by the N-Health Committee had listed the evidence showing that, but the recommendation was that it should be elevated slightly to recognise plausible risk of harm, which the current advice had not. And since that had that seemed as a parallel situation, and that committee would be well placed to, with that knowledge and that recommendation from that inquiry, apply that perspective, and then look at the microplastics data and be in a position of authority to provide national guidance.
Yeah. Dr. Murphy, do you have anything to add?
No, we didn't specify that in particular in our submission, so I'll leave it there.
Okay. And we've got the NHMRC coming a bit later. What questions would you like us to ask from them?
Have they considered doing a targeted call, perhaps?
We will be asking
research. Just, I guess, details around, what their plans were with respect to the strategy. That's what I would be asking.
Yeah. Okay. I think you've given us a bit of a heads up as to what communities to look at. Okay. I mean, I think we've heard testimony, it was in the previous hearing, that Australia is, quote unquote, relatively clean compared to a lot of other countries. And so perhaps trying to identify clusters in Australia is a bit more challenging compared to more polluted environments. So I think it speaks to international collaboration being important here as well. I don't know if you've got any thoughts on that.
I generally think in any research, the more collaboration, the better.
Yeah.
We work in such silos, we repeat research, we're wasting money in that regard. So any collaboration, especially if you can find countries that are really similar to Australia's demographic, but I'm always for collaboration because the mind, it's better than one mind, multiple minds.
Absolutely.
But,
Oh no! Just to add to that, I mean, if you activate the research community by investing in areas or calling for evidence gaps to be filled, the lovely thing about particularly the Australian research community, I speak as a former academic researcher, is that it's just internationally connected anyway. Everybody works with their international colleagues. Those networks are there and will be strengthened if you invest in those areas.
Yeah. Dr. Murphy?
I think that the other thing to add is if you take an international lens, you get more larger data pools, so you can pull that data together, particularly for something as nuanced as this. You need big numbers to get the significance. So I think that's very important. And I think, Australia probably has an opportunity here to be showing real leadership in this area as well by being proactive and getting on the front foot. So that's always a nice added bonus.
Yeah, okay. I think that helps us. We could definitely talk about preferencing international collaborations in this space, just given our small population size. I don't really have any additional questions, so thank you. You go. Yep, and then I'll tack on at the
I've
end.
got some questions from Senator Ruston as well. I just realised I missed a couple. She's sort of the exposure for younger people, so through even from birth through, could early life exposure contribute, do you believe, to long-term heart disease or higher risk to microplastics?
Speculating, but it is a cumulative exposure. So if you're exposed from a younger age and then you're living through life, but that would be pure speculation. So I can take that on notice to see if there's been any modelling data done in younger communities. But it's cumulative. So
it's a bit like we need the research on everything, but it's just another part of it. And the other one she had was, are there shared pathways between cardiovascular disease and reproductive health? So in regard to the microplastics.
I would have to, I personally have to take that on notice.
I think it still relates
that.
to the whole accumulation through life, I think, is really what it's starting from.
Yeah. I will look into that for you.
Just to butt in, Senator Askew, the Lancet countdown does talk about in utero exposure and then obesity. I think there are probably some epigenetic issues there. Sorry, thanks.
Yeah,
Dr.
Dr. Murphy has a hand up too.
Oh, yes, Dr. Murphy?
Oh, I didn't have my hand up, but I would agree that, the cumulative effect, but also neonatally, postnatally, childhood, those early childhood years where bodies are changing, potentially the impact of a foreign substance would have more than, say, in later life. So I think that would be something worth exploring.
Excellent. The only other question that I missed was, what are the long-term system costs of inaction? That's a $1 million question.
I think it's a multi-million question, but
I don't have numbers here on that.
Not in financial terms, but I think it's more about
I
the impact long term.
Yeah, I'm not a numbers person, but I think if it is a risk factor that is uncovered through stronger research, then it's people's lives.
Yeah.
It's disability, it's morbidity, it's mortality. But again, that is speculation because we don't know if it is, but more research is needed. But if it is, we're all exposed to it every day. We breathe it, we put it in our skin, we eat it. So I think it could have a big cost, but we just need to know more.
Sums it up, I think. Thank you.
I just have a final question, I guess, and I'm very conscious of the fact that not-for-profit organisations, you have a lot of work to do. But are either of your organisations doing any advocacy in this space in terms of pushing for more research, or is this inquiry sort of the first opportunity that you've had to sort of put that on the record?
I can go. Yeah, I'll go first. We are doing a lot more in environmental risk factors, but this is probably the first opportunity we had for a formal engagement.
And in regards to our grants and our research funding, so we don't do sort of specific call-outs, but that could change in the future, especially if there is a strong sort of priority topic. So this is part of our advocacy. There is a big, we are pushing for environmental change and environmental work because we know that is such a big sort of player in the cardiovascular space. But this is the start, and this is the start of something bigger as we get more information as well.
Dr. Murphy, did you have anything to add?
Yes, I mean, this has been our first opportunity, but we realise that this is going to be big into the future. And I think the other thing to say is the Australian Chronic Disease Prevention Alliance, which I'm the chair, will be looking at this very closely because it brings together ourselves, the Heart Foundation, Dementia, Diabetes, Kidney Health and Lung Foundation. So we've all got a very, very vested interest in this topic.
All right, well, if there are no more questions, can I thank both of your organisations and yourselves for coming along today, also for providing us with your submissions and being prepared to take questions on notice. All of your evidence is valuable, and I hope that in turn the remainder of the evidence that we gather as a committee and then the findings that we make are useful to you as well. I think it's the more we delve into this, the more interesting it is and the more slightly horrifying at the same time. It's that balance of not alarming people but actually...
Being alarmed.
Being alert but not alarmed, I think, is the previous thing. The committee will report to the Senate on Wednesday the 26th of May 2026. The committee has agreed that responses to question on notice should be provided by close of business on Wednesday the 15th of April 2026. And again, thank you so much for your evidence and your time. It is very much appreciated by the committee.
Thank you for the opportunity.
Thanks.
Thank you for the opportunity.
Okay, and the committee will now suspend briefly. We'll resume. Thanks, broadcasting. I now welcome to the next panel Associate Professor Green, Dr. Charteris, Professor Kirk and Professor Palanisyami. If everyone could come to the table, that would be great. Thanks, everyone. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, I'm going to ask each of you to state your full name and the capacity in which you're appearing today. And I might start online first. So I'll start with Professor Green.
Thank you. Yes, I'm an associate professor at the University of Melbourne with over 25 years' experience in reproductive biology, including the last 15 years studying the effects of endocrine disrupting chemicals, such as bisphenol alcohol phenols, parabens, and PFAS on fertility in humans and animals. I also have a joint appointment as the research director for Monash IVF, which is the second largest human fertility provider in Australia. I'm also on several science advisory boards, including Early Pregnancy Loss Coalition, Reproductive Health Australia, and Plastic Exposure Reduction Transformation Health Trial. I'm a passionate advocate for increasing public awareness, and I've contributed to 3 submissions to this inquiry, and I'm here today in a private capacity and should note I have no affiliations with the plastic or chemical industries. Thank you.
Great, thank you so much. Professor Kirk.
Thanks very much. My name is Martin Kirk. I'm a Professor of Epidemiology at the Australian National University. I'm sorry I couldn't be there in person today. I have been working for 20 years in government and about 20 years in the academic sector, mainly in the areas of food and waterborne infections, but extending out to environmental health threats as well. So I have conducted studies into environmental contaminants such as asbestos, PFAS, bromine, other chemical contaminants. I haven't done a lot of work on nanoplastics and microplastics, but I can certainly see some of the difficulties of working with those substances and their pervasive influences. I'm here in a private capacity and I have no conflicts of interest to declare.
Thank you very much. I'm now going to go to the people in the room and I'll start on my left.
Good morning. My name is Dr. Nicholas Charteris. I'm a research fellow at the University of Sydney, Faculty of Medicine and Health. I've worked on federal chemical policy in the US for the last 6.5 years. I'm currently leading a project as a consultant for the World Health Organization on reducing non-essential plastics and single-use plastics in healthcare. And I've also conducted a world-leading systematic review, rapid review on the health effects of microplastics, which I'll speak on today.
Great.
I also have no financial conflicts of interest to disclose.
Thank you. So my name is Professor Thawa Palanisyami. I represent Australian Plastic Research and Innovation Laboratory from the University of Newcastle, and it was established in 2016 as the first plastic-focused research centre in the world. And I also represent NHMRC, National Research Network, Healthy Environment and Life.
Thanks very much, everyone, and it's really great to have such a fantastic panel with such incredible expertise, so thanks for joining us today. I'm going to ask each of you now to make some opening remarks and then we'll go to questions. So I might start in the same rotation, so we'll start with Professor Green.
Great, thank you, and thanks for the invitation to speak today and have the opportunity to highlight a number of issues that I hope the inquiry are currently considering. First, when trying to establish the impact of xenobiotics, it's very important to recognise that setting the safe daily exposures focus on acute toxicity, ignoring cumulative and chronic exposure effects, which we know go across generations. In fact, animal studies show effects manifest up to 20 generations after a single exposure. Data in humans are, however, urgently needed on the transgenerational effects of xenobiotics. Second, toxicity studies often fail to show vulnerable populations are disproportionately affected, especially low socioeconomic populations who are not only more likely to live near sites of xenobiotic and plastic production, but also sites of disposal, such as municipal dumps, as well as working in blue-collar professions with increased occupational exposure. Therefore, I echo the need for the increased longitudinal and transgenerational human biomonitoring programs, and with particular emphasis on the inclusion of vulnerable and disproportionately exposed people. Third, there is a desperate need to increase the development and access to blood and urine tests for xenobiotics so these can be accessible by medical professionals and the public. Currently, measurements are only possible in a few university research laboratories or specialist environmental monitoring companies. These are also limited to just a few xenobiotics, not extensive panels, and are very expensive. Fourth, fund interventional studies to look at monitoring the health of individuals before and after the removal or reduction of xenobiotics and plastics to provide real-world evidence, especially as RCT-style studies cannot be conducted. Fifth, establish education programs in communities, especially vulnerable communities, and schools to provide evidence of how plastic and xenobiotic exposures can impact fertility. Also, ways to reduce exposures via simple changes in lifestyles and behaviours. These should be delivered by external experts, not reliant on already overly burdened teachers. In addition, the development and availability of fact sheets and guidelines. Sixth, the introduction of clear labelling in supermarkets on all food and personal care products using a single nationally recognised logo that is mandatory to use, either showing the inclusion of known xenobiotics or that products are totally free. Do not allow manufacturers to use their own ambiguous ones, such as BPA-free. Seventh, don't just focus on the sales and the use of plastics and products that leach xenobiotics, but focus on their correct disposal. The job isn't done once the product is sold, but the onus and the cost on manufacturers for the clean-up and disposal. This can also help to fund education programs via plastic or xenobiotics tax on industry and manufacturers, and notably on key distributors, such as supermarkets and fast food chains. And lastly, increase regulation and adoption of safe exposure levels in line with the EU, align testing standards and embrace the REACH programme to put the onus on the producers and safe standards, not the consumer to be left unknowingly exposed. Also, introduction of a single regulator with broader inclusion of products. Currently, food and cosmetic and personal care products have patchy regulations overseen by multiple agencies and regulators. Thank you.
Thank you very much, Professor Green. I'm going to go to Professor Kirk.
Okay, thanks very much. As I mentioned, I haven't done a lot of work on nanoplastics and microplastics, but I have done quite a bit of research into PFAS, per and polyfluorinated alkyl substances, which are definitely xenobiotics in that they're not intended for human consumption. I think it's worth making a few comments about plastics in that microplastics and nanoplastics in that their ubiquitous nature means that it's very difficult to conduct epidemiological studies, and I think monitoring the health effects in humans is incredibly challenging just because of the breadth of different chemicals and that are used to manufacture plastics, and also the chronic nature of many of the health outcomes. And we see that it's common when we're assessing the health effects of chemicals, unless there is a signature health outcome from an exposure like mesothelioma from asbestos, it can make it very challenging. So one of the things I would say about nanoplastics and microplastics is the need to actually take a focus which is very much toxicological in nature, and they do lend themselves to studying through those kind of means. So, you can actually set up experiments which are probably very informative. I think they're extremely concerning from a human health perspective just because of their pervasive nature. They're almost impossible to remove, really. So I think we have got a long way to go, but I do think there is a huge need to better understand the health effects of microplastics and nanoplastics and other xenobiotic compounds. I think, I think PFAS is in some ways exemplifies the difficulty in that many of the health effects that we do observe are often they're not very strong signals of health outcomes. They are for some, but for many health outcomes where we have concerns, say for instance cancer as a health outcome, the epidemiological studies are often inconsistent, and so it's I think very important to gather information from a toxicological nature, either in humans or in animals. So those types of studies are very important. I think I'll leave it there because I don't really have much more to add.
Thank you very much, Professor Kirk. I'm going to go to Dr. Charters.
Thanks so much. Fossil fuels are used to make a broad and diverse group of petrochemicals. Fossil fuel consumption and petrochemical production are more than 15 times higher than they were in the 1950s. Plastic and plastic-related chemical production can be more lucrative than selling methane and ethane for fuel, heat or electricity. Therefore, as plastic production is set to triple globally by 2060 with commensurate impacts on health, it's critical that timely action is taken to mitigate and prevent these fossil fuel and plastic-related risk factors for chronic disease. The largest proportion of plastic production comes from single-use plastics, and 98% of single-use plastics are derived from fossil fuels. Plastics are made with around 16,000 chemicals, for which only 4,000 are known to have hazard data, and the other 8,000 with very limited data. Extensive empirical evidence, including from world-leading authoritative reports, demonstrates hazards of toxic chemicals found in plastics, including endocrine-disrupting chemicals such as PFAS, phthalates and bisphenols. Despite the Australian government's divergent position to multiple world-leading authoritative reports and reviews on the health harms of PFAS chemicals, exposure to these chemicals and others used in plastics have been found to increase the risk of chronic disease, including cancer, neurodevelopmental harm and infertility. Furthermore, growing evidence points to health concerns from microplastics and nanoplastics formed when plastics break down into small particles or are intentionally added to consumer products. I conducted a world-first rapid systematic review that I mentioned on the human reproductive, respiratory and digestive health effects of microplastics for the state of California in 2023. This review relied on a systematic review method for evidence synthesis that's consistent with the best practice in the world, and we found over 3,000 studies to include in our review. We found that microplastics are suspected to harm reproductive, respiratory and digestive health, including male and female infertility, and are linked to lung and colon cancer. In March 2022, the United Nations member states adopted a resolution to end plastic pollution towards an internationally legally binding instrument, and that would allow for negotiation of an international treaty to end plastic pollution. During the World Health Assembly in 2023, 194 member states raised the issue, and Resolution WH76 was adopted to increase efforts to address pollution from chemicals and plastics, including through the Plastics Treaty. Most countries participating in the treaty favour addressing plastic pollution at every stage of the plastic life cycle. However, progress has been stifled by a coalition of oil and gas and plastic-producing countries and industry groups, which are advocating for a treaty focused on a flawed solution of waste management and recycling. To be clear, recycling is not a viable option and does not protect human health from the harms of microplastics, which break down from larger products, or the chemicals used in the plastic. After decades of promoting individual responsibility and recycling as a solution, the fossil fuel industry and its petrochemical partners are now facing growing public scrutiny and litigation for misleading claims that recycling is economically or technically viable. For example, in September 2024, California Attorney General Rob Bonta filed a lawsuit against ExxonMobil, alleging the company carried out a decades-long campaign of deception in which the oil and gas giant misled the public on the merits of plastic recycling. Currently in Australia, the National Plastics Plan outlines our approach to increase plastics recycling, find alternatives to unnecessary plastics and reduce the impacts of plastics on the environment, which involves working with the industry to phase out particularly problematic plastic materials, recycling and consumer education. It is unclear of the progress on this plan and if these targets have been met after I looked at the websites. In closing, I implore the Australian Government to take immediate precautionary public health actions to mitigate the harms of plastics, microplastics and the approximately 16,000 chemicals that are used in their production. That includes banning all non-essential single-use plastics without delay, which would require extending the current list of products on the roadmap for harmonising action on problematic and unnecessary plastics, require reporting, transparency and accountability on plastic production and waste, imports and exports, including their associated chemicals, adding health warnings and labels to plastic packaging so that the public can be aware of the health effects associated with microplastics and the chemicals used in their production, and finally increasing funding for NHMRC, or rather the NHMRC increasing funding to increase research on the health harms of microplastics and biomonitoring. Thank you very much.
Thank you very much. I'm now going to go to Professor Palasamy.
Thank you. And I acknowledge all my colleagues' points here, and they've been expressing their views based on their expertise and journey. And what I'm going to talk to you is regarding our journey in the last 10 years. So the evidences are from our own experience. So we started in 2015 in the name of Australian Plastic Research Innovation Lab. That time we were called EPIC Lab, Environmental Plastics Innovation Lab, but we have to change it. I'll explain later. So when we started, there was no single paper on environmental plastics in Australia in 2015. There's not a single paper, whereas UK and Europe already ahead. So we started looking at the literature, and we actually framed knowledge gaps, this wide knowledge gaps. And also we understood there's a fundamental flaws in understanding the plastic pollution. Number one, people always thought the virgin plastic is the plastic that is polluting. So we first brought to the notice that weathering of plastic is so important parameter that has to be considered. Because when plastics synthesized in the lab or factory, it's different. When it's entering the environment, that's where it's becoming more corrupt. So I always call plastic as a three-dimensional toxicant. So plastic can exert toxicity as a particle itself, and it comes with more than 15,000 chemicals, as Nick explained. And it can also attract and harbor toxic microorganisms. These three things were not considered in 2015. So we were the one first revealed that weathering is underlying basis for all the risk assessment if you want to understand the plastic risk clearly. So that was our first paper, and we started using the term environmental plastic because that's a reality of the plastic that you are seeing in environment and animals and humans. And then we looked at how actually plastic behaved in the environment. So we sampled around Australia in partnership with AUSMAP, Australian Microplastic Assessment Program, along with my good friend and colleague, Dr. Scott Wilson. We brought a national sampling methodology. What we want to do is work with citizen science and school kids, train them on hand-picking microplastics from the beach. And we trained more than 4,000 participants. And then we characterized more than 2 million microplastics. That helped creating a database. It's called Microplastic Hot Map. You can see how many sites in Australia with microplastics are there. Our Bondi Beach always ranking top in terms of number of microplastic. And then in our journey, then we introduced all the new risk-related information. For example, how plastics can accumulate cocktail of pollutants. And we ourselves analyzed and found out that all the toxic pollutants such as PFAS and heavy metals are in very high load. And it's not a laboratory spike study. And also we understood what is the basis of attracting pathogens. And then we moved on to how plastic break down over the time, how it's converted into micro nanoplastics. So over this journey, so we spent 5 years on completing 15 PhD theses on this. And as Nick explained, when I participated in National Plastic Summit, recycling was the loudest voice there, without understanding risk of recycling. So we completed 2 PhD theses on risk assessment of recycled plastics, and we became enemy of many recycle industries because we are trying to tell the truth. And we often get innovators coming to us, oh, we made a recycled cutting board. And then we ask, why? So that kind of knowledge gap was there. So we were upfront and saying that you can recycle responsibly, and we have to understand the science. And then 2022, we partnered with NHMRC HEAL. We were invited to be part, and we wrote a good program on plastics and human health. And with limited money, we started working on how to actually develop tools to measure plastics in human biospecimens. And now we are sitting in this room, and one of the reasons was our study in 2018. And we were invited by Geneva Environmental Network to set up the framework for global plastic treaty. And I was one of the keynote speakers. In 2021, I was invited by US National Academy of Science to deliver a keynote on plastic and human health because we estimated the mass of plastic ingested by human first time. And US Academy of Science was interested in that. And that was the eye-opener because we were questioned on, oh no, there's no plastics in human body, but we provided the data. The scientific community already is proven that the plastic is exposed through all sources. So this was the journey, and now we are in a stage to take a decision and policy. And what we want to present here today is, number one, establish a global biomonitoring program, or at least for Australian National Biomonitoring Program, so that it sets the benchmark for what to target. And in parallel, we should work on prevention. And everybody talking about we don't have evidence, and there are some people asking more evidence. What is more evidence? Mortality or cancer? We will not have time to cure all that. So we should stop the flow now and establish the benchmark, and also work on redesigning for health. And there is always alternate. We were living without plastic, healthy life. And we take knowledge from our indigenous community, and we work very extensively with our indigenous community to take our knowledge and better redesign plastics. And just last point, why our lab changed to Australian Plastic Lab from EPIC Lab, because we felt the need that we need a forensic style of analysis lab, and we actually spin off analytical lab to do all this kind of work, and there are work that you can't do it under academic setting. And that lab has the capacity to analyze all the environmental matrices, and also we want to support the innovators in terms of innovating new materials, that some of the materials I brought it today. We work with the innovators and startup companies on how better design. That was the lacking part. And I believe if plastic is invented today, it wouldn't get past the approval, but it got passed. So we don't want to make the same mistake. So we want to work with the innovators from the start, how you actually redesign, how you set up the criteria for the material's end of life. Thank you.
Thank you very much. Really interesting opening statements. So I'm going to go to questions. I'm going to start with Senator Askew.
Okay, well, I'll start at the beginning. We'll go back to Professor Green. You've given us quite a list of things that you would like us to look into and to put forward as recommendations. So I just wanted, first of all, I just wanted to elaborate a little bit. You talked about the blood and urine tests that are available. How readily available are those to the community at this point?
They're not actually very available at the moment. They're only, for example, PFAS. Really, many of the labs that you may be able to access for a large fee only measure sort of up to about 9 of the standard PFAS, nothing like the sort of 15,000 that are currently there. So they're not readily available to medics, for example, if someone came in to ask for an assessment or to do that. So there are specific, as I said, environmental companies that do offer those, but they're extremely expensive and not regular access to normal general public.
So do you see that there is a benefit, though, for especially the GPs and the medical community to be able to test at this stage, or is it too early for them to be looking for something particular?
Well, I think it goes twofold. First, it allows the patient to understand, person to understand in terms of their exposures and whether they can do something to reduce them. And also it provides data maybe nationally in terms of us getting data on our population in terms of some of that human biomonitoring. So I think it would be useful to do that. I guess the difficulty comes around that there aren't sort of high and low thresholds that we can educate the public around if you're above a certain level that that's dangerous or not. So it would require us not just providing the access to the test, but also caveating and providing information in a excitable way that what exposures mean and what we can do about them and what we can't do about them. But I think it would be really useful for a lot of people, especially I'm dealing obviously with fertility couples. They're very keen to understand some of their exposures and ways that they can improve their health in terms of trying to conceive as well.
And obviously that leads into the biomonitoring, human biomonitoring that I think we've got universal agreement across all 4 of our witnesses today about. That you've also touched on labelling. What would you be recommending is labelled, and what would it be identifying?
Yeah, from my perspective, I mainly work on xenobiotics, so not so much micro and nanoplastics, but as you're seeing going on the supermarket shelves, you see lots of different labellings in terms of BPA-free, and I think obviously the inquiry I've heard around how that may mean that just because it's BPA-free, it's not BPS-free. So I think there's ambiguity in terms of how that's being used, and I think the general public could benefit from having a single national logo, either stating it's free or just having a way in which we can easily show them that there are some chemicals in there that are probably harmful to them and with good evidence.
And we've heard a lot of evidence over the course of the hearings that we've had already about the fact that there are so many chemicals and toxins within it. So how would we be able to actually limit or give some identification to what we're putting into that sort of labelling and warnings?
Yeah, good question. I haven't really thought directly about that, but I suppose it's ones that we have extensive evidence for in terms of, in this case, obviously fertility we're talking about, but as a lot of the colleagues have highlighted, it's far wider than that. So whether or not there's some sort of simple framework that we can have to communicate that, that there are alternatives out there, and that basically that these companies are not using them, so we need some sort of logo to warn people. But yeah, I haven't actually thought about that.
Okay. The only other thing you talked about, the public awareness campaign. What would you see that how being presented and how?
Yeah, primarily I think the lack of people's understanding specifically around fertility. So I teach obviously a lot at university, and a lot of people really have no idea about their fertility and how it changes over time. And specifically, I think we need that education start a lot earlier in schools. And to be talked about generally in terms of what the capacity is, but also how much our environment can affect our fertility. So really sort of tailoring the programs to the age level that we're providing that to, but again, providing lots of robust information that we have evidence for, and also importantly, probably more around what can we do about it rather than just an awareness campaign, but also sort of fact sheets in terms of easy ways that we can avoid the current plastics that are in our environment and reducing exposures in terms of, not heating things in microwaves if they're plastic, or not drinking out soft plastic water bottles. So really easy things that schools and vulnerable communities can take on board in their everyday life, so it becomes really tangible to them in terms of how they can really make a difference.
Thank you. I'm sure that the other witnesses would probably like to comment on some of those questions that I've asked just then, so I might just open it up to the other three if any of you would like to add anything before I go to other more specific questions to you.
I'd just comment regarding an approach with informing the public of potentially hazardous materials. The Department of Toxic Substances in the state of California has a safer consumer program whereby if there are chemicals that are identified as being hazardous, they can be put on a list of priority products, or rather chemicals, and they then the manufacturer has to then either look for an alternative chemical to use in the product, or a warning is made and put in a public position when the chemical's either used in a product or if it's been used in a facility or a shop. And so I think that's an approach that we could be using here if there is evidence around harms of chemicals that are being used in products.
So that as in plastic products that are being produced, that
Correct.
would actually be one of the warnings.
They may have chemicals in them of concern like PFAS, phthalates.
Okay, excellent. And I noticed that Professor Kirk's got his hand up as well.
Yeah, look, I just wanted to comment on Professor Green's comment about making testing available for some of these compounds and materials, and I'm really not convinced that's necessarily a good idea unless there's something people can do about their exposure. And a good example is PFAS, where if you get a PFAS test, you can't really say much about the diagnostic value for your health effects today or the prognostic value, so what it might tell you about your health state in the future. And we've done a lot of work with both people who've lived in highly exposed areas and clinicians working in those areas, and it really leads to more confusion than anything else, I think. And I do support testing in the context of epidemiological studies or very highly exposed populations, but I think we've got to be very careful when we recommend testing. I do think there's a really important role to play for biomonitoring and for things like the Australian Bureau of Statistics National Health Measures Survey, where they recently did some reference testing for PFAS across Australia. So that could be done for some of these other compounds as well, where they're shown to have sufficient public interest and importance from a health perspective.
Excellent, thank you. I might just go back to Dr. Charters while I have just a couple of quick questions in regard to what you raised earlier. You were talking about legislating the chemicals in plastic. So it relates to what you just said then. So how would we go about that, and what recommendations do you think we should be looking to put forward?
Yeah, so currently the main issue we have with plastics and understanding what's in them is that there's limited transparency. So there's limited requirements to report what chemicals are going to plastic products. So we have little to no idea what we're actually being exposed to. That's the first issue. The second issue is most of the chemicals that we're being exposed to have been passed through regulatory agencies with little to no safety data. So we don't know if these are actually safe for humans to be exposed to. So we need to rethink how we're regulating the chemicals, first of all. So we need to have sufficient data on every chemical that comes to market. There's a push globally to use less and less animal data at the moment, and there's a move to use more in silico and in vitro data. And that's obviously going to limit the amount we will know about these chemicals that have been used in plastics. So I think that's the first thing we need to be thinking about. We need to improve the regulatory system on the chemicals. The second thing is if the supplier or the manufacturer can't tell us what chemicals are in the product, so if we don't know what chemicals are in the plastic product that we're being touched with, there should be a health warning that we don't know what chemical compounds are in there, because there could be PFAS chemicals that could be hazardous and we don't know about, phthalates, bisphenols, things that are known endocrine disrupting chemicals. So it's not good enough for us not to understand what chemicals are in these products, and if we don't, we should have health warning labels on them to incentivise those manufacturers and the industries that are making these products to list those chemicals so we're at least aware of what's in them.
So you're talking about plastic, like PVC pipes, things like that.
Food packaging.
What about things like where we've got microplastics in things like makeups or fertilisers and carpet and all the other...
We should be absolutely banning them. There should be no functional primary use for microplastics. We don't need them in cosmetics. We don't need microplastic nanoparticles in consumer products or in products generally unless they're essential, and they have to be demonstrated to be essential, like a medical function. And unless that can be demonstrated, we do not need those products in the environment.
Okay. I'm just thinking to what you just said then with the medical aspect of that. How would that work they drips and stuff all come in plastics? What other alternative products are there out there that would be able to be replacing those? That's
an excellent question. There's a lot of work going on with this at the moment, looking at how we can change essential plastic products in the healthcare system that may have chemicals that we know that are harmful to human health, like PFAS and phthalates. But there's also a lot of work, as I mentioned before, that's been done across different health systems and the World Health Organisation to look at how we can reduce non-essential, single-use and plastic healthcare products that are being used. So just thinking about larger products that are typically used like a gown or a face mask that has basically over time the belief that it reduces infection, but there's little empirical data to support that. There's a lot of work being done to say, let's rethink how these products are being used. Can we make them reusable? Can we find alternative materials to these? And just basically look at low-hanging fruit and see if we can reduce the amount of plastics that are being used in the healthcare system. So we can do that across a broad set of areas, not only health. We can be thinking about, just in terms of consumer products. Do we need these? Are they essential? And if not, can we find alternative materials?
And what incentives do we need to be offering or providing to people? Or I think you talked about it. I think Professor Palanasimo, sorry, pronunciation. You mentioned, I think, the innovation support for innovators. So what do we need to be providing in this space to encourage people to come up with these ideas?
So I'll just start from next one. So in terms of medical plastics, and it's a Pandora box. I opened it and I closed it now. The reason is we went too far. So PVC, most of the medical plastics are PVC. And we all know more than 50% are plasticizers.
Yeah.
And the painful truth is, we all go through this. Even NICU, children, preterm birth, everything they have to go through. And these plastics, the healthcare professionals don't have any idea of the composition of it. They may have an idea of PVC. They may not know how much chemicals in it. And parents don't know. So the transparency is missing. But 100% there is an alternative, surely alternative. And in Australia, I brought a mass sample here. It's fully compostable mass sample, Australian innovation. And it's we're struggling to get it through, and now they are about to bring it to Australia. And that's a compostable mask.
So what is it made of? It's obviously got no PVC.
No PVC, it's a plant-based polymer. It was invented by a nurse who was working in Westmead Hospital, and she won a National Innovation Award in Parliament last year. But some of the innovators, they have ideas and technologies, but they needed a hand-holding support to get it across. So that's one of the examples. There are other things, and like my colleagues explained, there is a myth, right? Whatever wrapped in plastic is clean and sterile, which is untrue. I work with Dr. Stanley Chen, who advocates for plastic-free healthcare. You know, you can get away with the continuous sterilization. You can get away with, you can have a better medical equipment. Of course, there are some things inevitable. Still, I'm sure if you open up, there are products. Yeah. So there are actually equally good alternate, better alternate. But healthcare need bit of adjustment. They may have a budget limitation of, buying power and all that. They have to work with government or you all have to give a comment. Okay, there is an equally good alternate, and can you increase the budget to 20%? I'm sure as a parent, I will be happy to pay for healthy alternative than settling on the petroleum-based plastic with unknown chemicals.
You wouldn't know that wasn't the same as what we've had previously. I'm very conscious that I'm taking up a lot of time, so I've got lots of questions, but I'll hand back to the chair and let her allocate elsewhere.
Thank you. Senator Nandaraja.
I'll start with you, Professor Palanisamy. Can you just talk us through recommendation 2, stop the flow? Now, we, supported the Global Plastics Treaty. It was kiboshed in the end by the fossil fuel generating countries. The Lancet Countdown is saying that Saudi Arabian oil company plans to channel about 1/3 of its oil production into plastics and petrochemicals by 2030. That is 4 years away. And Shell has also opened up a plastics plant in the US. We are up against it here. What are the next steps? I mean, we can't let this go, obviously, given the scale of this problem. And we can't really put the onus on ordinary Australians. It's got to be upstream. Right? I agree with you, we have to stop the flow or reduce that, turn that tap down. And I feel like there's a really important piece here between, as you said, the citizen scientists, right? Bringing in, co-opting civic society in partnership with the scientists. So I might start with you and then we'll go around to everyone.
That's a good question, very important question. I think that's where the policy decisions should go, in my opinion. So all the plastics that are problematic and toxic, we don't need it. So stopping them is not a big deal. Only thing, we need a cross-sector support. I always think marine science, more than 200-year-old. In 1890, I still, it's puzzling me. How come we missed spotting plastics in the marine environment 200 years ago? Had it been spotted, we wouldn't have reached it this long. And even my, role model, Rachel Carson, at Silent Spring, when she revealed about DDT, she was a, marine ecologist. That time, 1965, plastic was emerging. So it was too late. I feel we were all traveling in different directions. So scientists, industry, and policymakers traveling in different directions, either deliberately or, without meeting each other. But stopping the flow, there are so many unwanted plastics. And even educated companies, how the hell it got into my life? I'll give you an example. Until we published in 2020, glitters were not even considered as microplastics. Wear it whole day, we live with glitters, and it's a metal, aluminum coated plastics in it. And in the analysis, that's a headache. The only way to get rid of glitters is washing. Goes to wastewater. Wastewater plants are not designed to capture microplastics or PFAS. It designs to capture nutrients. And then you end up in recycled water or end up in the marine environment. And these tiny glitters can get back. This is just one example. And artificial turf. Why do we need artificial turf? Shedding thousands and millions of micro nanoplastic. And so many things, easy decision. And there is equally good alternate. And the healthcare cost of replacing, it just simply cannot equate. Even if you're talking about replacement, the consumer will always ask for, is it cheaper? But science, normally we explain, you're paying for the total environmental cost, not for the product. If you really want a product cheaper, here it is. But here is the, hidden criteria that you do not know. So that's why the stopping the flow is, we already have national plastic policy and the list of items, and every state is actually banning top 20 items, and South Australia is ahead of anybody else, banning straws and balloons, and glitters now included in New South Wales. So there's already momentum, but we can't afford to delay. We are already late.
Yeah,
I'm in the European Research Council Allied Review Panel. In the last 5 years, I get to review a lot of proposals. I'm seeing huge money invested on it. We have a lot of evidences. So we are already late, so we have to act quickly. And industries won't be affected because they have other alternatives they work on. For example, some of the plastics innovations that can straight away fit into the existing plastic industry and machinery. So they can get on with the, guilt-free manufacturing setup.
Would the other academics like to comment? Are you happy?
Martin, I don't know if you're going to unmute yourself. Looks like you were.
Yeah, I just, for me, I really think that the health effects, while we're all talking about health effects, I think they're not as clear as we might make out. But I think the environmental contamination is the angle we need to take. And I do agree that we are really up against it when you've got an industry like the petrochemical industry. I think what we have seen in most industries where there's a vested interest that involves lots of money, they behave badly. And so here I think it has to be multi-pronged. I'm just listening to the discussion around the hospitals and getting rid of plastics and single-use equipment, and I see the opposite side of it as well, where you, in low and middle income countries, where you get repeated outbreaks in NICU because people are reusing single-use devices and they have tragic outcomes. So, I think we have to have the alternative that's readily available. And also we find that consumers don't actually know that products they're using actually have a plastic coating on them that degrades. So I think it's really challenging by virtue of the fact that these compounds and materials are ubiquitous. They're on absolutely everything. And so the environmental catastrophe is one very key way we can communicate that to society and the need for alternatives. But I do think it's very challenging. I do think there's the need to do health research alongside it, in particular, as I mentioned before, of a toxicological and a biomonitoring approach. I think it's possibly amenable to things like clinical trials here as well, because we have people who are naturally exposed every day to these compounds, and you can actually get a group of people that would volunteer to be not exposed and look at health biomarkers in those groups, and it's definitely amenable to that, even though they're very difficult and complicated studies to conduct. But I do think we need more evidence, but in the meanwhile, I think prevention is key. Has been advocated, which is all about the providing alternatives and starting to put out the publicity that we should shift entirely away from plastics.
Professor Green, did you have any comment, or am I?
Just to echo that, I think it's a two-pronged attack there in terms of how we can maybe stem the flow. Firstly, I think in terms of the current products on the market, it's probably around some sort of penalty or taxation, where the bottom line is if we pass the cost on to the consumer, they're not going to consume it. And so if we can have some disincentive by increasing cost, and then on the other hand, of course, supplying and benefiting by supporting alternatives, as we've heard from the colleagues here today, to replace them at a lower price point, then the consumer dollar will actually ultimately drive where there's supply and demand from some of those bigger companies. So I think that's really important that we do that two-phase effect, and really when it comes down to it, it all comes down to money and the consumer. And if we can get them to drive the decisions, then alongside and coupled with regulation, hopefully that will work.
Just two very brief comments. So I just want to, just on Martin's point about not having sufficient evidence, I just think we need to be very careful because the evidentiary bar to bring chemicals to market is very, very low.
Yeah.
Little to no safety data.
Yeah.
We then all get exposed and it's the burden of proof's on us to find out whether these chemicals are causing harm.
Yeah.
They also have cumulative impacts. There's 40,000 industrial chemicals used in Australia and they could be acting on the same pathway, but we don't test chemicals for cumulative impacts when we bring them to market, if at all. So that's the first point. The second point about incentivising changes, extending, I think Mark mentioned it before, extending the producer responsibility and polluter pays principle. The externalities of these products is a huge issue. The fossil fuel and petrochemical companies make them. We pay for the environmental and human health impacts. And so we have to pay for that. So we need to explain that to consumers that we're paying and bearing the costs. But to incentivise these industries to change their practices, we need to put the responsibility on them for the clean-up and the healthcare costs.
Yeah, no argument there.
Thank you. I just want to add one comment. Yeah, Nick is right. So health is environmental. And we have to recognize that. And what we are seeing in the water and food chain, it is in our body. So we have a convincing data, there is no doubt that occurrence and distribution exposure is established. And the policies and in terms of reducing and what kind of labeling, Europe actually already established that some of the products should have a tox-free labeling or plastic-free labeling. Right. So it's compulsory. For example, those who are importing textiles, they should, if they have a plastics tags, 30% tax. But they still haven't touched the polyester, so that's still a plastic, but at least a step forward. So if we just focus on plastic, it has to be plastic-free labeling. I don't think 10 plastics allowed, or we will never reach that one. And again, cumulative effect is, that's what missing. And if you just target one chemical or one particle, as I explained at the start, microplastic is a three-dimensional toxic and it can attract or release various levels of chemicals and other hazards. So it has to be a cumulative effect. And another thing, when we talk about biomonitoring and human health, very important to understand, we have to follow European approach. They take cross-sectoral approach. If you don't understand, even if I'm a doctor, if you don't understand microplastics in compost, I wouldn't be able to interpret the data, what I'm seeing in my vegetables or in my body fluids. So we need to have a knowledge on the cross sectors. Then only we'll be able to get a better data and we'll be able to interpret, okay, my backyard garden compost contains more than 2% microplastics. And then what is the uptake? I need to know the knowledge of it and then what size it can cross. And then when I monitor body fluids and organs, then I'll be telling you, it makes sense. So we are reviewing and in the final stage of submitting a paper on micro nanoplastics in the heart muscles. And the data, you know, I'm still not convinced there is a nanoplastics in it, but there is. And so, but that's because I've been seeing plastics in every steps. I've been hand picking. I train my son to hand pick microplastic when he goes for playing. So then I'm saying, yes, definitely. I've bitten plastic when I was eating my vegetarian meal. I found plastics in my son's breakfast cereal. So I know, yes, it is possible.
Can I turn to the innovation that you talked about in your third recommendation? And I've just got some of the materials I guess you've given us.
Yeah.
So this is a biodegradable mask?
Compostable, yep.
Compostable mask.
Yeah.
What are the, how was
So
this?
I just want to clarify. So biodegradable term is actually not appropriate to use. It has to be compostable bioplastics.
Right.
So biodegradable, it doesn't mean it's safe. It can release microplastics. So compostable means it will convert into non-toxic form like carbon dioxide and water.
So this is one of those...
Compostable.
Compostable,
But
okay.
in healthcare sector, composting is not an option.
No.
It may be with blood, but it's just giving an opportunity to move away from petroleum plastic. So it will not have those 15,000 chemicals.
And then we've got these credit cards, which are recyclable, sustainable, biodegradable. Is that right?
Yeah. So we worked with American Banking Corporation because it's not really a environmental pollution problem, but they generate around 1.5 tons of plastic PVC waste per month, and they want to reduce the use of petroleum plastics. And each credit card that we have, it has 9 layers of PVC. So we took the opportunity to redesign, and now they are in a commercial stage of introducing green card. So the green card will be based on seaweed, and so as that straw you have, that's a seaweed-based straw.
Right.
So when straw ban happened,
So there's no plastic in these cards?
the grey one have no plastics.
Oh, so
Yeah,
that's this is made of seaweed.
Yeah.
Oh, that's fascinating. So this is a bioplastic.
Yeah, exactly. Yeah.
Oh, that's fascinating. And then we've got this thing that
That's
says
PHA, polyhydroxyalkylate.
What is
that's
that?
That's a PHA polymer, polyhydroxyalkylate. That's only marine biodegradable polymer.
Marine biodegradable.
Yeah, that's only marine biodegradable. All other polymers will not.
Okay.
So this was extracted using bacterial metabolism. So we supply the carbon source and then...
And what would be the use of this?
The straw you have, we can make.
You mean this?
Any of the materials you can make. Only issue at the moment, it's expensive.
Yeah, that's okay. We can overcome that. What about this?
So you couldn't guess? So that's a whippersnipper card.
Yeah, we thought so.
That's a deliberately manufactured to release micro nanoplastics.
Yeah.
The only way you're replacing it, cutting, chopping.
Yeah.
So this was when I worked with New South Wales Independent MP Greg Piper 10 years ago. His hobby was collect this broken whippersnipper card around Lake Macquarie. So he met me for coffee and said, can you do something to it? It's not easy to replace. It's a monofilament.
Got it.
So one of our industry partners helped, and now we are doing a trial. So this again seaweed based, with the intention that in case it gets into the marine environment, it become a feed. And this also can be used for horticulture applications as well.
And what is this?
Those are all films. The mulch films and bags, many things you can use. That's another industry partner, again, Australian Innovation.
Yeah.
And see, they come to us to cross-check whether this is safe, whether at the end of life, what their intended purpose of end of life, whether it's compostable or bioplastic, whether it has any toxicity. The Australian bioplastic standard, one of the strictest in the world, so it has to pass those standards. So our lab is the only lab in Australia is actually certified to test this kind of product. So that's why I brought these things.
So I did a PhD on fungi, so this is my favorite.
Exactly.
Can you talk us through this?
So that's a mushroom packaging. It's our own innovation.
Right.
So we use agriculture waste and grow. So you can make various innovative stuff. So this is one of them. This is our lab test tube holder. And you can make pots. You can easily get rid of that black plastic. So we work with Lake Macquarie Council on native plants, bush regeneration. So we make the box. We want to make.
Are these Australian innovations?
100%.
Okay,
100%.
so there's a huge opportunity here for our Australian innovators, scientists, startups to take these to market.
That was the whole purpose of bringing.
This is very interesting. Thank you so much. We have put out a new strategy, Ambitious Australia, which is focused on how we catalyse this kind of innovation and get this out there into the market. So very exciting. Thank you so much for your testimony.
I just have a couple of questions. I'm conscious of time. I think, as we've heard in evidence that you've given along with other submitters, we are up against it in terms of big petrochemical fossil fuel companies. And it would seem to me that one of the ways, as you've said, that we need to actually help make the shift is for people to understand the impact of these things and to move away from those products, because if people won't buy them, then it takes away the market. I guess I'm interested in your thoughts around because some of the people who have given evidence have also said, we need to balance, alarming the community versus actually educating them. I guess I fall on the side of people have a right to know, but interested in your thoughts around how do we balance giving people information, noting that there will be some people who are able to take action in ways that others can't, particularly depending on your level of economic security, for example. So just interested in you all expanding a little bit more on what you think are the best approaches to start off with, so that because we've got to have community demand, right? So you can't have demand if people don't know, but how do we balance those things? Who'd like to go first? Maybe I'll just go around the room. So Dr. Charters, if you have any thoughts on that.
Yeah, excellent point. Thanks, Senator. I think I agree. People
deserve the information that we have so that they have some agency. But obviously the challenge we have often is that there's disparities in the exposures and there are limitations in how people can take action personally. And this is why upstream measures in government intervention is so critical, because this is a question that will often get asked by journalists. So what can people do in their homes? So certainly there are some things people can do, and we should be informing them of those strategies, and also think about incremental changes. So in populations that may not have the financial ability to remove all plastic products from their house and to move to safer alternatives, talk about a strategy over time doing it potentially to limit exposure. I think public health awareness campaigns working with grassroots and community organisations is critical, similar to what's happened obviously with climate action and also with smoking. I think we should be thinking about what we did with smoking in terms of a suite of public health approaches, because if people can understand that there's a relationship here between the industries and the potential health effects on these, I think that helps people understand that there's a need for change. But again, I think we just need to be careful with the framing of this, where we don't want to say that this is on you to do this, because otherwise that's what industry wants. They want us to, again, to be the ones responsible for the clean-up and for obviously trying to mitigate the harm. So there's some ideas, but I think we just need to be very cautious with the framing.
It occurs to me, Professor Palasami, that actually seeing these products, and thank you so much for bringing them along today, that in itself is very powerful, right? Putting in front of people the alternatives. So I wonder whether an education campaign about the alternatives and therefore people putting pressure on government to make those alternatives available.
That's spot on, Senator. We can't wait for government to take decisions. It will happen at its own time, but as a responsible citizen or responsible parents, we should start. So I started from my home. It is too difficult to buy plastic-free pillow. It's extremely rare to buy a plastic-free mattress. So I spend a lot of money in buying that. That's number one. And getting rid of lunch boxes, getting rid of water bottle. That is the strength of plastic. It just came into our life without even we realized. Everyone has a doll in our body. It just came into our life without even we blinked. So that is the danger of this one. And then it will affect our health. It is affecting our health. It will affect our health in a much worse way if we don't act on now. So we can start few things that within our capacity, but absolutely agree. We can't shift the blame on consumers. We didn't ask for plastics. It just thrusted upon our life. So it's actually it's easy blame game. Industry wanted. Petroleum is trillions and trillions of dollars of industry. We are fighting against a massive mafia. And the thing is, the shifting blame on consumer, you can have a proper waste management, that's all just blame game. So it should be a parallel action, and we try our best. We are small player compared to petroleum industry, and then government level there should be a advocacy. And Australia is actually well positioned to lead this change compared to any other countries, because we are not landlocked. We can say no to many things, and we have a huge agriculture and other bioresources to tap into in terms of designing alternatives, and other countries don't have that luxury.
I feel like we should take this bag of products round to every MP in the building and actually show them what's possible. I might open it up as well to Professor Green, and then I'll come to you, Professor Kirk.
Thank you, Senator. I was just going to echo that and say that obviously the education programs that I sort of suggested, I know that as soon as my kids come home from school, they start talking to me about that. And I think that's the great way that we can get out into the community through school activities, making them fun and educational in terms of showing them the replacements. Kids learn much better by visual means, as you know, you're a teacher. So I guess I think a combination of information, but also activities, showing them, hey, don't put this bottle here, use this bottle, use this type of material, practical things that we can do that aren't very prohibitive for some of those communities, are really, really effective, and really ensures that the campaign will be successful, as well as, supplementing that with obviously NGOs and other community groups who are obviously advocating more at sort of the adult level. But I think if we're going to make change, let's make change in the younger generation. Let's educate them about alternatives. Let's educate them about some of the negative side of the current plastics and the industries that produce them. So, and alongside that, of course, as we've talked about, taxing, or at least having some disincentive for that, means that as a parent, not only am I hearing from my children that this is such a great thing, but when I go to the supermarket, guess what? It's cheaper than, of course, the one that I already think is bad. So I think that's critical, and if we can get those school programs in early and also couple that with fertility, because people really don't make that connection between fertility and exposures to environment, and that's so surprising to me, but it happens all the time.
Professor Kirk.
Yeah, look, I think the question of how to make change regarding alerting versus just raising awareness is a really tricky one. I think we've already heard about how ubiquitous plastics are, and it isn't something that's happened overnight. It's been going on since the 1950s. And so, you know, we have stuff in our house in Tupperware in the 1970s and 80s. And so I think the challenge is huge. I do think that the health effects, we do need to, if we want to make the case that these are a health problem, we need to get better evidence. You know, despite the fact they might have been made out of nasty chemical precursors, their bioavailability isn't necessarily as convincing. You know, sure, we can find plastic particles throughout our bodies, but ultimately we're going to have to convince public health professionals as well, who would have to support these kind of programs. And I can tell you, having dealt with PFAS, that that's not the case. There are many clinicians and public health professionals that don't think they're the kind of problem that scientists working on it do. I think
the onus is on us, the government and legislators.
Yeah, and I totally agree. If you want change, you have to make the cultural shift, and you have to make it so that plastic's seen as a second-class option, and other things, other materials are prioritised. You have to, you know, you couldn't rely on government, because government's an ineffective tool to be able to make kind of those societal changes if we want to keep pollution out of, plastic-based pollution out of environment and out of human and animals.
I have two questions on notice.
Okay. Well, do you want to? Senator Nandarajah has a couple of questions on notice, and
just
then I might finish
on
up.
notice. Thank you, Chair. Dr. Charters, your rapid review, is that published?
It is. It was published in December 2024. I'm going to submit it as part of my...
that would be great. And the list of innovators who created some of these products, would you be able to provide those innovators' names to us so that we can perhaps have a chat to them and find out what their... I'm sure they're going to be having issues with scaling their work up, so it would be great for us to have a more fulsome discussion with them. Thank you.
Look, can I say thank you so much for all of your evidence and your expertise today, and being very generous with your time. I also want to thank you for showing us something hopeful. I live in Gladstone in central Queensland, and I went to the Central Queensland University project in Gladstone, where they're actually doing stuff around alternatives for plastic, and particularly around netting and stuff like that. So it is really good and positive to see something positive out of this, especially when a lot of the evidence that we're hearing is quite alarming. So thank you very much for your time. Thank you for your submissions. Thank you for being prepared to give us more information on notice. The committee will be reporting to the Senate on Wednesday the 26th of May 2026, and we've agreed that responses to questions on notice should be provided by close of business on Wednesday the 15th of April 2026. We're now going to suspend, and we'll resume at 1:30. Thank you so much.
Thank you.
Right, we're ready to resume. Thanks, broadcasting. I now welcome the Australian Diabetes Society, who's joining us via video conference. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. If I could ask you, just for the benefit of the Hansard record, if you could state your full name and the capacity in which you're appearing today.
So my full name is Sofianos Andrikopoulos, otherwise known as Sof Andrikopoulos, and I'm the CEO of the Australian Diabetes Society. So I guess I'm appearing in front of you as representing diabetes in Australia.
Great, thank you very much. I'm now going to invite you to make some short opening remarks, and then we'll go to the committee for questions.
Look, I know that this committee is about microplastics and the effect of microplastics on health, on chronic disease. There is emerging evidence, I guess, in metabolic disorders like diabetes and obesity that microplastics are playing a role or are associated with high blood glucose levels, high blood pressure, and other metabolic derangements. What we don't know is the mechanisms by which these environmental insults, these environmental pollutants, are causing diabetes or insulin resistance and inflammation that leads to diabetes. I would think that given the increase in these environmental pollutants that we need more research, I would encourage the Commonwealth to support more research to understand the impact that micro nanoplastics have on chronic disease, including diabetes.
Thanks very much, Mr. Andrikopoulos. I'm going to go to Senator Askew to kick us off.
Thank you very much, and thanks for joining us here today. It's great to have you with us. I've got a family involvement with diabetes at a lot of levels, so it's always good to hear from you.
Yes, we did speak.
We have.
We did speak, yeah.
My question, first of all, is so you're sort of saying that there is some sort of evidence, but is there any type of evidence at all? I know we're saying emerging evidence is appearing, but is there any evidence yet of an impact of exposure on people living with type 1 or type 2 diabetes?
Look, as far as I know, and I had a look at the literature, there is associations between these pollutants and the cause of diabetes. Or the association with diabetes, I should say, more accurately. We don't know whether that's causal or not. We don't know whether you can sort of sit there and say, yes, if you are going to be exposed to a particular amount or level of these environmental pollutants, micro nanoplastics, that you will definitely get type 1 or type 2 diabetes. I think the evidence continues to be associative. And I think that's why in my opening remarks, I suggest that we need a lot more research to understand the role, the impact of microplastics. My hunch would be that, as with type 1 diabetes, where we know that if you get exposed to a particular infection, a particular virus, whether that's the flu, whether that's COVID, that if you have a genetic predisposition, then that environmental insult can accelerate the development of, say, type 1 diabetes.
Okay. So obviously there is concern in the community, and we've certainly been hearing that, through the evidence that we've got, that, there is the emerging evidence, as I mentioned. How should clinicians be responding at this point in time in regard to the current evidence, and should there be greater awareness and prevention efforts at this point in time?
I think Let's. How do we do that? I mean, how do we do prevention of these environmental toxins, microplastics, where they're everywhere, in our packaging, in the foods or the water that we drink, in the medicines. With type 1 diabetes, people inject insulin. That's a plastic device, the insulin pen. In type 2 diabetes and obesity, the GLP-1 based therapies currently in Australia are all injectables. Again, that's a plastic, and people are exposed to plastic. So, how do we have preventative measures? I think, again, I'll go back to say that we need research to understand how we can package things in a way that toxins don't leach out, that they become a little bit safer for people to consume. I think because this is early, and I commend whoever's put this committee together to look into microplastics. I commend you, because I think it's being proactive, and we're trying to do something about this environmental toxin. Yeah.
It's certainly been something that's been topical. That's one thing, this inquiry. But also we've certainly heard the need for further research and understanding, greater understanding of what the impacts are, how should we be measuring it, all those sorts of things are very important. One of the things that we have had suggested on numerous times is the establishment of a human biomonitoring program. Is that something that you would be supportive of?
Yeah, I think so. I think that's occurring in other parts of the world as well, I think. So I think some sort of way of monitoring the waterways, monitoring the effect on certain communities, I think would be hugely useful for us to be able to then put in place measures to prevent, measures to help the community. Yes, absolutely.
Excellent. Thank you very much. I'll hand to the Chair to give the call.
Senator Ananda Raja.
Thank you, Chair. Thank you for your testimony. I'm assuming you're an endocrinologist, are you?
I am what I call myself as a mouse doctor. So my background is I did 35 years of research in diabetes, particularly in type 2 diabetes, where I looked at the genetic and biological mechanisms by which beta cell dysfunction occurs and leads to type 2 diabetes.
Okay, understood. I had a
discovery researcher.
Sure. I have a specific question around the mechanistic basis of endocrine disruptors. I don't know if you can answer that.
Yeah, sure. I can have a go.
With reference to plastics, how do these actually work at the molecular level?
Right. As far as I know, these microplastics can enter the cell and cause insulin resistance. So one of the ways that people think that microplastics can lead to diabetes is via an insulin resistance mechanism. So in type 2 diabetes, one of the major dysfunctions is muscle and fat insulin resistance that puts a load on the islet beta cell to secrete enough insulin. And when that secretion fails as a result of the insulin resistance, then you get diabetes, type 2 diabetes. So the theory is that these microplastics enter the cell, the muscle cell or the fat cell. They then somehow disrupt signaling pathways of the insulin receptor that cause insulin resistance. That puts pressure on the islet beta cell to secrete more insulin. If you have a genetic predisposition, this was my research for 35 years.
Perfect.
If you have a genetic predisposition to beta cell dysfunction, then that can lead to type 2 diabetes.
And with respect to other risk factors, you mentioned genetics. I'm particularly interested in groups with very high incidence of type 2 diabetes. First Nations comes to mind, but maybe there are other groups, Pacifica, I'm not sure, and so on. Is there then a link, do you think, between, for example, First Nations communities who are also exposed to a lot of plastic, I might add, and early onset type 2 diabetes? Or do you think that's, do you think that could be an area of research?
Yeah, I think that could be a contributing factor. We know, I'm not saying anything that you don't already know, that the incidence of diabetes in Aboriginal and Torres Strait Islander communities is very, very high. It's 2 to 4 times higher than non-Aboriginal communities, and it's likely that environmental factors, environmental pressures, including nanoplastics, play a significant role. Absolutely, and the curve's been shifted to the left with respect to people from Aboriginal and Torres Strait Islander communities developing type 2 diabetes at an earlier age. Right? So there's a genetic predisposition, and then the environment causes the onset to happen earlier in life, which is bad because then complications are much more severe in people who develop diabetes, type 2 diabetes, at a relatively younger age.
First Nations communities, though, are not homogenous themselves, right? You've got urban dwellers, and then you've got people living in the regions, and then people living in remote Australia. Is there a gradient in diabetes incidence across that cohort based on where they live? So, because I think, and I'm just speculating, that people living in more regional, remote areas would be exposed to more plastic just because of all the packaging and the food and water and so on that's brought into these communities.
Look, I think there's an underlying predisposition to obesity and diabetes and other chronic diseases in Aboriginal and Torres Strait Islander communities. I don't know, and we can have a look at whether Aboriginal people living in urban communities have a slightly lower incidence of diabetes compared to people living in remote communities. It would be actually quite interesting from what we discussed before about doing the biogenome study to see whether an increase in plastic exposure in Aboriginal communities is associated with a higher degree of or higher levels of chronic disease compared to Aboriginal people who are living in urban areas of Australia. I think that would be fascinating.
Well, we've got the NHMRC coming next, and I just wondered whether you could perhaps give us some asks that you think we should be questioning the NHMRC over.
More money for research.
Yeah, but that's very non-specific. Can you narrow it down
more
a little
money
bit?
For research. More money for research for type 2 diabetes.
To be fair, type 2 diabetes gets a lot of money for research, but with respect to environmental impacts and plastics, what kind of questions do you think we should be asking?
Yeah, can I just first say that it's the funding for diabetes research from the NHMRC has decreased by 50% over the last 10 years. That number. Those statistics are on the NHMRC website, on the government website. So I don't think we get a lot of money at all for type 2 diabetes research, and I think we need more, particularly for these kinds of discussions. I think there should be a targeted call for research to look into microplastics. That's how I think the NHMRC could tackle this, with a targeted call for research in type 2 diabetes in Aboriginal communities and the environmental insults, including microplastics.
We have.
If you want a specific answer.
Thank you. No, thank you. The other question with relation to First Nations communities are the issue of birth weight, low birth weight in children, in babies. And we've heard testimony after testimony. It's in the Lancet. It's, that microplastics are found across the placenta, So, yeah, the maternal placental barrier, and it ends up in the baby. Are you aware of any data in Australia looking at First Nations maternal child transmission of microplastics?
No is the answer, but I'm sure that we'll be able to get that. I'm not aware that it might be available, but I don't know.
Okay, that sounds like that could be an area of research, given the fact that we've got problems with low birth weight. Okay, I don't have any.
And there's a U-shaped relationship. I know people would have told you about birth weight and chronic disease later in life.
Yeah. All right, can you just further explain that, please?
Well, low birth and high birth weight are both, so it's a U-shape, so both low birth weight and high birth weight are associated with chronic conditions later in life.
So
low birth weight is not good, high birth weight is not good.
Okay, so that in utero and 1,000 days really does matter for...
Absolutely.
Yeah.
So, there's unequivocal data for that.
Okay, thank you so much.
Thank you.
Mr. Andrikopoulos, I just have one question before we finish this panel, and that is, you mentioned early on that, you know, there's emerging evidence that microplastics and nanoplastics may be a potential risk factor for type 2 diabetes in particular. And I guess I'm just interested to know what level of evidence, I guess, would you be wanting to see as a diabetes society in order for you to list it as a potential risk factor for people to be aware of? Are we at that point yet for your organisation, or you're waiting for more evidence?
I think I would like to see a little bit more evidence, and I'm more than happy to be involved in developing that evidence, because I think this is a really important area. And as we discussed about Aboriginal and Torres Strait Islander communities and remote communities, it's really important. I would like to see further data implicating microplastics in insulin resistance. Mm-hmm. That could be done both at a discovery science level, so in animal studies, and also doing public health research, and particularly Australian research, where we can have a look at how microplastics correlate with chronic disease in specific vulnerable populations.
All right. Look, thank you very much. We've heard from we heard from the Heart Foundation and the Stroke Foundation this morning, who said that this hearing is sort of their first foray into advocacy around microplastics. Correct me if I'm wrong, but is that also the case for Diabetes Australia?
Look, it is. We've been aware of endocrine disruptors, and I think it was mentioned, for a while now. So we do know that environmental insults can impact endocrine systems. Microplastics is something that's coming up. The focus on microplastics is new. So I think, as I said, I think this is really, really good, and you should be commended that you've started this inquiry.
All right. Well, thanks very much for your evidence today, Mr. Andrikopoulos. Looking forward to gathering more evidence, getting more information, making some recommendations, and hopefully we can progress this issue. But very much appreciate your time today. The committee will report to the Senate on Wednesday, the 26th of May 2026, and we've agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026. Thanks again.
Thank you for the opportunity.
We might just suspend. Oh, we've got our next ones online? Yep. Great. Sorry, my bad. I didn't realise everyone was online. Okay, so I now welcome the National Health and Medical Research Council, who are all joining us by video conference. Thank you for appearing before the committee today. The Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy, and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. Commonwealth officers appearing today are also reminded of the Senate order specifying the process by which a claim of public interest immunity should be raised, and a copy of the order is available from the Secretariat. For the Hansard record, could I please ask you to state your full names and the capacity in which you appear today?
Yeah, hi, I'm Steve Westling. I'm the CEO of NHMRC, and I just wanted to check that you can hear and see me okay.
Yes, all really clear, thank you. So, Mr Wesley, I'm going to invite you to make some opening remarks and then I'll go to senators for questions.
Excellent. All right, well, thanks very much for the opportunity to appear before the committee today. And I would like to pay my respects and acknowledge the traditional custodians of the lands that I'm on and that you are on, and also pay my respects to elders past, present and emerging, and Aboriginal and Torres Strait Islanders that are joining us today. And as I said, I really welcome the opportunity to talk about this critical, important and emerging issue that really is raising complex questions for science, policy and public health. So I'll start by outlining NHMRC's role, particularly our research funding and also our role in developing evidence-based environmental health guidelines. So as I'm sure you're aware, NHMRC is Australia's leading national body for funding high quality health and medical research and supporting the translation of that research into evidence-based guidelines and advice. And we also have a really important role in promoting the highest ethical standards in health and medical research. And through all of that, our mission is to build a healthy Australia through investment in research, translation of evidence and maintaining research integrity. So microplastics and PFAS and other environmental contaminants present complex and evolving challenges to human health and require robust, high-quality research to understand exposure, potential health effects, and then appropriate policy and regulatory responses. And I guess our role is to ensure research investment and health advice are grounded in scientific rigour, expert peer review, and the best available evidence. So we fund predominantly, through competitive peer-reviewed funding schemes, which are actually predominantly bottom-up. So we ask investigators to put grants into us, we peer review them, and the very best get funded. So in that system, we don't actually tell our investigators what to do research on, but we pick the very best research. That process, though, has enabled us to fund research across the whole spectrum of health issues, and we're confident that it covers most areas. However, we do have some other ways to support priority-driven research, and that's the targeted calls for research. So with the targeted calls for research, we can address specific health issues through one-off priority-focused funding opportunities. And they're designed to build research capacity, stimulate research in areas of high urgency or potential impact. And recent examples of that are our early onset cancer, TRC, and we've done that in collaboration with Cancer Australia, and the peer review for that has concluded, but the outcomes aren't public yet. We've also done the serving and ex-serving ADF members' mental health and wellbeing targeted call for research in response to the Royal Commission in Defence and Veteran Suicide. And back in 2019, we did a PFAS TCR to help understand the issues of PFAS, environmental exposure and human health impacts. That was for $11.7 million and was funded by the Department of Defence. And we do, where other issues arise, there's another example of a One Health CRE that we've funded in the Pacific, that we've funded with DFAT to look at One Health issues across the Pacific. If we look at what we've invested through the investigator bottom-up process that I described through our ideas grants and our investigator grants, we've invested around $56 million over the last decade in areas which are relevant to the terms of reference of this committee. And that includes about $14.4 million on PFAS research. While that funding doesn't specifically relate to microplastics, it does look at issues of endocrine disruption by environmental exposures and chemicals and the impact on early utero and early childhood exposure. So, it's important to note that we have been funding the general area, but we would acknowledge that in recent times there hasn't been any particular funding on the topic of microplastics. NHMRC is also legislated to provide high-quality evidence-based health advice to the government and community, and we do that by developing our own guidelines, and third-party organisations also can seek to have approval and endorsement of their clinical, public or environmental health guidelines. So a couple of really key environmental health guidelines and advice that come from us are the Australian Drinking Water Guidelines, the Guidelines for Managing Risks in Recreational Water, and the NHMRC Statement Evidence on the Effects of Lead on Human Health. And obviously those guidelines are regularly updated, and the Australian Drinking Water Guidelines are updated probably more frequently through a rolling review process. And we set those guidelines where science is sufficiently established, but importantly, we don't regulate or enforce those guidelines. So the drinking water guidelines are there, and the states enforce that through their water processes. And the guidelines are derived from the very best evidence utilising our processes on guidelines. And just, a couple of comments on the Australian Drinking Water Guidelines. That has got 200 chemical fact sheets, and obviously PFAS has been an area of particular importance, and we've changed our PFAS guidelines quite recently, reducing the level required in drinking water. So I guess in conclusion, we agree with the committee that this is an important area. It's an evolving area. It's an area where there almost certainly needs to be more research and clearer evidence on both the environmental exposure, but probably more importantly, the health impacts of that environmental exposure. And then ultimately, when the evidence is available, then guidelines on environmental contaminants and exposure will be an important next step. So I'm happy to stop there and answer any questions.
Thank you very much, Professor Wesling. I just have one question actually, and then I'm going to go to Senator Askew. I'm just interested to understand from the perspective of guidelines. Is it the case that the NH and MRC only issues guidelines when there's clear causative evidence? Because I guess a lot of the evidence that we've heard over the last few days is that there's a mounting body of evidence that suggests that the precautionary principle should be applied. And so I just want to understand what the approach is that the NH and MRC takes when it comes to guidelines.
So, we have very clear and documented and published processes in terms of our guidelines and a sort of evidence to decision-making process. And no, it's not always absolutely necessary for us to have, gold standard evidence to make recommendations in our guidelines. We would highlight the level of evidence that was utilised in the guideline, and if the level of evidence was very low, we would highlight that. Particularly in clinical guidelines, and I know that's not necessarily what you're asking, but sometimes we need to go to consensus in terms of clinical guidelines because the randomised controlled study hasn't actually been done. So there's varied levels of evidence, and they are very clearly documented in any of the guidelines we develop.
Thank you very much for that clarification. I'm going to go to Senator Askew.
Thank you, and thank you, Professor Wesling, for your time today. Just on you mentioned the targeted call for research. How does that come about? Is that something you initiate, or is that something that the government issues or requests?
So there are a number of pathways up to the TCRs, and so we have a community portal as an example. So the community can put through consumer groups and those sorts of groups can put things into the community portal, or an individual can put things into the community portal. We also have input from the states through predominantly through the chief health officers of the states, and they can make recommendations for TCRs. And we do accept recommendations from government and obviously from royal commissions and Senate inquiries. So all of those go into a mix, a spreadsheet of TCRs that are ranked and decided on ultimately by NHMRC, but through our governance processes. So they would go to research committee and to NHMRC council for an endorsement, and then I would indicate and make a call for those TCRs.
So is nanoplastics and or microplastics on that spreadsheet?
It's not currently on that spreadsheet, no, but clearly after this Senate inquiry, I imagine it will be.
Fair enough. So I've got some questions from my colleague as well, so I'll work through those. So how are the current guidelines incorporating emerging evidence?
So the water guideline, so this, I'm not quite sure which guidelines you're referring to, but as an example, our water guidelines would be constantly through environmental health committees, looking at emerging evidence and work that's been done across the world. And so we would be looking particularly at other countries' guidelines, we'd be looking at published evidence, we'd be looking at the WHO definitions, particularly in regard to carcinogenesis and those sorts of things. So a number of the sort of PFAS-like chemicals are being constantly looked at in regard to that. And that's as an example, we recently went back to our PFAS guidelines and dropped the levels significantly because of that international evidence that we were observing.
Okay. And so on the Australian drinking water guidelines, there's nothing in there referencing microplastics or nanoplastics at this point?
No, there's not.
Is that something that should be addressed, or is it still too early from an evidence-based scenario?
I think that it's probably something that will be coming onto the agenda of the environmental advisory committees. I mean, I'm not claiming to be an expert in the area. I think having obviously looked at it carefully for this attendance, I would suggest that there probably still does need to be quite a lot of work in terms of strengthening evidence, absolutely.
And I'm just following on from Senator Allman-Payne's question earlier in regard to precautionary and early intervention rather than waiting for the final, full-on evidence. Should we be adopting more precautionary thresholds, do you think?
I think we already do look at it from that point of view. And, I would use PFAS as an example. I think we are being quite precautionary in terms of PFAS. Again, the levels of evidence about PFAS and its impacts on human health are now getting stronger, but aren't exceptionally strong, and yet we are taking quite precautionary approaches to that in terms of what I see as a relatively low level that we've asked water authorities to adhere to. So I do think we take a precautionary response. And I think, organisations like IARC, the WHO organisation, which defines, whether a substance is a carcinogen or not, if you look at the way they do that they are, also looking at it from a pretty precautionary approach, and we take on board their findings very seriously.
Okay. So what role does biomonitoring play in your assessments?
So we obviously set the levels, But we do think, and I think that, regular, particularly in terms of drinking water, regular measurement and transparency about those measurements, I think, encourages public confidence, and so we would support that.
Okay, so you mentioned earlier that the international benchmarks influence your policies around waters and so on. Is that something that you would look into for the microplastic side of things as well?
Absolutely, yes. So we would always be scanning the international responses, accepting that every nation has different ways of doing it, but that would inform our work a lot, yes.
Okay, because we have had lots of evidence about the EU and the US, so there's probably some good stories out there. Just on prioritisation of research funding, how do you prioritise it when you're looking at something like this? How would this become a priority as opposed to something else that's crossing your desk?
So I guess there are a couple of ways. One, as I mentioned, is through the TCRs, targeted calls for research. And, if we received advice from our chief health officers, from this Senate inquiry, from government, that would certainly influence our decision-making around TCRs. We also have a process through council to look at very broad priorities. And as an example, a couple of the priorities that we've highlighted in this triennium have been equity priorities. So Aboriginal and Torres Strait Islander health has been a very strong priority, but rural, regional and remote has also been a high priority, and gender equity. So those would also feed into this decision making. And if there was evidence, and I heard a few minutes of the previous evidence around Aboriginal and Torres Strait Islander communities and so on, and if there was evidence or a sense that they were particularly affected, then that would go to our strategic priorities and make it much more likely that we would be looking at this.
Okay. And just one other, in regard to the terms of reference of our inquiry, we're looking at the reproductive impacts on fertility and reproductive health. Is that an area that could be more explicitly considered when you're actually making that consideration?
Yeah, for sure. And the TCRs can have a series of goals, and if one of them was that, another one was Aboriginal and Torres Strait Islander and so on, that would be not uncommon for us in our design of the targeted calls for research.
Excellent, that would be very handy. My final question, have you actually provided any advice to government at all in regard to microplastics and nanoplastics, or have been asked to provide any advice?
No to both questions.
Okay. No worries. That's fine. Thank you very much for your help.
I should also probably take that on notice, but I'm pretty sure we haven't, but I will take that on notice as well and check with my staff.
No worries. Thank you very much.
Professor Wessling, just before I go to Senator Anand Raja, just some feedback from an earlier panel. We had the National Rural Health Alliance on earlier today, and they noted that rural, regional and remote Australians make up 30% of our population, but it would appear from the website that 10% of NH and MRC funding is going to rural, regional and remote. So I'm just going to pass that feedback on and go to Senator Anand Raja.
Thank you, Chair. Professor Wessling, just to follow on from Senator Askew, microplastics are ubiquitous. Whenever you look for them in the body, you'll find them in just about every tissue. I think I'm interested to know how the NHMRC, again, would prioritise research in human health. And I think what is informing my thinking is that we are seeing maternal to child transmission. It was described by Professor Dunlop from Minderoo as toxic trespass. It has lifelong impacts, and we've just heard that in terms of diabetes risk and other types of risk, including insulin resistance, obesity, and so on. And then, of course, there are regional communities who are crying out for greater representation in terms of the research dollar. We've got people with potentially occupational exposure. How does the NHMRC take this giant problem and then ensure we get bang for buck?
So I guess I have to go back to what I said previously, and that is the majority of our funding is investigator initiated. So the majority of the funding, we look at what investigators put to us in terms of their research applications. We judge those research applications, peer review them on excellence and impact, and then the best obviously get funded. Almost invariably, if there are important health issues, the investigators will put those sorts of ideas up to us. As I mentioned, where there are gaps or we believe there's insufficient funding in a particular area, we have the opportunity to have targeted calls for research as a priority-driven research opportunity. I should also mention now there is another medical research fund. We use the MREA. There's the Medical Research Future Fund, which is actually a top-down fund and is more priority-driven than our MREA. So that is another opportunity for research funding. We conduct most of the peer review for that, but we don't decide on the grant opportunities. That's decided by the Health and Medical Research Office of the Department of Health. So that is another opportunity for funding. So as I mentioned, the targeted calls are one of those opportunities to prioritise funding, and in really big and important areas such as Aboriginal and Torres Strait Islander health, we do have the opportunity to have extra priority funding, and we've applied that across the board to all of our grants so that we have increased our funding for Aboriginal and Torres Strait Islander health up above 8% by having it across the board. But we only do that for very particular areas, and Aboriginal and Torres Strait Islander health has been one of them, and gender equity has been another.
I want to draw you to perhaps reconsidering the funding model and looking at the convening power of the NHMRC. So what we've seen in research, and don't take it from me, take it from Robin Denholm, who handed down the third review, is a fragmentation, right, of research effort across our country, whether it be in health or in science, basic science, you name it. We have fragmentation. And we're also seeing that here in the microplastics research. And yet we have some incredible work going around in the country as well as internationally. And I speak to the efforts of Health Canada and their biomonitoring program. Horizon Europe, we heard from a researcher who's doing some work that's EU funded on microplastics. We've got the Minderoo Foundation, which is cited repeatedly in the Lancet Countdown. They are leading the way globally, by the sounds of it, in this area. And then we've got domestic researchers we've heard from all day today. I just feel like the NHMRC has a real role here. Yes, you do have your targeted calls, I get that, but there's a real potential for you to, as the funder, to have this convening power to bring not just health researchers together, but kind of steer them into creating both domestic collaborations, not just with other health researchers, but perhaps with environmental scientists, and we heard from some excellent ones today, but also go further and create those kinds of international collaborations, because, we're a small country, right? And this is a problem which is being pushed by the fossil fuel companies. And don't take it from me, it's written in the Lancet Countdown. They say that Saudi Arabia is intending on sending a third of its oil output into plastics manufacturing in the next 4 years. So we are honestly up against it. And I just want you to speak to us a little bit about the convening role of the NHMRC.
Yeah, so thanks for that. I might just start with the international, because I hadn't spoken to that at all yet. So we do a number of bilateral and multilateral international programs where we work with, we just announced one with Switzerland. We do a number with the MRC from the UK, the NIHR from the UK, CIHR from Canada, and so on. And importantly, we have been we have an EU Horizon program, which is separate from the recent announcement about Australia potentially becoming a member, on health. So people do have an opportunity to have an EU grant, which is a combination of Australian and European funding. So we do that. And yes, I think the bilateral and multilateral agreements that we have give us an opportunity to look for these sorts of areas where coordination across the world is helpful. And we've done that in areas like platform trials with the UK, dementia and other areas where, you know, there's a worldwide work on this area. And this, I agree, could well be one of those areas that we could discuss with our colleagues in the EU and Canada and Asia, actually. So we work with Singapore and Japan, India. So yes, no, I agree. I think we do have that opportunity and we do utilise that opportunity. And we're a member of HEROES. It's a great name, Heads of International Research Organisations. And again, HEROES plays a bit of a role in talking about those sorts of issues. And HEROES also includes Wellcome and Gates and Novo Nordisk and those sorts of organisations. So I think there is an opportunity there. I agree with you. In terms of in Australia, yes, we do, I think, have a leadership opportunity. We do have leadership in Australia apart from our funding. And as we recently ran a workshop on pandemic research preparedness to talk to the sector about what we should be doing right now to prepare for the next pandemic from a research point of view. And so we do and could look at that in this area. So yeah, no, I wouldn't shy away from NHMRC providing leadership. I think one of the inferences you may have made is that the bottom-up system may be disconnected. What we've actually found is that we actually get really quite good research on what we see as priority areas, you know, like cardiovascular health, like cancer, like neuroscience. And so the spread is normally pretty good. Mm-hmm. And then we have opportunities through things like Centres for Research Excellence, which we fund, where we require people to develop a national coordinated platform in a particular area. And our CREs have been particularly important in a number of these sorts of areas. And then synergy grants also require people to have a national coordinated group. So there are opportunities in those areas as well.
My last question is just to return to maternal child health. I know it's an area that you've prioritised as well, but we heard from the Australian Women's Health Alliance, and I wrote down Sandra's quote here. She said, "We need coordinated system-level action." And the interesting thing is, yes, there is maternal baby transmission in utero of microplastics, but this then, we heard testimony from another group, I think from Newcastle, who said that reproductive health is the canary in the coal mine, and we know that fertility rates around the world are declining, actually, for lots of reasons, but, you know, this may be one reason. And the other thing we also heard from was that IVF success in Australia over the last 30 years has not changed. It's unchanged, and yet we spend billions on IVF. So I feel like that's a real rich area of research as well. But thank you so much.
Thank you.
Professor Wesseling, thank you so much for giving up your time this afternoon and coming along to answer our questions. The committee will report to the Senate on Wednesday, the 26th of May 2026, and it's agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026. And I just want to thank you again for taking the time to give your evidence this afternoon.
No, thank you. That was it's really important, and I was very happy to come. Thank you.
Thank you. I'm now going to welcome representatives from the Australian Industrial Chemicals Introduction Scheme, Australian Pesticides and Veterinary Medicines Authority and Food Standards Australia, New Zealand. Good afternoon, everyone. Thank you very much for appearing before the committee today. The Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. Commonwealth officers appearing today are also reminded of the Senate order specifying the process by which a claim of public interest immunity should be raised, and a copy of the order is available from the Secretariat. For the Hansard record, if you could please state your full names and the capacity in which you appear today, and we might start with those of us who are online. So Ms Rundle. Or Ms Rumble, I should say. Sorry, my eyes aren't working very well. So Ms Rumble, if you could just come off mute and just state your full name and the capacity in which you're appearing today. Ms Rumble, could you give me a thumbs up if you can hear me? Okay, I think we have an audio issue with Ms Rumble, so we might come back. So I'm going to come to people at the table before me.
Thank you. Graham Barton, Executive Director, Australian Industrial Chemicals Introduction Scheme.
Claire Larter, the Assistant Secretary in the Regulatory Science Branch of the Australian Industrial Chemicals Introduction Scheme.
Ed Cram, Executive Director of Agricultural Chemicals at the Australian Pesticides and Veterinary Medicines Authority.
Sandra Cuthbert, CEO of Food Standards Australia New Zealand.
Matthew O'Mullane, General Manager of the Food Safety Branch at Food Standards Australia New Zealand.
I might just test again whether Ms Rumble can hear us yet.
I've just had a message saying that she's going to try rejoining because she can't hear the room.
Okay, great. All right, well, while we're waiting for that to happen, I'm going to invite each organisation to make some short opening remarks, if you would like, and then we'll go to questions. So I might start with the Australian Industrial Chemicals Introduction Scheme. Thank you very much, Chair, and thank you for inviting the Australian Industrial Chemicals Introduction Scheme, which I'll refer to as ACIS from here on, to appear before you today. ACIS is the national regulator responsible for assessing human health and environmental risks of industrial chemicals, authorising their manufacture and import, referred to in legislation as introduction, publishing risk information and making risk management recommendations to risk management authorities. The overall regulatory framework for industrial chemicals comprises ACIS and Commonwealth, state and territory authorities that set and implement standards to protect the public, workers and the environment. Within that framework, ACIS regulates individual industrial chemicals, including chemicals used to manufacture plastics, such as polymers and plastic additives. ACIS does not regulate finished or formulated products. Instead, we regulate the introduction of individual chemicals used as ingredients in the manufacture of products like paints, adhesives, solvents, cosmetics and cleaning products. We provide risk management recommendations to downstream regulators who can set standards and manage risks using the chemical risk information that ACIS provides. This includes chemicals used to manufacture products like plastic bags, packaging, toys, and the plastic components of consumer products from which chemicals may be unintentionally released. New industrial chemicals that are likely to present higher risk and which have not previously been manufactured in or imported into Australia must undergo an ACIS pre-market risk assessment and authorisation. This includes chemicals with effects of higher concern, such as effects on reproduction and development, and chemicals that persist and accumulate in the environment. Industry is required to provide information to support all applications for assessment. We can and do require further information when we have concerns arising from that information, other information that we hold, or overseas hazard assessments. We place a greater weight on data generated using internationally recognised and validated approaches, particularly OECD test guidelines, so that our assessments and recommendations are science-based, robust and transparent. These approaches include a developing suite of tools that were not available to earlier regulators, such as computational and other methods that can model the chemical effects on humans and the environment, supplementing empirical evidence from studies. ACIS also assesses and reassesses chemicals that are already listed on the Australian Inventory of Industrial Chemicals,
and we're actively working on risk proportionate assessment of the remaining unassessed chemicals, prioritising those of highest concern. Our current evaluation of 522 PFAS is an example of this work, demonstrating that while ACUS's final regulatory decisions must be made chemical by chemical under legislation, we do assess groups of chemicals and make recommendations to risk managers about those chemical groups. And I look forward to ACUS assisting the committee today. Thank you.
Thank you very much. Just before I go to our next witness, I might check. No, we've lost Ms Rumble again. That's okay. I'll keep trying. I'm now going to go to the Australian Pesticides and Veterinary Medicines Authority. Dr Cram.
Thanks for inviting APVMA to appear today. APVMA is Australia's independent regulator of agricultural and veterinary or AgVet products. And this includes products that are used to control pests and diseases and also products used to treat animal diseases. In line with the risk-based approach to chemical regulation, a separate regulator was established to manage these AgVet products that up to the point of sale, because they do carry inherently higher risks. So we're a product-based regulator. Before an AgVet product can be registered or approved under a permit, the APVMA must be satisfied that the product doesn't pose a risk to the health and safety of people or the environment, and also that the product is effective and won't impact trade. APVMA receives comprehensive information for every product and assesses it in accordance with international best practice. When risks are identified, APVMA has a broad range of regulatory options available to manage the risks of these products. APVMA also has powers to review any active constituents or registered products when new information emerges. And these powers include varying the conditions of use, suspending or cancelling approvals and registrations, and undertaking compliance and enforcement actions, including recalls. Ultimately, the APVMA's role is to regulate AgVet chemicals to protect the health and safety of people, animals and the environment, and to support primary industries, biosecurity and international trade for all Australians. I look forward to supporting the community today.
Thanks very much. We'll now go to Food Standards Australia New Zealand.
Thank you, Chair, and thank you to the committee for the opportunity to appear today. Food Standards Australia New Zealand, FSANZ, is the independent statutory authority within the joint Australia-New Zealand food regulatory system, responsible for developing food standards. These standards set the legal requirements for food produced or imported for sale in Australia and New Zealand, supporting a safe food supply for consumers. Enforcement of food standards is undertaken by Australian states and territories, the Department of Agriculture, Fisheries and Forestry for imported foods at the border, and New Zealand's Ministry for Primary Industries in New Zealand. FSANZ operates as part of a broader regulatory framework for chemicals. So agencies such as ACUS assess the risks of industrial chemicals and provide risk management recommendations. FSANZ draws on that work alongside international evidence and our own assessments to set standards that address chemicals as they appear in food. This includes chemicals that may migrate from food into food from packaging or contact material. In establishing or reviewing food standards, FSANZ undertakes risk analysis consistent with the Codex Alimentarius Commission's risk analysis framework and World Health Organization's principles for the risk assessment of chemicals in food. Underpinning these approaches is the principle that risk is a function of both hazard, so the potential of a substance to cause harm, and exposure, how much of that substance a person actually consumes through their diet. The committee has rightly drawn attention to vulnerable populations, including infants, children, and pregnant women. FSANZ absolutely shares that focus. FSANZ applies a cautious, evidence-based approach to emerging contaminants that may affect sensitive life stages, recognizing both the importance of protecting vulnerable populations and the need for regulatory decisions to be grounded in robust, reproducible evidence. There remain significant scientific and methodological limitations in this area, most notably the absence of harmonized analytical methods, insufficient exposure data, and limited toxicological evidence of adverse health effects at levels relevant to human dietary exposure. Without those foundational elements, enforceable food standards would not be scientifically robust nor practically effective. However, FSANZ is not passively waiting for the science to mature. We are actively monitoring the work of international bodies, including reviews completed by the WHO and FAO, and engaging with counterpart agencies to track emerging approaches to risk assessment and risk management for microplastics in food. Domestically, the Australian Total Diet Study, our primary tool for understanding what Australians are actually exposed to through their diet, is able to assess specific chemicals of concern, providing the kind of nationally relevant exposure data that can inform regulatory responses. FSANZ welcomes the committee's focus on this issue and is pleased to assist with the inquiry. Thank you.
Thank you. I'm going to have another go and see whether Dr. Rumble's sound is working now. Dr. Rumble, can you hear us? We're halfway there. You can hear us now, but we can't hear you. So we might start and then we'll see how we go. My apologies, but hopefully we can keep working on that. I'm going to go to Senator Askew to kick us off.
Thank you very much, and thank you for your time this afternoon and for those introductory comments. That was very helpful. As you can imagine, we've had quite a lot of interesting evidence provided, and I'm not sure if you've been following along as we've played in the last week or so, but it's been quite an eye-opener to hear some of the evidence that's out there. So I'll probably start from like the chemical side of things, I suppose, in regard to the regulatory framework. So are there current chemical regulatory frameworks fit for emerging contaminants? So how do you monitor those as they come through, become aware of them?
So we have a system that we use that is continuously looking for new information from around the world. So regulators may make new decisions in other parts of the world. I think it's got something over 93, possibly more now, different sources. And we drag that into our system. We use that to rank different chemicals according to hazard and exposure information that's available. And then we use that to make choices about the kinds or which chemicals or which chemical groups that we would put under what is called evaluation in the legislation. And that's an opportunity to reassess chemicals or even assess for the first time chemicals which are authorised in Australia.
And just having some of the evidence that we've received along the way is that there's more than, microplastics. There's a lot of chemicals and there's a lot of things that are put into, and they're not all the same. It's not uniform across it. So in the case of something like that, would you treat them as classes of chemicals, or would it be something you have to do individually?
So as we've done with PFAS, we're doing a single evaluation of 522 PFAS. So we're treating the class at once at this phase of our work. And then if it occurred to us that our work demonstrated that there were PFAS used at larger volumes than others, then we would design the risk assessment approach that was commensurate with that relative introduction volume in the country.
And in your opening statement, you mentioned about the ingredients, I suppose, of products and so on, and you provide advice then to the downstream. Is that then the producers who manufacture products? Is that how it works?
So our advices go to anyone who will be engaging with the chemicals. So we publish evaluation statements and assessment statements under the law, and that will provide information to persons conducting a business, to the kind of controls that will assist in management of risk. We also provide information and recommendations to the risk managers. So that's typically the hazard classification process of Safe Work Australia, poison scheduling by the Department of Health, and the ICHEMS arrangements that are administered by the Environment Department.
So in relation to the microplastics that we're looking at, nanoplastics, in the evidence that we've heard, especially with the work that's been done in the EU and the US, I think there's quite a bit of research that's already been done into this space, and there are actually some legislative guidelines in place. Are you aware of those, and is it something that you've been looking at for consideration in Australia?
If you're talking about controls governing the fate of microplastics in environments in other parts of the world, the answer is no, because that's not the extent of our regulatory authority.
Okay, no worries. So that might open that up to the other witnesses, whether or not you've been aware of what's been going on in other jurisdictions, and also whether or not that's something that you've been considering in relation to the work you're doing here in Australia.
Yes, thanks for the question, Senator. Yeah, absolutely. I think just to go back to the previous line of questioning, So the Australian-New Zealand Food Standards Code does regulate contaminants.
Right.
So as emerging or new contaminants come up and there's enough information there to indicate scientifically that there's some risks that need to be managed, then we can certainly step in and set food standards. So we have a lot of engagement internationally with, as Dr. Cuthbert's already mentioned, the Codex Alimentarius, which is an international food standard setting body, important for protecting public health and safety, but also for trade as well. So we have those sort of connections and also counterparts in many countries of the world. And I think it's fair to say, in relation to microplastics specifically, it certainly is an emerging area of focus for food regulators and food standard setting bodies. But and notwithstanding that comment, certainly still lots of research and information to gather to actually support a potential standard setting process.
Okay, so it's certainly evidence that we've received that there's definitely a need to put some further research behind it, but also that we need to be taking precautionary steps as well. So is it to a point, do you think that microplastics be regulated as a category? Are we getting to that point where we need to be doing something about that, do you think?
In the food space, I think the evidence is still emerging, and this is one of the great challenges. I think in our submission that we've provided to the committee, one of the research focuses in that area of analytical method development. So while there are lots of published studies which are looking at levels of microplastic in things like bottled water and the environment, we really do need to see some robust, reliable analytical methods specifically to quantify levels in food. And what that's going to do is give us a really good indication of, or a measure of, dietary intake or dietary exposure. And that's one of the key factors that we need, in addition to some more information around the toxicology. So we're able to set those safe levels of upper dietary intake that will then drive the standard setting process. So there's certainly globally a focus in the food space, but a recognition almost universally that there are some research needs there in that space.
In the food space, do you actually have regulation over the packaging and so on that food is presented
So
in?
the Food Standards Code does regulate food contact material, so that would include packaging. There is a general requirement in there that any food contact material must not contaminate food. So that's the extent of the regulation. I will add that in that contaminant standard that I've already mentioned, we do have the ability to set regulatory limits for individual packaging chemicals or plastic chemicals if there is a scientific need to do that. And our work that we've done, as Dr. Cuthbert said, through the Australian Total Diet Study, we've actually looked historically at levels of packaging chemicals in the Australian food supply. So that's food for retail sale, which is the remit of FSANZ. And those studies have shown consistently that levels are actually very low. So we haven't needed at that point to step in and set regulatory limits. But I guess there's always the potential for us to retest and to look more deeply at this.
So when
particularly,
you were testing, what were you actually testing? Sorry to interrupt you.
So we've tested for, excuse me, so things like phthalates, bisphenol A, PFAS, other packaging chemicals. So we did quite a broad screen of a whole range of packaging chemicals in the food supply, and most weren't detectable. And where we did find some low levels, when we put it through a risk assessment process, it didn't actually exceed those safe limits, those so-called health-based guidance values. So I will just add that work was undertaken a few years ago, and so I think there could be calls going forward to actually look at retesting, potentially picking up some of the newer chemicals as well. And we're probably a few months away from starting to plan our 29th Australian Total Diet Study, and we're already having conversations around, well, what are some of the chemicals we could potentially look at there as part of that work.
Go jump in. Just on that point, even though you're detecting very low levels or perhaps negligible levels, the issue that we're hearing is that these are chemicals that are accumulative, right? They're accumulating in us over a long period of time. So does your hazard analysis take that into account?
Yeah, certainly the behaviour of and chemicals and so will go not to the plastic particles per se, but the chemicals that potentially make them up. So as part of our standard processes, we're able to look at the potential of those chemicals to accumulate. And also coming back to something Dr. Cuthbert said, routinely we are looking at sensitive subpopulations such as children as well. So we're able to look at the data across different life stages. When we do our dietary exposure assessments, we actually look at the dietary intake of specific age groups across the population as well. So we've got a pretty well established mechanism for looking at these types of things. But obviously maintaining the connection internationally is critical because this is an emerging area and there's a lot of, as you know, a lot of research work going on, and we need to make sure that we're plugged into that.
Can I just ask a supplementary too? We heard from Dr. Munker this morning from Switzerland, who's part of the Food Packaging Forum Foundation. And in her evidence, she talked about the fact that there's 15,000 food contact chemicals, that she said there's more than, a couple of decades worth of evidence to say that we should be regulating in terms of food packaging. We also heard from the Australian Food and Grocery Council this morning, who I think made it fairly clear that unless regulations change, they're not actually going to change anything in their packaging. And we've also heard from scientific experts this morning who talked about the fact that, and I take your point that some of these chemicals are low, but that as consumers, we don't know what those chemicals are, therefore we don't have a choice as to whether we're consuming them. And we heard in previous evidence, I can't remember if it was Adelaide or Melbourne, the example, for example, of BPA and people buying plastic water bottles and containers that say BPA free, but what people aren't being informed about is but now it has BPF and BPS and the like, and so consumers are in the dark. So I guess my question to you is, should consumers at least be made aware that some of these food contact chemicals are in there, and are you aware of the work that Food Packaging Forum Foundation and others are doing and incorporating that into your work going forward?
Yeah, thanks for the question, Senator. I think, wherever there is new information, including from that forum, we're more than happy to look at it. I think that's our duty to have a look at that. In terms of the work that we've done, I mean, we've published, we're really transparent with publishing all of these studies and having the communication around them. I think the risk communication element of this is critical, as you've identified. So certainly it's, I guess important that we also keep bringing it back to, and this has already been raised so far in the conversation, the scientific evidence and the basis for potentially stepping in and setting regulations. We can do that where there's an acceptable minimum level of scientific information to do that, and that's both in terms of the exposure side, so we need to be able to quantify that pretty accurately across the Australian diet, and we also need to have good dose response information in terms of the potential adverse effects. So
I guess just from my perspective, like as a consumer, I'm not going to go and read all the studies that you're doing and the communication you're putting out, but when I walk in the supermarket and I've got a choice to buy product A or product B, and product A has food contact chemicals in it and product B doesn't, at the moment there's no way that I can make an informed choice as a consumer.
And you definitely shouldn't need to be trying to choose between product A and product B. That's definitely our remit and job to make sure that any chemicals within any of those products are safe, which is why we maintain monitoring the scientific evaluation. And so, for example, if there were 15,000 chemicals, we would then be working globally to figure out, well, which ones should we be prioritising, assessing and looking for, and how much is being transferred into food products, and monitoring to ensure that anything that you can buy on the shelf continues to be safe. And if it's not safe, we definitely have a role to step in and rectify that.
Well, I guess that the evidence that we seem to be getting from Dr. Munker this morning is that there are actually lots of chemicals that aren't being kept out of food packaging that should, and so maybe there's more work to be done in that space.
I thank you, Chair.
Sorry, I need to come back to you too, Senator Askew.
I think just to follow on from the Chair, and Senator Askew, our exposure to these chemicals in plastics is not just confined to health. It's coming at us from every direction. So it's almost like you need a multimodal model, right, to kind of factor your work into other types of exposures. And I think that's the piece that's missing here, because from your perspective, you're saying, well, it's very low, Australians don't need to be alarmed, and I don't want to alarm people, but in the context of our lives, we are getting hit with this everywhere. So what sort of advice or what kind of research or approach should we be taking to better understand Australians' exposure to these and risk to these chemicals holistically?
I think you raise a good point, and that's, we focus on the food supply, but there are other potential sources, and so how do we integrate the exposures? And so, there are occasionally situations, and it's all data-driven as well, so we need to have the reliable information to be able to do that, and I think we would do that if it was possible to do that, I guess, with the information that's there. So,
does biomonitoring play a role in that?
So,
well, we've had a lot of evidence from other experts who said that Australia doesn't have a national biomonitoring program, and that the value of those sorts of programs is that you can start to pick up those more cumulative impacts and start to target where information needs to come from. So would something like that add to the work that all of your organisations do?
We love evidence that comes from any source, so I'm not going to say that any evidence that's available wouldn't be useful. It's, the more evidence, the better.
Yeah, and it's a great question, but I guess with those biomonitoring, with the data, which is really, really useful, there's always that question around the sources or the routes of exposure. And so if we're trying to quantify, how much is coming from food, how much is coming from water, how much is coming from air, and then make some decisions about how to manage exposure, it's difficult to do with those biomonitoring studies. And even those studies themselves don't necessarily provide the kind of quantitative information that we need to actually set those safe levels of exposure.
All right, I'm going to go back to Senator Askew because we jumped in, so we'll go back to you, Senator Askew. Sorry.
I was just going to go further on down that path along the lines of, should there be some sort of labelling in regard to packaging? Is there something like that? Is that the sort of thing? When we look at food additives, that we've got numbers on the side of different things, is that where we need to be going to actually alert people to the fact that there are microplastics in either the containers that they're in or what's contained in the food? Is that something that we should be looking or heading towards?
I think our role, as I said before, is really to ensure that anything that is available for sale is safe. So if we started to create a limit, for example, then our evaluation would be assessing, all of the potential exposure points that people could be building up those amounts and making sure that over the course of their life, they won't be exposed to more than what's acceptable. So I still think our role is to ensure that there aren't things available on the market shelves that are going to be unsafe for consumption.
Okay. So one of the things that we've been looking towards is what sort of recommendations that we will be able to put into our report, which is obviously the outcome at the end of this inquiry. And there's a lot of evidence internationally that we think we should be looking at. There's a lot of suggestions that we will have been put forward from us. Is there anything in your specific areas that you would like us to be looking towards or to be asking other departments about to actually give some guidance so that we can have some sort of way forward at the end of this in regard to dealing with it? Because I know your requirement for evidence is great, but as we've heard, it's not actually that easy to do an evidence, some sort of trial where you haven't got exposure to any microplastics or plastics, because everybody in every day is going to be exposed to them, so you're never going to have a control. So there's got to be some way that we can go forward to be able to assess, provide you with the relevant evidence that you need, but also in the meantime deal with the emerging contaminants that are out there rather than just ignore it until we get to crisis point. So all three of you organisations can give us any feedback you like on that. Where do we need to go?
Thank you, Senator. One of the things that I've observed with the European system is the publication of a regulatory needs document, which helps provide the research community with areas that the chemical regulator over there considers would be helpful to their remit and the work that they're seeking to do. And reflecting on evidence that was given this morning, as well as the NHMRC before us, there could be an opportunity, whatever decisions might be made around biomonitoring and the like, having an opportunity to turn that then into information that informs the research community of the type of information that would help each of us do our jobs, I personally, in my role, think would be a useful thing.
Okay, good. Did you want to add anything, Dr. Ladd, or you agree? No. Okay, Dr. Cram?
No, we're evidence-based regulators, and the more evidence we have, the better we can regulate.
Fair enough.
And just to reiterate my earlier comments around the analytical methods, that will really support that quantitation of what's actually in food and support that risk characterisation more effectively. So I know there is a lot of work going on in Australia at the moment in the analytical method development space. A lot of that is not necessarily... it has an environmental focus. There's lots of different compartments that it's potentially looking at. But so for us, some good, robust, reliable analytical methods that will enable us to quantify microplastics would be helpful.
Okay, I'll let mine there so give you a chance.
I just have one question before I go to Senator Anandaraja. If I heard things correctly in the opening remarks, ACIS, you look at chemical by chemical.
We regulate chemical by chemical.
Sorry, you regulate chemical by chemical. Is it a similar approach for Food Standards Australia, New Zealand?
Generally, but if there is evidence that we have available to be able to combine chemicals together, we will do that.
Okay, and whereas APMVA, you do product regulation. So I guess one of my questions is, as a non-scientist, we're sort of hearing that we've got plastic products, be they containers, food containers, things we put on our skin, you name it, that contain multiple chemicals. Why is it that when it comes to pesticides, we want to know how they all interact together before we allow them to come to market? But with the other two, we're just doing chemical by chemical and not really considering what that means when they're all put together.
So I mentioned in my opening statement that they're the kinds of chemicals the kind of products that APVMA regulates are inherently of higher risk. So they are, they're designed to have impacts on biological systems, and so I think that's probably part of the reason why there is a separate product regulator for AVET chemicals.
I guess some of the evidence we're hearing is that we know they're high risk now, but we didn't know DDT was high risk in the beginning. So that's why I'm interested in the answer to this question.
Yeah, so in terms of industrial chemicals, the Australian framework is a risk-based framework as well, and it's designed consistent with the principles of the OECD, of which Australia is a member, and we have, as a country, signed up to an approach which is to create a regulatory framework in which, when there is the highest likelihood of harms, that the greater the data requirements for assessment would be. For us, though, I don't know if Dr. Krem knows how many AVET chemicals there are, but the number of consumer products, let alone all the other products used from the industrial chemicals that we regulate, is absolutely massive. I can't actually conceive of a single regulator being able to properly assess and regulate all of those products for the specific formulations, if I'm understanding your question correctly.
I guess it just seems a bit back to front, like someone gave some evidence this morning and they said if we knew what we knew about plastics when we first designed them and they were introduced, they wouldn't have got past the approval stage. And so I guess it's interesting to me that it's almost like we've gone, the problem's so big now, we'll just deal with the bits we can and we'll just have to live with the consequences of the rest. But interested in the answer to that question around food, particularly packaging and contact chemicals.
And this is in relation to the combined effects and mixtures, and I think I was going to comment that quite a bit of work has been done internationally around cumulative exposures and cumulative risks, and also mixtures as well. And generally those studies have indicated that unless a chemical has the same mechanism of toxic action in the body, then it's not necessary to kind of add them together, if that makes sense. Mm-hmm. So in terms of packaging, I'll go back to my earlier comments around the way the Food Standards Code regulates packaging chemicals, and which really is putting the onus on the manufacturer to ensure the safety and the suitability of that packaging material. So that's an important co-regulatory comment to make. Yeah. As I've said, we have the potential to establish regulatory limits for packaging chemicals where the data supports that. And equally, the packaging manufacturers, they're understanding that they're importing a lot of material from Europe and North America, where they have quite stringent standards around the use of packaging chemicals. And then there's also the role for groups like the ACCC and local authorities in terms of, potentially enforcing the quality of packaging material as well. So that's an important point to make.
Thank you. Senator Nandaraja.
Thank you, Chair. Are our food standards for packaging similar to the EU?
We don't have a specific packaging standard in the Food Standards Code. So if you went into the Food Standards Code, there is not a list of packaging chemicals that have been assessed or are listed. What we have, as I said earlier, is a general requirement that any food contact packaging material has to be safe and suitable, must not contaminate, and then it would be up to jurisdictional food regulators to enforce that potentially.
Does any jurisdiction have a food standard packaging code? Does the EU have one? I thought it did.
That's a good question. I'll have to take that on notice. I don't actually know. I'm sorry.
Okay. I don't know if any of you have read the Lancet Countdown. Have you read this paper that was published in the Lancet on microplastics? I'm going to suggest you read it. It's quite sobering reading. This is a top medical journal. And on food chemicals, food contact chemicals, it says that a systematic review of nearly 950 studies on plastic food contact materials reported that 40% of nearly 4,000 chemicals are released into food or food stimulants under specific conditions. More than 1,000, roughly 400 plastic food contact chemicals have been detected in humans of all ages. Migration of plastic chemicals into foodstuffs increases at higher temperatures and with longer periods of contact, which we know. Fat content, acidity of foodstuffs also influence the extent of release, as does serving size. And then paradoxically, it states that, in fact, children and infant food could have higher exposure to these chemicals than adult food just because of the surface area issue. So I just feel like there's a disconnect between this and what you've told us. But I don't dispute that, your is there a problem? What am I missing here?
Yeah, we can certainly, where there's a suitable analytical method, we can actually measure and look and do a risk assessment on that chemical.
I'll reiterate that, so what you've said isn't, I don't think that that's a disconnect from how we operate in Australia, and we are very connected to all of these international regulators who do the same thing. And as I'll go back to mentioning the Australian Total Diet Study, where we're regularly assessing how much of these chemicals are actually being exposed into the food supply and then being consumed. So there is a monitoring activity that we undertake to test how is that then playing out across Australia, to understand and then to decide, do we need to create limits and put any standards within the code to respond to that?
I think we're coming at this all the wrong way. Can I just be completely frank? Because I think that trying to prove causality or harm, it's just too hard with something like this. We have heard that there's a dearth of data in Australia on longitudinal human data. We just don't have those studies. And if we were to wait 25 years, one generation, we know that plastics would have gone from around 200 megatons or 400 megatons now to nearly 1 billion megatons. So in 25 years, that's what this Lancet paper tells us. That's the trajectory. It's exponential increase. I guess my question is, if we were to take a more precautionary approach to food packaging, what would those principles look like in terms of the harms we're trying to prevent? And then the onus falls onto the producers to kind of stick to those principles. Have you thought about that sort of paradigm, or has anyone thought of that paradigm?
Yeah, thanks for the question, Senator. It's a good question. I think, as I've said, the onus is always on the packaging manufacturers to make sure their product's safe and suitable. I'm sorry, could you repeat the question?
It's a different, you said the onus is on the packaging, to prove it's safe, but I think the question is safety is very difficult to prove with the current tools that we have. And in Australia, it's really, the data is scant.
Yeah. I think coming back to what Dr. Cuthbert had said in her opening address, the system for setting food standards and for analysis is risk-based. It's not present-based. So presence doesn't necessarily mean problem. That analysis of what's present is critical. But we need to then look at how much people are eating. So that's looking at what foods things may be present in, what are the dietary consumption patterns across Australia, and then being able to compare that intake, that dose, with some kind of safety limit. There needs to be some type of comparator there. And so this is where this dose-response relationship information is important for the critical adverse effects. I guess in setting those so-called health-based guidance values, they are set on the most sensitive adverse effect relevant to humans, to be protective of humans. So the idea of a precautionary approach is difficult to practically implement because of the lack of information. And as I said, it's risk-based, it's not hazard-based. And so I think what you're maybe talking about is a hazard-based approach, if I'm not mistaken. And what I'm talking to is the fundamental risk analysis paradigm that is used globally in this space. And so how a precautionary approach doesn't fit neatly into that paradigm.
Right. Okay, I think that's
hopefully that makes sense.
Yeah, I think it does. I think that's the nub of it, isn't it? That all these papers are calling for, experts after expert are calling for a precautionary approach, but our regulatory paradigm is not a match for that. Do you have any thoughts on how it could become a match for that?
That's a huge policy question, and I'm not sure that we can offer much there.
I mean, there's a lot at stake here. We're hearing about in utero transmission, blood-brain barriers being breached, microplastics in every organ in the body, early onset cancer, dementia, insulin resistance. I mean, it's a list as long as my arm, Low birth weight, very low birth weight, which has been persistent in First Nations communities who are also exposed to high levels of plastics. I mean, the list just goes on. IVF success rates not moving in 30 years, fertility falling throughout the world, and we are getting pummeled with more and more plastic. And I really would love you to think of how we should better regulate and what you need for us to put the onus on the producers to keep our people safe.
I might take that as a comment.
Yeah. Okay, one last question. Just on the topic of fertiliser, Can you just comment, Dr. Cram, on whether microplastics are an issue in fertilisers used in Australia? Because there's been a lot of commentary overseas around this issue.
So we regulate fertilisers, the APVMA regulates fertilisers that make a claim around enhancing growth promotion. Most of them don't actually fall within our regulatory remit. If it's a plant hormone that's added to the fertiliser, then we do a risk assessment, but it's focused around that plant hormone and the action of that plant hormone and so our risk is more focused around the chemical there that has the agricultural or veterinary impact.
And in other circumstances, the ingredients of those other fertilisers would be treated as industrial chemicals and come through ACUS. As I've stated before, though, our ability to consider microplastics in finished product doesn't exist.
So how would we have to help compel you to consider it? Would that have to come from the government or from someone else?
The law
would
have to change, but I think there's quite a policy consideration required. I wouldn't see it as simply giving up our. There's the relationship between our legislation and other parts of the regulatory framework.
Which, you have to forgive me, which act would we have to look at to amend?
ACUS operates under the Industrial Chemicals Act, but if we were being asked to consider a microplastic in a product that we may know very little about, that would principally be the challenge. If the fertiliser was being produced by 9 out of 10 components were already authorised and we were being asked to assess a new 10th, that would be our assessment. It wouldn't be of the fully formulated product. So that's fundamentally perhaps where your question is going, whether industrial chemicals should be ingredient or product based.
So who is that your job, Dr. Cram? If it was, the final product using agriculture and it was potentially contaminating the soil food chain with microplastics, is that in your purview?
So only to the extent that the fertiliser makes a claim about being an agricultural veterinary chemical. Otherwise, it doesn't fit into our regulatory remit. The states and territories set limits around things like heavy metals in fertilisers at the moment.
So there's a regulatory gap here by the looks of it, a blind spot around microplastics by the looks of it, in fertiliser particularly.
We look at the whole product when it falls within our remit. We look at the whole product, and if the microplastics were, if plastics in that product were something that we considered to be a risk, then we can ask for information around those sorts of things. But as I said, it's only those that fall within our regulatory remit that we look at.
And your regulatory remit does not have microplastics in it, is that right?
It's product-based, and it depends on the claims that are made in the product, and so most fertilisers don't fall into the category of being an ag-vet chemical.
Okay, I'm going to take that as that being a blind spot. Thank you.
Thank you very much to all of you for coming along and giving us your evidence this afternoon. The committee will be reporting to the Senate on Wednesday the 26th of May 2026 and has agreed that responses to questions on notice should be provided by close of business on Wednesday the 15th of April 2026. We're now going to suspend for... I think this is wrong here, sorry. We're going to suspend for 10 minutes and we'll resume at 3:22 p.m. Centre for Disease Control and the Department of Health, Disability and Ageing. Thank you very much for appearing before the committee today. The Senate has resolved that an officer of the Department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. Commonwealth officers appearing today are also reminded of the Senate order specifying the process by which a claim of public interest immunity should be raised, and a copy of the order is available from the Secretariat. For the Hansard record, if I could each ask you to state your full name and the capacity in which you appear today, and I might actually start with Professor Kidd online. I'm going to pause on Professor Kidd. I'm going to come to the people in the room and then we'll come back to online. I'll start on my left.
Thank you, Senator. Rajan Martin, Assistant Director General, One Health Climate and Environment Branch, Australian Centre for Disease Control.
Professor Zoe Weiner, Director General for the Australian Centre for Disease Control.
Emily Harper, Deputy Director General, Public Health Division within the Australian Centre for Disease Control.
Thank you. And now we'll go to Professor Kidd. If you could just state your full name for the Hansard record, Professor Kidd, and the capacity in which you're appearing.
No, we can't hear you.
No, you're on mute, Professor Kidd.
You're on mute.
I think we might still have an issue.
It does look like it's on mute. Yeah, it's good.
It looks like Professor Kidd's on mute, but I'm not sure if he can hear us.
I suspect he can. Oh, it's got the little red... There he goes. He's got it now. It's not working.
I might just... to the folks from the CDC, do you have any opening remarks this afternoon? How about we make a start and then we'll come back to Professor Kidd. Over to you.
Thank you very much for the opportunity and the invitation to be at today's hearing. As stated, I'm Professor Zoe Weiner, the Director General for the Australian Centre for Disease Control, and I would like to acknowledge the traditional custodians of the lands on which we are gathered and pay my respects to elders past and present. The role of the Australian CDC is to provide public health advice, synthesise evidence, support horizon scanning and help promote nationally consistent interpretation of public health risks. We complement rather than replace jurisdictions and other Commonwealth agencies. Our job is to provide government and the public with careful, considered and evidence-informed public health advice. The CDC does not regulate plastics or chemicals, and we do not set standards for their presence in food or water. Microplastics are a real and emerging environmental health issue. They are widespread in the environment and exposure can occur through multiple pathways, including inhalation, ingestion and contact with consumer products and medical products. Community concern and public interest in this issue is understandable. At the same time, the current evidence base remains limited. In particular, there is insufficient epidemiological evidence at this stage to confirm causal links between microplastic exposure and adverse human health outcomes. The detection of microplastics in human tissues or fluids does not on its own demonstrate harm. Much of the available evidence comes from laboratory and animal studies, which are important but cannot be directly extrapolated to real-world human exposure. There are also significant scientific and technical constraints, and these include uncertainty in exposure measurement, confounders not controlled for, variability in analytical methods, and limited dose response epidemiological data. This is not a circumstance that is unique to Australia. While some jurisdictions have introduced targeted controls and monitoring requirements, no country has established enforceable health-based limits for microplastics across exposure pathways. In this context, the Australian CDC supports a proportionate and precautionary public health approach that includes ongoing evidence review, monitoring, transparent public communication about what is known, and coordination with jurisdictions and relevant agencies as the science and understanding deepens. The CDC has also taken practical steps to strengthen the evidence base. Earlier this year, we published an open tender to support a biomonitoring pilot study to better understand feasibility and assess approaches for potential future biomonitoring arrangements. Biomonitoring refers to the measurement of chemicals in human body fluids and tissues such as blood, urine, breast milk, saliva and hair. Biomonitoring measurements provide an estimate of the amount of a chemical absorbed into the body from all pathways of exposure, for example, ingestion through drinking water, inhalation of air, and thus give a cumulative estimate of the chemical burden that a person carries in their body, sometimes referred to as a body burden. Biomonitoring can identify differences in exposure among groups within a population and can identify changes in population exposure over time. Biomonitoring is frequently an important element of epidemiological research that seeks to determine whether chemical exposures are associated with adverse health effects in humans. We're also finalising an evidence review commissioned by the interim Australian CDC last year on the potential health effects of microplastic particles, and we expect that review to be published shortly. In closing, the Australian CDC recognises microplastics as an issue of increasing public interest and concern. Our role is to assess the evidence carefully, communicate clearly about what is known and not yet known, and work with other agencies to support a proportionate public health response as scientific understanding continues to mature. Thank you, Chair. I'm happy to answer the committee's questions.
Thank you very much, Professor Weiner. I'm going to have another go and see whether we can hear Professor Kidd.
I can hear you, Senator. Can you hear me?
We can, loud and clear. So if you could, for the purposes of the Hansard, just state your full name and the capacity in which you're appearing today.
Thank you. Professor Michael Kidd, AO. I'm the Chief Medical Officer for Australia, representing the Australian Government Department of Health, Disability and Ageing. Thank you, Senator.
Did you have any opening remarks, Professor Kidd, or do you want to go straight to questions?
Happy to go straight to questions. Thank you, Senator.
All right, thank you. I'm going to start with Senator Askew.
Okay, thank you very much and thanks for your time this afternoon. And I'm sure you've been listening along to the different hearings that we've done in this space, and it's been quite a journey because we've heard a lot of evidence that has given us rise for concern, but also the clear understanding that we haven't got the research in place that we need. And I just noticed from your opening statement, Professor Weiner, that that's what you will need to be able to progress by the sound of it, which makes it really difficult when we've had evidence that we've got nowhere that within Australia especially, but anywhere really in the world, that you won't be able, to be able to do the studies that require you to have somebody who's never been exposed to plastics or microplastics. So how do we go about that, getting the correct evidence that you require? And also, do we take into consideration the international research that is being done? So if we start with the research and then we can go from there, probably Professor Kidd might like to add something to that as well. So I'll start with you, Professor Weiner.
Thank you very much. So obviously the biomonitoring is a key first step in that process. Then the ability to potentially data link to health outcomes would be an additional step that would help us understand the harm further, whether there is harm, and if so, what the correlation between the potential levels and the outcome might be.
So how would that look, that data link to health outcomes? So how would you be measuring that?
Senator, I think one of the ways recognising the earlier references to biomonitoring really being that population level resource, the opportunity to track over time people's exposure and the accumulation of that exposure, and then the potential to link that with perhaps other health information sources that will allow then for some of that epidemiological analysis. So at first it may appear as association, which we're hearing a lot about in these hearings. And obviously that then, we would hope, assists in really targeting some of the additional research that would be required to areas where we might be seeing, higher association that would warrant, further research or more targeted research over time.
Just on the biomonitoring study that you talked about earlier, how significant is that? What sort of numbers are we looking at with regard to that study?
At this stage, Senator, it is a pilot study, so it is relatively small in nature, and a lot of the focus here is really about exploring and better understanding some of the most effective and efficient ways of conducting biomonitoring in the Australian context. So whether or not that's looking, for example, at using discarded samples, or what sort of information or products or materials might already be readily available. So it is a pilot study at this stage, so it is unlikely to give us the sort of population level side of things. But the importance of the pilot is that it informs future deliberations as to what a future biomonitoring program may, should, could look like.
And what sort of timeframe has been factored into that to come out with the recommendations?
The understanding, I think, is that the pilot would be conducted over a 12-month period.
Yes, 12 months, Senator. So we're just in the process of completing the tender evaluation process. So we went through an open tender process. And yeah, we haven't yet selected a preferred provider to undertake that.
So within, say, by the middle of next year, we would be looking to have some sort of indication on how we're going to introduce a biomonitoring or the value of doing that. So that's the outcome?
Well, subject to the timeframes that we need to go through to assess the applications. But I think, in a ballpark sense, Senator, yes, that would be a reasonable estimation.
Okay. Professor Kidd, did you want to add anything on the research side of things?
Yes, I did. Thank you, Senator. Look, I really welcome this inquiry because I think as you've been receiving submissions and listening to witnesses, there perhaps have been more questions than answers, and of course that can be very frustrating and lead to further concern. It's absolutely essential that we continue to build the evidence base, and this inquiry, of course, helps to focus our attention. It's also really essential that we in Australia contribute to the global research that is happening around this really important issue. And of course, we're not alone. This is a global challenge. And just one other element about the types of research. We're likely to find more solutions through this research by having researchers from different disciplines and different paradigms coming together to look at the work that needs to be done and to sharing insights into some of the potential solutions. I do think that investments that we're making here in Australia, like the work that the Australian Centre for Disease Control is undertaking in biomonitoring, is going to help us to better understand both the risks but also the potential solutions.
Thank you very much. And we have heard evidence from Minderoo as well, who are doing some quite extensive research in this space as well. So I would imagine that you would be across the work they're doing as well. And,
yes.
So are there plans to develop public health guidance on the health risks of environmental exposures such as microplastics?
So, Senator, the N-Health Committee, which sits under the Australian Health Protection Committee, which Professor Kidd chairs, does have that broad remit around assessing environmental risks. And so, for example, on biomonitoring, that is something that the Australian CDC has worked with N-Health in exploring some of those, particularly feasibility questions. So I think one of the challenges in the microplastic space is that there's a lot of heterogeneity in terms of what's within scope, whether it's the actual microplastic itself or some of the chemicals which are absorbed by the microplastic. So I think there's also a piece of work in terms of clarifying the specific questions to be addressed, but that broad remit around environmental health analysis, looking at risk, looking at implications, is something that, does sit squarely within the remit of N-Health. And sorry, I should say that committee comprises representation from both the Commonwealth and all the jurisdictions and heads of environmental protection agencies, for example. So it is quite broadly based.
Okay. Did you want to add anything on that, Professor Kidd?
Yes, thank you. Again, the outcomes from this inquiry will help to inform the work that the N-Health Subcommittee, the Australian Health Protection Committee, has underway. Through that committee, we're certainly not ignoring the potential harms that can come from micro and nanoplastics and the risks to human health and the need to adopt the precautionary principle, which I know many of your previous witnesses have spoken about as well.
You've just read my next question.
Sorry.
As I said, I'm reading some of Senator Ruston's questions as well. So many submitters to the inquiry have called for a precautionary approach to responding to the emerging evidence. Would you agree with it? And what are the risks of delaying action? So waiting till the middle of next year just to see whether we should be implementing a biomonitoring program. It's just, is that a delaying situation, or is that prompt action?
Thank you, Senator. We do support the precautionary approach. We do think it's really important to have the causal evidence of harm. There are risks of taking action if the harm doesn't exist, because you can, of course, create uncertainty for community if you don't have the evidence, which is why we are supportive of the precautionary approach.
And I think, Senator, just acknowledging, as was noted in the CDC submission, that there's also work around evidence review. So that's something that we're actively looking at to try and compile both any Australian evidence but also evidence from overseas to better inform our future approach.
Do you want to add anything, Professor Kidd? I don't want you to miss out.
No, I'm happy. Thank you.
Can you outline the international approaches to this issue and whether any lessons can be learnt from them? Because obviously there is a lot of research, as we've mentioned, going on. Is there anything that we can be learning from them now?
I think, Senator, to note, as acknowledged, I think broadly throughout the inquiry, much of the focus internationally really has been on that sort of environmental side of things and focused regulation in that space. There is a lot of work, and we certainly are engaging and monitoring really closely with our international counterparts with respect to, methodology, measurement, but it is particularly challenging because these are everywhere, and there are many different types of plastics. I think sort of 16,000, different chemicals that may or may not be involved. So I think this is an area of focus, but there is a degree of inconsistency in approach. So I think we're all very consistent with the interest and attention that is rightly, being directed to this particular issue as the evidence base grows. And I think there's an enormous amount of work and collaboration and opportunity in that space. But it would be fair to say that there are different approaches being taken throughout the world, and that includes to the measurement and study of things. And that's one of the key things that we need to work together to harmonise, to allow us to really compare some of the different data sets and studies around the world.
So some of the detection studies that are ongoing, looking at detecting microplastics in lungs, blood, liver, kidney, placenta, amniotic fluid, breast milk, urine, ovarian follicular fluid, semen, tumour tissue and bone marrow, and they're being contributed to by Italy, Spain, China, the US, UK, Poland, Austria, Canada, Singapore and South Korea. And then, of course, the WHO and the UN are also undertaking both coordination work across multiple nations.
And the evidence that's gathered from overseas, is there resistance in Australia to actually align that and use that as the evidence base for us to make policy, or do we need to then do further studies in Australia?
We're very happy to take robust international evidence. That's part of the CDC's role, is to synthesise the evidence that exists across the world and bring that to Australia, but there are still gaps in that international sphere as well.
Okay. How can environmental exposure reduction best be achieved based on current evidence? What steps should we be actually taking now to try and reduce exposure?
I think it's very challenging, and Professor Kidd may also have some thought, thoughts to offer on this. We know that it's ubiquitous, so it is very, very difficult to avoid exposure, but we do know that there are some ways in which exposure can be reduced, and I think we've heard about that through some of the inquiry with references to things like plastic water bottles, single-use plastics, and the heating of plastics and the extent to which that impacts things. So I think a key role for the work that Mr Martin was also referencing earlier on is working with our state and territory colleagues, with our NHealth committee, Professor Kidd and international people, to really distill that evidence into practical advice for people that really is precautionary. So we don't want to be overstating potential harm here when the evidence is limited. But it's about taking that balanced and pragmatic approach for those people who may wish to, take those additional steps in there.
So, Professor Kidd, is there work being done on that from an educational perspective for the community?
Yes, there is. I'm not sure if CSIRO was among the witnesses that were called to the inquiry, but CSIRO has produced advice on limiting exposure to micro and nanoplastics, and can share that advice with the committee if it hasn't been included in evidence already. As Ms Harper says, the uncertainty is not an excuse for not acting when we have the potential for significant human harm. So these precautionary measures about how to reduce potential exposure through ingestion, through inhalation of microplastics is important, and there is advice that's out there already, and Ms Harper's mentioned some of those measures.
I think, Senator, for the broader approach to plastics, there is that almost hierarchical approach from prevention right through to disposal. So what we've seen through some of the international evidence is some countries moving where possible to reduce as high up in that hierarchy in terms of preventing downstream risk.
I think reduce consumption, or what do you mean by that? Reduce import of plastics?
I guess source reduction of plastics is...
That's certainly the evidence we've been hearing. So with all of that, should fertility and pregnancy be prioritised in this area? It's one of the terms of reference is looking at specifically in that area. Is that something we should be prioritising even in the advice to families, potential families?
So I think that's been acknowledged in some of the evidence that you've heard and submissions that we've certainly looked at, and I know some of the colleges, for example, have highlighted that in terms of particularly at-risk cohorts, and even the earlier discussions in terms of exposure over the life course. So I think it definitely would be reasonable to look at higher-risk populations.
Okay. Is that part of what the Professor Kidd, in regard to the CSIRO documents that you were talking about, is that part of what they've included in there for the fertility and pregnancy aspect?
Yeah, I don't recall that being part of it, but I may be corrected. But it's obviously an essential area. A lot of the global research has been looking at impacts on fertility for both men and women, the concerns for the unborn fetus, but it's just one of the health impacts. And of course, we also have risks of cardiovascular disease, risks of endocrine disease. I met yesterday with representatives from the Gastroenterological Society of Australia talking about risk for inflammatory bowel disease and malabsorption. So there are many potential health risks which have been outlined, and huge scope for further research to build up this evidence base. The other concern, which I expect you've had testimony about, Senator, is for those people living in communities which may be at greater risk of exposure to environmental contaminants, which includes the plastic waste as well.
We have, thank you. And my final question is just around coordination. So this is something that impacts so many departments, so many organisations. What sort of coordination would go on to actually address this? How do you work together to sort of, between environment and health and all the different people that come together to try and address this? Is there some sort of coordinated task force? Is that something that would be necessary?
I think there's definitely an opportunity for, and indeed an imperative to ensure that we are very closely aligned. We do have existing governance mechanisms. We've spoken about NHealth. We, of course, do, as all government agencies, and, you heard from colleagues earlier, work together and engage and share information. And that obviously feeds into fostering a greater understanding of risks and factoring into the sorts of advice that we might seek to provide.
Okay. Thank you. Unless Professor Kidd has anything further, I'll pass it.
As well as the Commonwealth agencies coming together, of course you had a number of the Commonwealth agencies earlier today, NHealth also brings together the states and territories, and and some of the states and territories have produced advice. I know Western Australia has some very clear public advice which has been published through their website, and so it's an opportunity for us to work together across the country as well.
Okay, thank you. And to the Chair.
Senator Nandaraja.
Thank you. I just want to go back to collaboration, because I think, we need a kind of coordinated system level approach to this problem, right? And Australia's a little bit late to the party as far as research goes. I mean, we'll get there, but there are other countries that are far more advanced, particularly the EU. And I just, I think that I just want to understand your appetite for collaborating, for example, with Health Canada, Minderoo, EU through Horizon Europe with existing programs that they've got going there, your CDCs throughout the world in kind of tackling this problem. And the reason I think that international collaboration is so important in this space is that we're up against, and this is coming from the Lancet Countdown paper from last year, we're up against a fossil fuel lobby that intends to basically redirect more oil into plastics and petrochemical production. And the graphs are truly terrifying. I mean, you've seen them. They are an exponential increase in plastic pollution over the next 25 years. And so I just was keen to better understand how much of an emphasis you're putting on international collaboration and the research that's already being done, rather than us having to reinvent the wheel.
Thank you for the question, Senator. We are deeply committed to collaborating across the globe. I think public health measures of all sorts benefit when nations collaborate together, and that's in the DNA of the CDC. We'll be to partner and collaborate. We don't want to be reinventing the wheel. We absolutely want to be learning from the best around the world.
Fantastic. And again, just to go back through just a point that Senator Askew raised, your priority populations, do you have a sense of which ones you might be looking at in terms of human health impacts? We've talked about maternal and child health. That's obviously a big one that's come out.
We know that for a number of environmental health issues, there is a clear relationship between things like socioeconomic status and exposure to risk. So, for example, First Nations communities would be a group that would be particularly impacted as one example. But I think that broad approach around looking at the relative risk of different cohorts and having that as a key focus around directing our efforts is important.
With regards to your horizon scanning, wouldn't mind just hearing more about what that looks like in terms of, I guess, international developments, but also locally. There is a fair bit of work being done in other kinds of domains. And I speak particularly of the birth cohorts that we already have in Australia. Like we've got the Geelong cohort, we've got the Gen B cohort, massive cohort in Victoria. And whether you think there's a role for the CDC convening these groups and, with a bit of additional funding, if need be, from NHMRC and other bodies, using what we already have established in Australia to help advance the evidence base.
Yes, we have a very high appetite for leaning in and supporting from that perspective. I'm aware of some of those biobanks, which are extraordinary data sets and assets that the nation has that would seriously help us in understanding this problem in greater detail. And I'm certainly aware of Gen V, and they have an extraordinary asset that they've built up that I think will be very helpful, and we'd be very happy to coordinate that if it was useful.
I'm a little, I guess, concerned about waiting for an evidence base to build up before we actually act and recommend some controls in this space. One, because of the fossil fuel lobby, right? The second is that we have some associations, let's call them, between microplastics, the chemicals associated with them leaching into our body, the forever nature of them once they're inside us, and a whole litany of health problems from cradle, from in utero to grave. So I'm just wondering, and I cite things like lead, mercury, tobacco, asbestos. Right? Asbestos, the ozone hole. we didn't have completely, a full picture with each of these before we regulated and we intervened, but it really took a long time before that happened. And we are already sort of 60 years into this journey with microplastics. We know that there's this exponential increase coming. What kind of controls should the committee start thinking about right now in order to put downward pressure of plastics in our environment?
So I think I'd probably go back, Senator, to some of the, yes, appreciate that it will be some time before we have a very, very clear picture about potential harms here. But I think we would seek to see a greater convergence between some of the human health, the animal health, and some of the studies that are currently published to help us form a greater view on what our advice would be from the CDC's perspective. As Professor Weiner referred to earlier, the role of the CDC here is really in formulating that advice and synthesising and communicating in that evidence-informed way. Regrettably, we don't have some of those levers. It's not the role of the CDC to oversee some of those more regulatory levers.
I think, Senator, we are aware that there are various studies underway, including I think 3 that do look to explicitly link microplastics exposure to health outcomes. So it's not the case that there's nothing in train. So that's something that we're very, very focused on in keeping an eye on those things as they progressively report over the coming year.
I don't want us to get to the end of this committee and all we say is we need more research, right? I mean, I think that's a given. That's self-evident. I think what we are trying to get at as a committee is, well, we know 90% of our plastics are imported. What kind of controls do we need to put in place to reduce the flow, given that we can't get a global treaty off the ground yet, even though Australia supported it? How do we catalyse bioplastics or alternatives to plastics, particularly for food packaging? And we just heard from the regulators before, and there's clearly gaps in their regulatory framework. So it would be, I don't know, is the CDC, could the CDC, in your wide remit, could you perhaps look at some of those areas? Is that something that you could do, or would that have to come from us?
Perhaps not directly answering your question, Senator, but I think just recognising the breadth of different portfolios involved. So even in the regulatory space, we have in the agriculture side, in the health side, in the consumer regulation, industrial chemicals and so on. So there's even just in that subset, a very broad range of portfolios. I think similarly if I understand the sort of broader question around plastics and potentially reducing Australia's either import or utilisation, again, that's kind of spread across a range of areas. The environment portfolio has a key role in plastics policy. So there's certainly things that the CDC can do, but I guess it is within that fairly complex and broad context of other stakeholders.
And Senator, I appreciate it's still a delay. It's not necessarily an urgent action, but I do believe that biomonitoring is going to give us some really clear guide rails as well about where we would and should be looking and thinking about from that perspective in terms of what is accumulating in the various components of people's bodies.
With your biomonitoring pilot, you might have mentioned this earlier, what's the population that you're looking at? Is it cross-sectional, all age groups, or is it sort of targeted?
I think it's more less around potential participants and more around some of those methodological questions, including feasibility of different approaches.
Okay.
That's about, is that looking then at specimens that have already been held and just using what's already held in biobanks and things like that? So will you actually be accessing them, or you'll just be reviewing whether that's an opportunity to do future biomonitoring?
I think primarily on the feasibility side, recognising that I think as Professor Weiner and others have said that there are a range of other biobanks that are in existence.
Okay.
I have a question.
I'm sorry, I interrupted as it was.
No, it's fine.
I have a question and then I'm happy to go back to you. I guess just listening to the evidence over the last few days, it seems to me that, like as you've said yourself, like this is ubiquitous. It's everywhere. We've got evidence that it's now in all of us. And I guess sitting here, I'm interested to know what the level of priority is that's being given to it, because it would seem to me that if we're wrong and we're all going to be totally fine full of plastic, then we've got nothing to lose. But at the same time, if in fact this is causing the sorts of things that the evidence is starting to suggest it's causing, then this is a potentially massive health problem. And so I guess I'm interested, from me as a non-medical person, I'm kind of sitting here going, I reckon this is something we need to be looking at pretty quickly, because if in fact it's contributing to strokes, contributing to heart disease, contributing to type 2 diabetes, autism, epigenetic changes, like which the evidence is starting to suggest it may be, that's a massive health burden down the track, in addition to the personal health costs that puts on every individual. So I'm interested to know, I guess, where in the hierarchy of priorities does this issue actually sit as far as the Health Department and the CDC go?
So from the CDC's perspective, Senator, sorry, go ahead.
No.
From the CDC's perspective, it's a very high priority, Senator. So we do have the evidence review that Mr Martin referred to earlier, which will be published very shortly. We've also, we do have the biomonitoring pilot. We are very actively engaged with monitoring and information sharing and understanding what is going on internationally, recognising that there is an increasing interest in this and increasing activity. And it is actually, it is really quite a groundswell of activity around the world. So it is a really significant priority, Senator.
Yeah. Professor Kidd?
Yes, similarly for the department, Senator, this is a serious public health concern, which is why it's on the agenda of the N-Health Subcommittee, the Australian Health Protection Committee. To Senator Anandaraja, I hope the inquiry does say that we need more research, even though it perhaps is a given, because the research is so important. I know you referenced the Lancet countdown report earlier on today, where again, the authors talk about the need for more evidence about the impacts on human health, and this is why the precautionary approach is so important, and looking at what we can do both at a global level to reduce the environmental impact of plastic pollution, which is a very serious global health challenge and which then, of course, contributes to this, but also what happens at a local level and what can we do to reduce the potential ingestion and inhalation of these products.
Can I just ask one question, then I'll go back to you, Senator. Professor Kidd, you mentioned, I think it was WA Health has some advice around microplastics and nanoplastics. You mentioned CSIRO. Do we have, at this point in time, noting, as you said, that it's early days, but it is an area of concern, one of the things that we heard from a number of submitters last week when we were hearing evidence is the fact that right now there isn't a trusted source that people can go to at least find what the early evidence is suggesting that they should avoid if they want to take a precautionary approach. Is that something that the CDC and or the Department of Health is looking at providing?
Yes, it is. So international horizon scanning and translating that evidence into information that the community can find helpful is a key role for us, and that is one of the focuses in looking at the microplastics.
Mm-hmm. Would we be able to take on notice just any, like you noted those two sources, if there are any other current sources available that you're aware of in this country, that would be helpful.
Just to follow on from the Chair's comments, the US CDC used to have some really terrific some evidence on its website, fact sheets, not only for lay people but also for researchers and clinicians. Is that something that you're looking to emulate as well?
Yes, providing the evidence to the community as well as to clinicians and the broader public health system is a key component of our role.
That is fantastic, genuinely. The second is just within your remit. I think that there's a really important role here for citizen science. And, you know, we've just come out of National Science Week, where one of the scientists on the panel said, you know, science is for everybody. It's all inclusive. And we have 27 million people in this country. They're absolutely invested in their health and their environment. And I wondered whether what thinking the CDC is doing around activating our general population and kind of mobilising them a bit, because at the end of the day, yes, politicians lead, but sometimes we need to follow. And, you know, it takes a civic movement to kind of enable us to make tough decisions. And I'm interested to know what kind of engagement you're doing with the Australian people.
Senator, as you would know, we stood up on the 1st of January.
I know. It's early days.
But key to our remit and the role of the CDC is to build trust with community, and we can't do that without working directly with community and understanding those concerns and what they are. So whilst it's early days, again, it is key to the remit of the CDC and is a priority for us.
Yeah. I would urge you to speak with the Professor Palanisamy, who was honestly a pioneer in the study of microplastics in Australia, and he mobilised, I think, 5,000 odd people, including children, as part of a citizen science project and I guess movement, and helped bring microplastics, you know, to the fore in Australia. So we have some terrific scientists. I think health scientists are fantastic, but let's not forget the environmental scientists as well. They are, you know, they're probably the ones with the real expertise because they've been doing this for such a long time. Thank you very much.
Social scientists we also find really important areas for us in that multidisciplinary approach.
Yeah, wonderful. Thank you.
Thank you.
Do you have any more questions, Senator Askew?
I'm done. Yeah.
Okay.
Thank you.
Well, look, thank you very much for giving us your time. It's very much appreciated. It's been very interesting hearing about the things, particularly that the CDC is looking to do in this space. And I think that, you know, we've learned a lot from this inquiry, and it's good and to hear that it is a priority, and I guess we're going to be pushing along to keep it there. So thank you very much.
Thank you.
Thank you, Senator.
I have words I need to say because we're done. So thank you for your evidence today. The committee will report to the Senate on Wednesday, the 26th of May 2026, and has agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026. And I'm going to say a lot of things again. That concludes today's hearing. Thank you to all witnesses who appeared and to Hansard and Broadcasting for their assistance. Thank you very much to the Secretariat for the work that you've done to get us ready for this and to organise it. The committee will report to the Senate on Wednesday, the 26th of May 2026, and has agreed that responses to questions on notice should be provided by close of business on Wednesday, the 15th of April 2026. And the committee now stands adjourned. Thank you.